Hello and welcome to the Giant Health Event 2020. This year, we're very proud to bring you nearly 400 speakers from around the world in our big annual healthcare technology event. According to the Financial Times, the Giant Health Event is the largest, most valuable gathering of everybody around the world who works in healthcare, tech, and innovation. So we're very happy to welcome quite literally many tens of thousands of people from around the world who are dialing in to participate in our annual event. My name is Barry Shrier. I'm the founder of Giant, and I'm also very proud to introduce you to my colleague, my co-founder, Professor Shafi Ahmed. Hello, Shafi.
Hi, Barry, and thanks for the intro.
Pleasure.
I'm really excited by the next couple of days, Barry.
Thank you, Shafi. If you'd be kind enough just to introduce yourself and tell us very briefly a little bit about your background and what you're up to these days.
Yeah, so I'm a surgeon based in London, working at the Royal London Hospital. And in my spare time, I've been involved in, I guess, the world of health tech innovation and digital transformation. Spending a lot of time, not just in the UK, but around the world, trying to figure out some of the mysteries and find solutions that healthcare needs to support going forward. And this giant mission that you set up, Barry, back 6 years ago, it's been a great vehicle and a great tool for people to come together, to collaborate, to talk, to innovate, to discuss new ideas. And it's been a great, I guess it's nurturing the mindset of the future healthcare professionals.
Excellent. Shafi, thank you very much. And obviously, we're extremely proud to have you on board as our chairman and also as the master of ceremonies for the main stage at Giant. So just to follow up with Shafi's introduction and background, once again, my name is Barry Shrier. I'm the founder of Giant. My personal background is as an international technology entrepreneur. I've been lucky enough to develop and scale and launch successfully international technology businesses in the telecoms industry and in the clean tech sector. And luckily enough to have built up a group of 5 international engineering businesses in the clean tech industry. And we had a big entrepreneurial exit about 7 years ago. That led me to a personal family experience, which I found quite impactful in my career and in my journey. I had a lot of free time after I sold my group of businesses, and I was lucky enough to spend time looking after my father, who at the time was 91 years old, and my mother was 87. And for anybody who's had that type of experience, you cannot help, of course, but to engage extremely heavily with the healthcare industry when you're looking after a 91-year-old. So, of course, with my father, age 91, we had visits from doctors and nurses to our house quite literally every single day. It was embarrassing, but we were on first name terms with all the ambulance drivers in our town. And I just literally absolutely fell in love with the healthcare industry. And my father passed away, but he was 92 years old. He had a long life because of healthcare. He lived very comfortably without any pain at home because of healthcare. And that had this profound impact on me. And that's the origin of my absolutely passionate love affair with the healthcare industry. So this led me to found the Giant Health Event and Giant as a business. And I was lucky enough to meet Shafi very early on, 6 years ago. And in discussions with him, we realized that, of course, there's some very big challenges for the healthcare industry around the world. Challenges, obviously, like the ongoing exploding demand for healthcare services, the interest in everybody getting better healthcare services, the challenges we have regarding things in society like aging, of course, and new diseases like diabetes and obesity. So all these things are coming together to create more and more demand on healthcare services. And what we realize as entrepreneurs, of course, is that innovation by way of the deployment of new technology can hold out the promise of delivering more healthcare services for less money and empowering and enabling clinicians to accomplish more and to deliver better healthcare, hopefully at less cost and at scale, which is what we need. So this is what led Shafi and I to launch Giant. Giant, of course, is an acronym. It stands for Global Innovation and New Technology. We launched 6 years ago, and Shafi and I have been on an extremely exciting and challenging journey over the past 6 years. In year 1, we started running a little event in a derelict nightclub in London, quite literally, where we had a few hundred people coming together, and we were lucky enough to bring on some substantial global sponsors who subscribed to our vision. Our vision, of course, is to improve the health and the well-being of people around the world by facilitating the adoption of new technology and supporting healthcare tech entrepreneurs. So that's what we do. We are now, after 6 years, a community of nearly 200,000 people around the world, people who view themselves as ones whose business is healthcare innovation. We're very proud of our community. And to be honest with you, we consider ourselves primarily a community. We exist to support you, everybody who's interested in healthcare and technology and innovation. We actually don't call ourselves an event business, although we run what I hope is one of the most successful and valuable events in the world of healthcare. So we're a global community, and what we do are the following. Number one, we do our annual event, and thanks for Shafi and his leadership in helping us to coordinate that event. He is your Master of Ceremonies on the main stage today and tomorrow. And also he's been instrumental in helping us to bring a lot of the leading figures from around the world on board as speakers. We also do, for example, a podcast series called Giant Thinking. We do a weekly email newsletter, which is free of charge. You can find out about that from our website. And we do the Healthy Innovators Live TV. So that's our business. We're a global community. We're about world-leading tech entrepreneurs and clinicians like Shafi. We're about supporting the investor community who around the world are always looking for the best healthcare tech investments. We're about supporting everybody at the coalface, the doctors, the nurses, the hospital managers, the primary care and community care workers. And we're about supporting all the business people from startups to the world's largest companies who are all directly involved in promoting innovation in healthcare to advance the delivery of better healthcare outcomes at lower cost and at scale. So that's us. I just want to say a personal thank you to everybody who's joined us. Thank you, obviously, to Shafi as our chairman. And I'm now going to look at the agenda for the Giant Health event, which is a 2-day event. We have nearly 400 speakers, quite literally dialing in from around the world. So we're very proud of the quality of the content that we're giving you this year. And as a reminder, of course, all this content will be available to download after the event as well. So if I can invite everybody just to go to the Giant website, which is www.giant.health. I'm now just going to spend a few minutes reviewing the agenda. So once again, please go to our website, www.giant.health. And in the primary navigation at the top, you'll see a tab called Shows at Giant. You'll see that we have 2 days. We have today, of course, Tuesday, the 1st of December, and the event continues tomorrow, which is obviously Wednesday, the 2nd of December. On day one, we have the main stage, and Shafi, you can talk about that in a minute. But I'd also like to bring to the attention of all of our viewers from around the world a few of the other highlights. Obviously, we have our main business sponsor, Vodafone Business, and we're very, very proud to have Vodafone on board. We also have some other key partners and sponsors, which include, for example, a business called Bob Health, who on day one in conference room 5 are talking all about the theme of spread and scale in the NHS, how to take good ideas from one to many, which is very important and a crucial part of innovation overall. We also have as a highlight on day one in conference room 2, a whole one-day conference called The Future of VR and Immersive Technology in Healthcare. Very exciting to see some of the latest developments in virtual reality and other immersive technologies and the application of those in healthcare. Another highlight on day one, of course, is the conference room 1 afternoon presentation called Extending Health Span in the Age of Digital Health, AI, and COVID-19. This is presented by our partners, Humanity, who have been doing extremely good high-profile international research and developing applications to address aging around the world. So very excited about that. How about you, Shafi? Do you want to share with us some of the highlights that you see on the agenda?
Of course, and we put together so many speakers across 2 days from all around the world. The main stage, of course, which I'll be chairing, will bring together some fireside chats with some, I guess, people in innovation and healthcare who are going to take us to the next level, including Matthew Gould, CEO of NHSX, the Ministry of Health from Abu Dhabi, telling us about what they're doing in the Middle East, of course, as well as the CMIO, the Chief Medical Information Officer in the Netherlands, talking about their project going forward in terms of connecting their healthcare system, as well as a celebration of Michael Serres, who's our who passed away sadly this year, but actually left his legacy by really bringing innovation and patient-led innovation into healthcare systems. I'm also excited by the wearables track, which talk about how we remote monitor people, look at wearables and sensors and data and that kind of thing. So there's a number of areas I think we're going to be really looking forward to. And of course, as someone who's interested in VR and AR and immersive technology, we've got a whole day on the kind of where we are in terms of virtual therapy, immersive technology for education, and also for use in clinical practice. So yeah, so many things I'm excited about. But also, Barry, we have a startup competition, which I'm sure you want to talk to about.
Absolutely. Yes, thank you, Shafi. And so very glad to have you on board as our valued chairman and as the master of ceremonies on the Giant main stage. If we look at the agenda on day 2, we have some very exciting things. On the morning of day 2, this is the 2nd of December, on the main stage, we have the Beanstalks competition. Giant Health is the founder of Beanstalks, which is an international healthcare technology competition for prizes. So we're featuring some of the most interesting healthcare tech startups from around the world who are all competing in front of judges for the annual awards. And then in the afternoon on day 2, we have Giant's International Awards Program. And so this is a new innovation for Giant this year, where we have put together an extremely exciting, interesting collection of awards categories, looking at various categories in healthcare technology innovation, like the best application in immersive health tech, the best technology innovation in the pharma industry, the best medical app. We also have other categories looking at, for example, leaders in healthcare innovation. We have the Entrepreneur of the Year, the Startup of the Year, and the Female Entrepreneur of the Year. And we also have a final overall category of individual subsets of awards in the area of investors and support categories, the Venture Capital Investor of the Year, the Angel Investor of the Year, and the Accelerator of the Year. So we're trying to bring everybody in the international healthcare technology community together and to celebrate all the achievements of the year and to showcase other things that are bubbling up. These are some of the few things I'm very excited about, but there's a couple more on day 2. And Shafi, if we can look at the agenda for day 2, and if you can share with us anything else you'd like to highlight for our audience.
Of course, we're looking at chronic diseases, and one, of course, is Parkinson's, affecting many people around the world. And we're delighted to have Parkinson's Concierge talking about how they live with Parkinson's and innovation in their management and treatment of this disease. But also we have, of course, looking at how we scale. Bob.health is an organization that will tell us all about how you scale. Coming to the NHS, use the navigate through the healthcare system and scale those ideas, which Barry's alluded to, could be from the Beanstalk competition, etc. And we're looking at therapeutics and also looking at how we help healthcare managers to adopt new technologies. So I think we cover a wide range of healthcare issues, which is what's important about Giant, bring everyone together to collaborate to move further forward. And I'll be, of course, hosting the awards program, as Barry mentioned. I'll have my black tie and a glass of champagne, non-alcoholic for me, thank you. But come and join me tomorrow for celebrating the best in healthcare around the world.
Shafi, thank you so much. Once again, on behalf of everybody in the Giant Health team and on behalf of the entire global Giant Health community, we want to thank you for joining the health event this year. We're very, very proud to have you on board. Obviously, this is the first year we're going digital and doing the entire event as a virtual event, but we believe there's a lot of value and benefits in doing a virtual event because, of course, that means a lot more people, quite literally from around the world, can dial in and can join us. We also want to say that our goal is to support you. Our goal is to support everybody in the international healthcare innovation community. So we invite all of you to contact us directly on our website and let us know what we can do to support you. If you're a startup looking for investors, we can help. If you're a global business looking to engage with the innovation community, we can help. If you're a clinician with a new idea for business, we'd love to work with you. Or if you're doing anything else in the world of healthcare and innovation, please contact us, message us, introduce yourself, let us know what we can do to help and support you. We would also like to say thank you to Barclays Bank and the Eagle Labs program within Barclays Bank. They've been an ongoing, passionate supporter of the Giant Health event, and we're very proud to have them on board as a valued sponsor for this year. So thank you to Barclays Bank and the Eagle Labs team there. We also want to introduce everybody, of course, to our virtual event platform. Naturally, due to the pandemic, this is the first time we have ever launched a virtual event. And we spent quite literally 6 months, over the past 6 months, looking at all of the virtual event technology platforms that are out there. And we felt that we actually were not able to find an off-the-shelf virtual event platform that satisfied all of our requirements. So what we've done is we've gone ahead and built our own entire virtual event platform. This is the Giant Health VEP. We obviously are sharing that all with you right now. We believe that it offers better functionality for all of our stakeholders, everybody who's participating in the virtual event with us here at Giant Health. So please note that there's substantial personal networking opportunities. Make sure that you complete your profile on the virtual event platform and make sure that you open yourself up to networking. There's loads of ways of using the virtual event platform on your smartphone, on your laptop, on your tablet, on your desktop PC. And of course, we want to help you to meet everybody else in the Giant community and help you to do valuable, successful networking, to build your personal reputation, to help you with your career, to help you with your current job and all of your future ambitions. So take advantage of all the networking services that are out there. We also want to make sure that we invite you to participate in Giant's virtual international exhibition hall. We have quite literally almost 100 exhibitors from around the world, from very large successful global businesses like Vodafone and Barclays Bank and others, all the way down to the smallest, newest startups, the leaders in tech innovation. Please take time to go through our virtual 3D exhibition hall and acquaint yourself with that. And we invite you to talk to all of our exhibitors. They'd love to hear from you. They have extremely interesting products and services at the coalface of innovation in healthcare. And we have a lot of journalists coming this year who are going to be looking at a lot of the new products which are being announced at Giant, a lot of the new services where our exhibition partners are making new announcements right now at the Giant Health event. So we invite you to go to the virtual 3D exhibition hall and to engage with all of our exhibitors. Lots of very, very interesting opportunities and new innovations to show you what's actually the latest and most important things helping occurring in healthcare innovation. Don't hesitate to look at all those. And of course, we'd like to help you with introductions. So if you see any exhibitor, you can ping directly and have direct video calls with them, but we can also help you with introductions.
So welcome to Giant. I hope you enjoy the next 2 days. There's so much content. Please network, meet new friends, collaborate widely, give some feedback on the event itself. And more importantly, I hope you expand your minds over the next couple of days. Well, hello everyone, and welcome to a fireside chat here at the Giant Health event. And it's a great pleasure and honour to have Matthew Gould for this particular fireside chat, and I'm really looking forward to the conversation and hope you will also share that too. So Matthew Gould needs no introduction, of course. He's the CEO of NHSX, which has now been in existence for over 18 months now. And so it'd be great to explore how it's been shaping the future of healthcare. So Matthew, thank you so much for joining us.
Oh, it's a pleasure. It's very nice to have the conversation with you.
Yeah, so look, it's been, as I said, 18 months or so now. You've been in that position, and NHSX has evolved, I guess, over the course of time. So when I remember back when you first started, Matthew, you spent time in the hospital on call for a whole week, spending time with all the doctors, nurses, and experiences from that has led to some change, I'm sure. Can you just share your current vision and strategy for NHSX compared to when you started, and perhaps where you're now thinking about the future?
So I think the essentially what we're doing boils down to 3 elements, which is really quite simple. It's digitize, connect, and transform. So we want to ensure that the whole of health and care, and the and care bit is really important here, but the whole of health and care have a base level of digitization, because if we don't do that, then we can't do anything else. And so one of the big changes I think we've made as NHSX is to create the second chapter for the provider digitization journey. The first chapter with the Global Digital Exemplars, I think they did a fantastic job at creating really digitally mature and advanced trusts that were doing exciting things and showing what can be done. We've made sure the second chapter is the Digital Aspirant Program, which is taking the less digitally mature and giving them help so that they can climb up that scale of digital maturity themselves. So number one is digitize. Number two is connect, where we have to make sure that patient data can flow safely and appropriately between health and care settings. I mean, we knew before the pandemic what a cost there was in terms of staff and patient time, in terms of patient outcomes and patient safety, that patient records so often couldn't flow between GP and acute trust or mental health trust or social care home. The pandemic has, I think, brought home to us really starkly how important it is that data can flow properly and safely, including between health and social care. And so, again, another big shift that NHSX has made in this space is to put our focus on ensuring a base level of shared care records right across the country. So the letter, for example, that Simon Stevens and Amanda Pritchard wrote out to the service on phase 3 made very clear that all the local systems are expected to have, by this time next year, a minimal shared care record in place. And we will be doing everything we can over the next few years to ensure the whole country, in every bit of the country, there is a shared care record that's effective in making sure that patient data can flow where it's needed safely. And then the third element is transform, because ultimately this is only worth doing unless it affects the patients and the citizen and the care and the support that they get. And so I think the highest expression of what we do is when we're actually using digital technology to reimagine care pathways. And that's been incredibly exciting. Together with Steve Powis, the National Clinical Director, Hugh, the Performance and Improvement Director, and their teams, we've been redrawing, rethinking care pathways for the key long-term conditions in particular, thinking about how remote monitoring using digital technology can improve care, create efficiencies, make a much safer, better, more effective care experience for the patients involved. And we're rolling that out, and I think it's very, very exciting. So it's digitize, connect, and transform. And then, with apologies for a long answer, but it's an important question. Underneath it, there's this underpinning objective of giving clarity to the front line around what needs to be done, how it can be done, and how they can get on with it. And we're really trying to express this in, I think, 3 key projects. There's our imaginatively titled What Good Looks Like project, which is being led by Sonia Patel, our brilliant CIO. And this is to set out for the first time in a very long time expectations about what systems and providers should be doing in digital and using digital technology to transform in very straightforward and simple, coherent ways, that if you're not a tech head, but you're the chief exec of a trust and you want to make sure your trust is doing the right things, will help you. Secondly is equally imaginatively named Who Pays for What, which, as the name suggests, is designed to give clarity to the front line about what they can expect might be funded from the centre and what they should get on with and fund themselves. Because I think that hasn't been clear. It hasn't always been predictable or stable. And that has been a disincentive to the level of investment, multi-year investment that we need to be made right across the front line. And then the third element is something that I know is dear to a lot of people's hearts in the NHS, which is creating much simpler, more straightforward, empowering guidance on information governance, where we got ourselves, I think, in a bit of a tangle with lots of very complex guidance and people being very nervous about doing the wrong thing. So during the pandemic, one of the very first things we did was put together a simple 1-page guidance note that basically said, if you're doing the right thing for your patients, you're trying to be sensible, then you get on with it. And this was endorsed by the Information Commissioner and by the National Data Guardian, and I think it had a really powerful effect. We've now created a portal, an IG portal, which sets out equally simple, clear, easy to use guidance for different situations for IG professionals and clinicians and members of the public. And I think we can have a big impact just by giving people the confidence and the clarity they need.
So thanks for that, Matthew. And I really like the way that you've kind of kept it fairly simple. Some of those project titles is as if it's labeled as it should be on the box, for example, which is great for our kind of the users at the end of that. But also the thing that's been impressed me so much is the rapidity, the speed of change that you've implemented across various systems. And it's been quite wide reaching. It hasn't been just small verticals, it's been wide reaching. So thank you for sharing that. Thank you for that kind of the work that you're doing on reimagining healthcare and you're saying transforming, which we all aspire to, of course. Going further afield, we've seen that the pandemic has now really changed the way people understand the digital language of tomorrow. We need to be able to become more literate in digital technologies, and part of the job, of course, is to translate that into the healthcare workers at the front line. So the question for me now is, so those are the vision strategies. So what is NHSX doing to embed that transformation digitally for the long term? What are the key things that you've been doing at the moment?
So it's a really good question, and embedding the change for the long term, I think, has as much to do with people and systems as it does with the technology. The actual technology that we're talking about for the most part, look, we're doing really exciting things in the AI lab. There's some very exciting cutting edge things happening right across the surface, but actually what we're trying to do fundamentally is in technological terms, not that exciting. Where it gets tricky and interesting is in people and system terms. So I think, I would say there are three ways we really embed this. I mean, number one is the people side, where we've massively stepped up the investment we're putting into creating a digital ready workforce, working very closely with Health Education England, talking to the GMC and others about training. And we need to make sure that from the top to the bottom in every provider, there are people who don't necessarily have to be total computer geeks, but they need to be confident about leading and using digitally led change and transformation. And they need to know why it's important, and they need to know that they can do it. And they need to have the right people, but they don't need to be IT specialists themselves to lead that. So whether you're talking about the boards or chief execs or medical directors or clinicians or non-clinical staff, we need staff who are comfortable and confident and hopefully excited about what digital transformation can bring in terms of the care they give their patients and their quality of work. So really investing in people is one area. I think the second area is the NHS is making, I think, quite an important shift to system level thinking. So we've got our 42 STPs and ICSs, and they're going to be the core unit of geography for the future. And we've been working very closely with colleagues in NHS England and Improvement to make sure that the DNA for systems, the instructions that go out, the expectations and requirements have digital and data right in there at the heart from the start. And we're not retrofitting digital on as an afterthought, but systems should be making use of digital transformation and data as a core part of what it means to be an effective system. And the guidance that's coming out from the centre to systems will reflect that, I think, very vividly. And then the third area is just the clarity that I mentioned earlier, by making clear that some core basic things are expected of providers, different sorts of providers in health and care, by making clear how it is expected to be paid for, giving people clarity about what's expected, making it easy for them to do the right thing, not just issuing lots of instructions from the centre, but for example, creating procurement frameworks so that people can buy compliant products, whether it's an EPR or a blood pressure monitor, that they know is going to be interoperable, they know is going to be efficacious because it's on a procurement framework that we've set up for them and can be bought easily. We need to make it easier for people to do the right thing rather than the wrong thing.
Yeah, and that kind of makes a lot of sense. Thank you for that, sharing that. I like the fact that you're opening networks, open standards, you're thinking about interoperability, you're thinking about collaboration has been a key term, where the NHS is part of a wider remit of other partners coming in, which I really like that. That's certainly, I feel, the way future of the healthcare system should work. So I guess that we've seen a lot of successes of NHSX over the last 18 months since you started leadership, of course. Also, we've seen some challenges, perhaps even some failures. Can you just give us a sense of what you've learned from all that, and perhaps share with the audience some of the successes and lessons that you've learned along the way?
So, things that have gone well, I mean, very simply, the deal we did with Microsoft, which we worked on with NHS Digital, I think massively helped, improved cybersecurity, help put the tools that people need in their hands, and save the service £300 million. That was a really nice and pretty important moment. I think the IG guidance that I mentioned, a page of really simple, empowering guidance for staff, for clinicians, had a big effect. The data store that we set up at the start of a pandemic so that we could see where there were stresses and strains in the system and make sure that the pandemic was being run and resources were being allocated based on measured need rather than anecdote and who was shouting loudest, I think had a really important effect. The deals that we negotiated for NHS staff with the telecoms companies, I think were great, and had a lot of take up. Setting up the COVID National Chest Imaging Database, building a database which can be used to train and validate AI systems on chest scans, I think really has potential to grow into something very exciting. Shipping out 40,000 laptops to the system at short notice at the start of the pandemic, I'm pretty proud of. Creating the Digital Aspirant Fund, building the Shared Care Record Programme. There's a load of things going on. A lot of it is quite slow burn, so it's not stuff I can point to and say, look, here is this fantastic thing we've built, because actually what we're trying to do is systemic change. And look, we've learned a lot. The process of creating a contact tracing app was, as I've said publicly before, a bumpy one. We did what we were set up to do, which was take on a risky project, do it properly, create optionality, test the options we built and work out which one was best. We've now got an app which is, I think, got the best functionality of any of its kind in the world and one of the highest levels of take-up in the world, and was the fastest downloaded app in UK history. So a complex story to get there, but we got there. What have I learned? I've learned change in health and care is really tough and requires, the best advice I had was from one of the people who I go to for advice, she was a senior NHS person, and I asked her what tools and levers you need to use to effect real change in the NHS, and she said all of them. And not only is that true, but it's all of them plus time. I've learned that it's very hard to get a system which is under enormous short-term pressure to think collectively about the much longer term. but we're doing it with strong support, including from both the front line and the top. I've learned that money is important, but actually money is only one of the tools that we need to be using. That actually our status as both the Digital Transformation Directorate of NHS England and Improvement, but also housing the Digital Policy Department of DHSC, means we can do the full span of levers, from project funding and service instructions to legislation and regulation, and we need to be doing all of it to make it work. And I mean, not a day goes by when I'm not reminded that ultimately this isn't about computers and software, and so it's about people, and it's about, I'm sorry about my excited dog who has strong views on digital transformation. It's about people, and it's about systems, and it's about culture.
Great. I think you're absolutely right. Ultimately, it is about patient safety, patient outcomes, and ultimately it's about the care that we offer that person at the end of the healthcare system. So thanks for clarifying that, of course. So thanks for sharing that and being honest and open about where you are. Are there still real barriers that you haven't addressed yet that you'd like to, Matthew?
Loads. I mean, none of this is quick. If we are to drive digital transformation, then I think it's a series of barriers and a series of challenges. So we can, for example, we can come up with a fantastic new pathway for hypertension at the centre and work very closely with the National Clinical Lead and the Royal Colleges and the rest of it. Getting it adopted nationally is a serious challenge. We can come up with brilliant plans from the centre for how systems and providers should make use of digital technology and data. But again, getting that beyond the point where the ones who are keen do it really well, a chunk do it a bit because they feel they have to, and some don't do it at all, that's really tough. So there's a series of challenges. There are some challenges which are just going to be generational, creating a workforce which is genuinely comfortable and excited and has faith and hope in their technology, rather than seeing it as something deeply frustrating that gets in the way of them looking after their patients. That's a long task. Creating patients and citizens who have the enthusiasm, the tools, and the ability to make use of what we could offer, I think is very exciting. A lot of our, I mean, a vast majority of our citizens are very comfortable booking holidays on their phone and getting their news from their phone and doing all sorts of things. Some are not. Some find it difficult. Some are digitally excluded. Working out what we do with them, working out what we do. I think digital technology and the use of digital isn't even across different communities and different parts of the country. Making sure that what we do is to the benefit of everyone, not to the just to the help of those who have already, I think is super important.
Yeah, and I think you're right. I think there's huge variability, as we all know, across the healthcare system, not just about technology, it's about even clinical work or bringing new ideas into fruition. We always had this kind of difficulty in kind of top to bottom approach. We see pockets of innovation in various parts of the NHS system. How does it coalesce? How do you bring all the parts together? And I think that's a kind of, I guess, challenge that you've had for a while. And hopefully we'll see some kind of better way of disseminating good practice so it's more uniform, and technology is part of it.
Yeah, I totally agree. And just on, I mean, on that, there's not a single part of the system I've been to that isn't doing something brilliant in technology. Everywhere I go, even the sort of relative digital deserts, I invariably come across a consultant, a ward, a nurse who is doing amazing things. And the frustrating thing is there's not the sort of natural osmosis of good practice that you would expect. There's in fact sometimes quite the reverse of a sort of, well, we didn't invent it, and just because they do it up the road, why should we be doing it, and we're different. And I think we need to get over that. We need to create standards, we need to create clear criteria for good, and we need to do a better job at identifying and sharing best practice.
Yeah, I couldn't agree more. When I'm innovating, doing certain things, we've gone through challenges of governance and rules, regulations, they even disseminate to somewhere else, they start all over again, the same conversation. So you're thinking, why not just talk to one another and just get on with it kind of thing. It's always been frustrating from that perspective. That's great, thanks for that. So one thing that leads on from that, which has been a passion of mine for a while, Matthew, which I'd ask you about, how do we bring innovation into the heart of organizations? I'm not talking about technology, but innovation, giving people time in their jobs, giving the workforce the kind of the space to think about innovation. How do you change things, their practices, whatever. I think we've struggled with that because we've been so pressurized in our jobs because of course, it's a difficult, demanding position we have. So how would we bring innovation to the heart of every organization so we can promote some of the ideas you mentioned, Matthew?
So I think it's a combination of bandwidth, culture, and permission, and they all go together. So when I started, I was wondering, why is it that very stretched frontline providers aren't incorporating technology which is proven to ease the load, make them more productive, deal with the thing that they are grappling with? Now I understand it's because if you're living hour by hour, day by day to try and keep it together under enormous pressure, you just don't have time to choose, incorporate, reframe what you do around new technology and innovation. I can understand that. It's a trap you get into, a catch-22, where you need the innovation to get out, but you don't have because you haven't got the innovation, you don't have the bandwidth to deal with it. So we need to create some bandwidth, and we need to create the roles, the CCIOs, the CIOs, the board level support that means that people will be able to make use of innovation. We need to make it easier for people. I talked earlier about procurement frameworks. It sounds very dry. I think it's actually super important, because if you are really up against it, you don't have much time, you don't have much money, and you're presented with a cacophony of ideas and people selling you stuff and everyone telling you what they're doing is brilliant, it can be quite hard to navigate. The centre can really help with that. I think there is a permission point, which is, I mean, one of the things that has been brilliant over the last 8 months, there's been a lot that hasn't been brilliant and a lot that's been very difficult. But one of the things which has worked well has been the willingness across the front line, across health and care, to just get on with stuff, to on the basis of necessity and a common sense of, I mean, really unified purpose, do stuff in a way that wasn't necessarily the case before. So instead of making sure that absolutely everything is aligned, every bit of paperwork is filled out, every box ticked and I dotted and T crossed, people were just getting on and building what they needed to build, or getting what they needed to get, so that they could carry on giving the care that their patients needed to their patients. I think if we can bottle some of that permission, that self-permission, it would be great. And that would lead to the third issue, which is cultural change. So trying to create a culture in which innovation, a willingness to take risks, and even a willingness to fail is rewarded, rather than never take risks because you'll get into trouble culture. Now, clearly there are some things you never take risks on. Never take risks on patient safety. You never take risks on patient privacy. Medicine is not the same as the rest of the tech world. But that doesn't mean we can't try things out safely. It doesn't mean we can't innovate. And we need to find a way to get that balance right.
Thanks for that. And obviously now we're approaching winter quite rapidly. We'll see the flu coming to the hospitals, as in COVID, again, rising in cases. What are the priorities of NHSX over this period and perhaps in the new year? If you could share that with our audience.
I'm sorry, could you?
What are the priorities coming up during this winter pandemic and next year?
Yes, so the priorities are really the obvious priorities to do what we can that will both help for winter and the short term and the second wave, while at the same time using that as a platform for the future. So it's on Digitize, it's to try and get money support to the less digitally mature trusts quickly, so they can do things with it in a way that I think should be able to help in the short term. On our Connect, it's trying to put in place very swiftly a minimum shared care record everywhere, and just keep improving. One of the most useful things we did in the first wave was to improve through GP Connect, through additional information on the summary care record and so forth, the amount of patient data that can flow through the system safely. So to keep doing that, because it saves lives and improves care. And then the third area in Transform is using digital technology for example, for people with hypertension, giving them blood pressure monitors. It's something we're working up with colleagues in NHS England so that they can be monitored at home. They don't have to repeatedly go into formal care settings, and a condition which is a contributing factor to severe COVID can be monitored and kept under control at scale.
Thank you for that. And I think we're coming to the end of our session. So I'd like to really just to thank you, first and foremost, both on a personal level, on the work that you've done over the last 18 months to really bring transformation to the healthcare service, which was much needed. I don't think people realize how much work you have done and how many changes have happened without kind of realizing the context of it all. Also, thank your team, NHSX, Matthew, all the hard work that they've been doing over the last 9 months to help us overcome some of the huge barriers that we've all faced and challenges over the last 9 months. So it's a pleasure, Matthew. Thank you so much for joining us and sharing your thoughts and your vision and your personal experiences on HSX. And we wish you well, of course. Thank you so much.
Shafi, thank you. It's been a real pleasure. And thank you for being such a brilliant champion for what digital technology can do for patients. It's been brilliant to watch you in action.
It's very kind. Thank you so much. work at Giant, but also doing some amazing work in healthcare, as we shall hear over the next hour or so. So without further ado, I'd like to introduce Anne Sheehan, who is the head of business at Vodafone UK, and she can tell us a little about what their plans are going forward. And so glad to have you here.
Yeah, good morning, Shafi, and good morning, everybody. I hope you've all managed to get on the platform okay. So thank you, Shafi, for the introduction, and it's great to join everybody at this amazing virtual event. I know we're all getting used to the world of virtual, and Vodafone is really proud, Shafi, to be the sponsor today. Health sector has been hugely important to Vodafone, actually now more than ever, and I think COVID has shown us how important both health and care is great for the communities in the UK across the globe. So we've got some exciting speakers lined up over the next hour or two. So I think hopefully, and then a great Q&A event. So hopefully we get some really lively participation around some of the very topical things that we're going to discuss around technology and how it can help transform healthcare.
So I guess the question for me really is around Vodafone's, I guess, interaction with healthcare. So why is healthcare so important to Vodafone, Anne?
I think, look, I think technology, as I think we can all agree, has played a really important role in supporting health during the pandemic. And technologies, which we'll talk a lot about 5G in the panel discussions later on, but the technology has shown how it can completely transform the delivery of care. And interestingly, prior to COVID, Shafi, you and I and some of your peers had a lot of discussions around the future, the vision, trialing the technology, what it could do. And actually what COVID has done is made, it's no longer a vision, right? It's here, it's live, we've got use cases in the UK. And I think if I look at the health sector already, we've seen some incredible technologies really deliver better patient outcomes. And also we've seen it help train and educate a new generation. So from our perspective, we really see that the UK actually could be a really global leader from a 5G perspective. Now, I guess to kind of bring down to practicalities, right? So we do understand that technology can be expensive, and in a lot of scenarios, health sector hospitals have to be wise with their budgets. They don't have a lot to invest. And therefore, I think what we need to do and what we've learned from COVID is we really need to enter into more partnerships. So move on from a supplier, so Vodafone being a supplier to the industry, to more being partners, co-creating, co-collaborating, and trying to make it more about outcomes as opposed to big investments up front. And I think as the technology partner, we're there to support. And what we want to do is provide flexible and secure solutions, but start small. And some of the things that you'll hear the panel discuss later on, for example, is why don't we create in a hospital one 5G operating room together, one 5G hospital bed, a 5G connected ambulance. And therefore we start small, we test, we try, we learn. And actually then we can, come on a journey together to transform healthcare in a scalable, I think, secure and cost-effective manner. And this morning you're going to hear from a team of experts that we've pulled together that are leading in their field. So Nadine Haram, who we know is the CEO of Proximi and is really an innovator who has really challenged the status quo with technology. You'll hear from Scott Petty, who's the CTO of Vodafone, who will really talk about what we've done in terms of innovation to meet the challenges, and then hear direct from the front line from Ali Phillips at the University Hospital in Southampton. Also, in this virtual world, we also have breakout rooms and virtual stands. So please try and make the effort to go to a virtual stand where you can really get more in-depth discussion going on how we are using some of the new technologies like 5G, mobile private networks, mobile edge computing, all these new buzzwords that we'll hear, but actually genuinely our views on how we can use them for better patient outcomes. Yeah. And I think last, before I hand over to Danny, is, we really see 5G and technology as a force for good. We're really, really excited, Shafi, about the possibilities. We really want to work in partnership. So let not like the traditional way of looking at things about we need big budgets, big procurements. Let's just try, do things together. We've got the technology. It's in all our interests to use that, put that technology to good, and to do trials in hospitals to see, what we can create together. So now I'm going to hand over to the Head of Innovation for Vodafone UK, Danny Kelly, who's going to tell us all about the great things that we've been doing in this space. So thank you, Shafi.
Thank you. Okay, great. So then now we should have the video hopefully playing for the session. Sebastian, if you're there, or Isabella, can you let us know when that when the videos are ending? Because we've got the video for, of course, for Danny Kelly at the end. Then we have the one with the panel, I guess. Is that right, Anne?
Yeah, correct. Yeah.
Is it just one video for all of that, or is it just two separate videos? Anne, do you know?
Hi everyone, my name is Danny Kelly and I am Head of Innovation at Vodafone UK. So firstly, let me take the time to thank you for watching this presentation today. You've got me for the next 30 minutes and I promise to keep this as fast-paced and as engaging as possible. So today I really want to have a conversation or a discussion with you around what are the technology changes that are underpinning some really transformative outcomes within the healthcare sector. Those technology changes are very much being driven by new technologies such as 5G, IoT, the Internet of Things, or MEC, multi-access edge compute. And what we've seen is when we combine all of these technologies together, it's really given us a real ability to deliver truly transformative outcomes in healthcare and beyond. So by way of a signpost in terms of what I'd like to cover today, it's really have a conversation around the accelerators and the inhibitors to that technology adoption. I'd like to get us all on the same page in terms of what is 5G, actually what are the key attributes of 5G and how does that really work. I'll talk through some of the changes that Vodafone are already involved in within different hospitals and organisations across the UK and further afield in terms of delivering transformational outcomes within healthcare. And then actually I thought it'd be useful if we stepped out of healthcare for a minute and we have a conversation around how we're taking those key attributes from 5G and MEC and IoT and we're applying those in other industries. So in this case, I'm going to look at transport and logistics industry, just to give you a view of how we're going to see some changes in that sector in the very near future also. And then we'll round off with an animation video of what Vodafone sees the hospital of the future and the very near future at that look like through the power of harnessing these new technologies. So with that said, I thought it'd be useful just to get us all onto the same page if we watched a short video with regards to Vodafone's vision for connected health in the 21st century.
2020 has been a year like no other. We've gained a renewed appreciation for health workers, experienced astonishing technological progress, and made public health a global priority. But we've also seen challenges in the current system exposed like never before. We stand on the brink of revolution. The UK is digital, and patients across the country are ready to embrace a new way. Imagine a future where at-risk patients can be remotely monitored in real time, and medical staff can share health data instantly. It's time to reimagine healthcare. From fixing basic hospital inefficiencies and replacing silo mentality with a more holistic approach, to implementing and enabling advanced technologies like 5G and AI. We have the collective vision and momentum to make it happen right now, but we can't do it alone. Together we can replace the old model with something faster, smarter, and more patient-centric. Together, we can innovate safely, build trust, and learn at speed. Together, we can make connected healthcare a reality.
So hopefully that short VT gave you some idea of the great work that is already underway today in the healthcare sector. However, if we want those changes to become a common reality, it will, of course, require a much broader adoption of the technology that is underpinning those changes. What we do know for certain is that we are now entering into a period of exponential change in the technology sector. And as a result, new technologies such as 5G and IoT and edge compute capability will allow a number of industries to completely reimagine themselves, to self-disrupt. And we absolutely know for certain that the healthcare industry is at the forefront of the adoption of those new technologies. Now, there's a number of reasons for that, I'm sure. However, without doubt, the pandemic has played its part. So whilst we do know the pandemic completely disrupted the global supply chains, what we do also know is that the pandemic brought with it a positive change in that healthcare has been reimagined. We've been thinking about new ways in which we can deliver traditional services in new channels, not old channels. And actually what we're also seeing is a mindset change in terms of patients and their willingness to accept the engagement with new channels as a form of healthcare provision. So we've not just seen that here in the UK, but we've seen that globally. And throughout the pandemic, we've actually seen technology be used as a central part in terms of delivering some of those changes. We've seen, as a result of 5G adoption in very many places, we've seen new ways in which we could offer healthcare services. VR, virtual reality surgery preparation, augmented reality surgery, remote patient monitoring, drones, and robots. We've seen those being used in Wuhan province to disinfect hospitals. We've seen 5G robots being used for medical delivery and medication delivery. 5G has played a key role within the pandemic, whether that be through the introduction of new services or the reimagination of existing services. Therefore, it might be worthwhile taking a step back and saying, what are the key challenges in the healthcare sector today? And through a 5G lens, how do we begin to address them? So if we look at 5 key challenges that we know exist today, decentralization and accessibility. How do we leverage this new technology to remove the borders for knowledge? How do we ensure that it's accessible to all through new things like telemedicine, remote consultation, remote diagnosis, remote ultrasounds? All of these things play a part today. 5G can begin to really make these technologies mainstream and help address that particular challenge. We then have digital learning and collaboration. So we know that throughout COVID, it's been a real challenge to get medical students into the operating theatre. Do we need to do that in the future with technologies such as augmented reality or virtual reality, when we can beam students into the operating theatre for live learning? And we're already seeing great examples of that today with great companies such as Proximi. And of course, Vodafone, you'll see in one of the examples later, is involved with some universities around the country to ensure how do we do this from an education setting as well. Emergency care. So how do we reimagine emergency care as a result of 5G? How do we use the attributes of 5G in terms of its benefits of low latency and high speed and high bandwidth to deliver real-time information between the ambulance and the hospital? And there's lots of applications that we can then apply to really change frontline response. Community and social care and personal care. So how do we begin to think about that secondary care or treating chronic illnesses in the home? So really improve the lives of people suffering with those chronic illnesses, removing those journeys to the hospital. And then lastly, hospital workplace digitization. How do we begin to address the technology changes from a hospital perspective? And of course, infrastructure is at the heart of the challenge here. So we've got a number of legacy systems and legacy information stacks that need to be addressed. And therefore, it's incumbent upon operators such as Vodafone and the ecosystem of partners who will create these great applications to do so in a way that are open, that are flexible, and that are scalable so they can be adopted at pace. This will not be a big bang approach. It may be an agile approach depending on the institution, and therefore we have got to work together to find what works best for different organizations, but ensuring at the heart of all of this that what we bring to market is open, is flexible, and is scalable to ensure that we can deliver these services. So with that said, it might be worthwhile now having a look at what is 5G, what are its key benefits, and actually how do we apply them in the real world. 5G is here and it holds the key to a new era of wireless transformation. So please do forget about anything you may already know about the other Gs, 2G, 3G, 4G. 5G is not an evolution of the other Gs, it is without doubt a revolution, and it brings with it the ability to completely transform every industry vertical. And as I mentioned before, healthcare is absolutely front and center in that. So whilst the evolution from 3G to 4G allowed us all to watch Netflix on our phone a little bit faster, actually the evolution from 4G to 5G is not the same. It is completely transformational and offers us a very many different opportunities to reimagine services in their entirety. So with that said, let's have a look at those key attributes of 5G and understand a little bit more about them. The key attributes of 5G are, of course, speed, latency, bandwidth, and capacity. And the best way to think about these is with a simple metaphor. So if I use a motorway as an example, speed, self-explanatory, it's really about how fast you can go. And of course, 5G enables you to go very fast. Latency is about how quickly you can react to other cars on the motorway. And bandwidth is really about how many lanes we can have going in one direction, and 5G really opens that up and gives us a lot of lanes on the motorway. And then lastly, capacity. Capacity is about how many cars can be on that motorway. A lot of cars, the bumper to bumper, that are interacting with each other without any sort of disruption. So that really is the power of 5G. But what does that really mean from an application perspective? So look, let's bring that to life with some healthcare applications that you'll know and recognize. So here we have a simple axis of network speed and latency, and we've plotted against this on this particular slide just some examples that 5G really enables as a result of its ultra high speed and ultra low latency, which is absolutely dependent for some critical services. So just to bring some of this to life, I'll draw your attention to the green symbol at the bottom of the page. There we have human visual reaction time. And the reason I call that out, it really takes about 13 milliseconds for your brain to pick up an object and recognize what that object is. With the power of 5G, we can take speeds and latency all the way down to as low as 1 millisecond. And that's incredibly fast, but completely necessary if we were to deliver new applications, such as, for example, autonomous cars on their roads. They will need high speed. They'll also need that low latency from a decision-making perspective. And you can also see that in use cases from a healthcare perspective. So some examples on the page here, you can see connected ambulance, whereby it doesn't need as fast a latency as some applications, but it does absolutely need that real-time high speed to enable that real-time connection between the ambulance and the front line and of course the hospital staff. And if we look at some of the other applications, remote surgery application or immersive AR, VR or healthcare robotics, these things require ultra low latency and of course high speed. These things are only possible as a result of 5G. They were not possible because of the other Gs, and therefore we've really been waiting for these technology change to completely unlock these applications. So what does that mean for clinicians and for patients in the real world? It's really about how we no longer beginning to adapt but explore. It's no longer about supporting patients' care, but it's empowering patients' outcomes. It's no longer about reacting, but it's preventing, and it's no longer about ensuring availability, but it's unlocking accessibility. So let's just talk about them one at a time. We used to adapt, but now we can explore. Explore what? We can remove the boundaries and begin to explore new possibilities with the introduction of new services. We touched upon a little bit about that today, but the connected ambulance is a great example of all of the things that we can now use 5G to unlock within the world of a connected ambulance for the future. Supporting patients' care, well, now it's about empowering those patients independent. How can we decentralize healthcare? How can we offer healthcare in the home and remove the need for trips to the hospital and actually give patients their lives back? That's what 5G can enable. Where it's no longer about reacting, it's about preventing. So how do we use new technologies such as digital twins to predict and understand outcomes before they're deployed so that we can begin to reduce errors in the real world? And then, of course, ensuring availability, unlocking that accessibility. So how do remote technologies, which we're beginning to see adopted, such as remote diagnosis and remote consultation, those things, how do we ensure that they become mainstream through 5G to really transform the healthcare sector? So with that said, I think it'd be useful now at this point to go ahead and have a look at how's Vodafone taken those capabilities from 5G, ultra high speeds, ultra low latency, and taking some of these advantages in terms of decentralization of healthcare and digital twins and applying those in the real world to deliver transformational outcomes today. Of course, we want to see those expanded into the healthcare sector. That will take time, but I think we're already starting to see the seeds grow from a technology adoption perspective, and it's good to have a look at some of those opportunities. So Vodafone is beginning to shift the dial on healthcare provision in the UK and beyond. But actually, when we do so, we're not doing so independently. We are very much dependent upon a whole raft of partners in the ecosystem to come together to really deliver those transformative outcomes. Differences between 4G and 5G. 5G has a dependency upon an ecosystem to really take advantage of the benefits that we can bring from a network and technology perspective. So if I just give you 4 examples today of where we're involved in the UK and further afield from a Vodafone perspective in terms of really taking those attributes of 5G and applying them in the real world. So the first example I'd like to share is the work that we're doing to deliver the UK's first 5G connected hospital campus. And there, what we've done is partner with Proximi to enable the hospital through 5G to deliver augmented and virtual reality assisted surgery. And that, of course, addresses one of the major challenges in terms of decentralization and accessibility. But what we're also doing there is addressing learning and collaboration, because we will enable through that application from Proximi live learning from the operating theatre to the university campuses. And that is really important in terms of our ability to address multiple needs. So great work there from our partner Proximi, a great application, a great solution, and it's great to be seeing this being adopted into a UK hospital through the power of 5G. Sticking with learning and collaboration, if I move on, we're now working with Coventry University to deliver an interactive VR remote learning capability at Coventry University. Again, this will be the first of its kind in the UK. It's the first enabled interactive 5G remote learning capability. And what will enable there is really a 5G AR VR virtual tour of the human body. And I believe that has really ushered in a new era of education through the power of 5G. And we'll begin to see this become more common across university campuses across the UK for different industries, not just healthcare. But it's great to see that healthcare, again, are really pioneering these changes within the education industry. So I talked a little bit about it today, connected ambulance. We're working in Milan on the connected ambulance. We've got a number of projects in the UK on connected ambulance. The beautiful thing about connected ambulance is there's so many applications that we can now deploy into the connected ambulance to really, really transform frontline and first response healthcare. I'm not going into all of them today, but I'll touch upon a few of them. 5G, of course, offers us that ultra high speed, which is necessary for those HD video calls, and therefore connecting the ambulance paramedics to the hospital staff with, allowing them to see at first hand what's happening with patients in front of them. This can all be done through a audiovisual headset. Talking of headsets, we can use those headsets to offer paramedics operational protocols. So giving them a reminder or a nudge in terms of what they need to do next with different patients under different circumstances, depending on what is happening with them. We've got tele-ultrasound capability that we're able to share with real time with the hospital. There's multi-parameters whereby the vital signs of the patient en route to the hospital can already be transmitted to the hospital staff. And of course, visual recognition, something else that we can do. So a paramedic sometimes attend scenes and the patients are unconscious. Using a augmented reality headset, they could be able to identify who is that patient. It's from healthcare records and understand have they got any underlying health conditions. I mean, these are just some of the great examples that we can now see come to bear for the connected ambulance of the future. And these things are happening today. These are not things that we want to develop in the future. These are happening today already with Vodafone footprint. And then lastly, in Dusseldorf, we have been working to create Germany's first 5G connected campus. We're looking there to address a number of challenges around personalised care and hospital workplace digitalisation. So what you've seen here is we're using 3D mixed reality library for surgery preparation. And we're also using that for monitoring patches for remote monitoring of patients in the home to understand their vitals ahead of surgery and the likes. So actually, there's two great use cases being developed there in Vodafone Germany. With that said, I thought it'd be good just to break out to a couple of other industries so that we could have a look at how else is Vodafone transforming services. And I already said up front that we would select transport and logistics. So why don't we go ahead and have a look at how Vodafone's playing a part in taking those same attributes that we're using to deliver transformative outcomes in healthcare and apply that to transport and logistics industry so you can have an understanding of what you can expect to see in the future in that space. Transport and logistics, it appears, is hot on the heels of the healthcare sector in terms of its appetite to adapt these and chances to deliver different outcomes in this space. Vodafone is involved in a number of projects, both in the UK and further afield, and I'll just touch upon a few of those. Some of these actual examples seem a little bit far-fetched, but the reality is we're engaged and actively engaged on deploying these technologies today, and we can expect to see these changes on our roads or our waterways in the very, very near future. So with that said, let's talk about a few of these examples. The first one I'd like to talk to is the work that we've been doing with Ford at their plant in Dagenham. Really, they've adopted a mobile private network with some edge compute capability, and combined, these technologies have offered them a new way in which they can manufacture, in this case, electric batteries for electric cars of the future. So that race for electric cars onto our roads is absolutely happening here in the UK, and 5G and edge compute capability is playing its part in terms of how we deliver that. Vodafone just won an award from DCMS, Department for Culture and Media, for our work at Ford Factory to really build a showcase for manufacturing for the whole of the UK, which is a great accolade. A little bit of bragging rights there. So let me just move on and show some other examples where we've been involved today. So the next one here I want to talk to is the 5G enabled autonomous ferries in Germany. Now, this looks a bit futuristic and probably a little bit unrealistic, but the reality is we're already underway deploying the technology along the waterways to make this a common reality. In this particular instance, what you'll see is these vessels will be completely autonomous, whereby the captain will be at home, able to navigate these vessels from the comfort of his own home. Hopefully not comfortable. I'm sure there will be a number of security measures in place to ensure that this can happen all safely. But actually, the conversation here is really about the power of the technology enabling this to happen in a safe way. We're also working with West Midlands 5G on their West Midlands 5G project to actually build the UK's first stretch of public road to test autonomous vehicles on. That's 180-mile stretch of road in the West Midlands. Great to see the West Midlands team really spearheading this into the UK and being at the forefront of the adoption of autonomous vehicles onto our roads. So we can absolutely expect to see autonomous vehicles being used in earnest on the roads in the West Midlands as the testing site for these onto the UK roads. We're also working with Hariba Mira, the Motor Institute Regulatory Authority in the UK, to build them a test track and facility for 5G autonomous vehicle testing. And again, that's just to test some of the technologies that we can deploy from an autonomous vehicle perspective before they make it onto our roads in the UK. So look, these projects are happening here and now. They're very real, and we can expect to see changes in terms of autonomous vehicles on the roads very, very shortly. Also, you may have seen in the press recently, Vodafone were working with a partner called Origo to deliver a autonomous bus at the PGA Golf Tour in Wales at Celtic Manor. We used that autonomous vehicle to get golfers from the clubhouse to the first tee in a fully autonomous bus, being of course deployed there on a private road. But actually it just shows you that that technology is available today, and it's only a matter of time before we will all see that as a common reality here in the UK on our roads. We are involved actively right across Europe and further afield in terms of these projects. There is a massive appetite for change in this space, only just behind the appetite that we're seeing come through from healthcare in terms of adoption of new services into that space. What I'd like to do now is step back in and have a look at a short animation video of what Vodafone perceived the hospital of the future to look like, with a number of these changes that we've talked together today and brought together in a little animation so that you can see what that might look like. So there we have it, a day in the life of a surgeon in the not so distant future. If only it were that easy, I can hear you say. What's clear from that video is that we are only scraping at the surface in terms of the technology advancements we can begin to deploy. Of course, we'll all have to work together to ensure that the long-term architecture can support this rate of change, making sure that it's open, secure, and flexible. If we do so, then we'll be able to innovate safely and secure to make connected health a reality. And of course, if we put patient outcomes and user experience at the heart of everything we do, then the possibilities will be truly endless.
Hello, ladies and gentlemen. Thank you very much for the invitation to join this exciting panel with so many esteemed speakers and friends. My name is Nadine Hashash Haram. I'm a reconstructive plastic surgeon at Guy's and St. Thomas's, and I'm also the founder and CEO of Proximie. And what I'd really like to share with you today is how we've been envisaging the potential of changing the world, the power of strategic partnerships that allow us to be stronger together as we ultimately work to improve the quality of lives of our patients all around the world. As a practicing surgeon, and I've been a surgeon for over 10 years now, I've worked both in the UK within the National Health Service, but also globally within multiple other health systems. And what I can tell you is that I witnessed firsthand some of those key challenges that we face in healthcare. Challenges around variation access, variation outcomes, and variation quality. And it always struck me as a conundrum. Why is it that patients don't get the same quality of care everywhere they go? And for me, it became a frustration and a drive to think about how do we change that process? How do we ensure that we can leverage solutions that allow us to ensure that patients, no matter where they are, get the best care the first time, every time? Some of that is about what we'll talk about today. And some of it is about a mindset, thinking about an operating room, a space that's so exciting yet so undigitized. And how can we digitize that environment to drive expertise, quality, and care? But of course, we always need to look back at history to understand a bit more about the genesis of surgery, this idea that was predicated on communication, collaboration, and co-presence, that by being together in a room, we can drive expertise, we can share and discuss different ways to do procedures. And whilst it's passive, was a way that drove us forward. And undoubtedly, we have to credit that time to a lot of the advances that we did make in surgery. And that environment is probably why we still call an operating room here in the UK an operating theater, that kind of amphitheater type experience. But if we fast forward to about 18 months ago in Texas, this was the case. We've probably demonstrated that we haven't adapted with the times. In a world where we're so digital in everything that we do, why is it that we still need to put tens and tens of people in an operating room to scale? And I'm sure you'd agree this is quite a passive way of learning, a passive way of communication and collaboration. And what do we know about what each of these individuals are doing when they then go back to their own operating rooms and their own hospitals to deliver that care to their own patient population? When we talk about variation, it really is anchored in evidence. This is not just an assumption or a hypothesis, but this is something that we see day in, day out. Here in the UK, we talk a lot about GIRF, to get it right first time, and mapping out that variation across hospitals within the NHS. But also within Europe and more globally, this is a challenge. And I can tell you that what often used to frustrate me was this misconception that variation of care really exists only in the developing world or the low and middle income countries. I can tell you that variation care is very much something that we experience day in, day out, and I'm sure other surgeons on this panel will agree to that as well. And these numbers that I put on the board here are numbers that are meaningful and are worrying. Here, for example, even in the UK, you're 14 times more likely to suffer complications of colorectal surgery. And these are numbers from other centers in Europe as well in other specialties. And so this idea of quite simply where you live determines if you live or how you live is something that is concerning, is something that we need to do something about, and we need to act on this. And we know, and as a surgeon, I can speak to this, as I'm sure the other surgeons will as well, is that the future of surgery is exponentially faster, smarter, smaller, cheaper, and better. We have a vision of where the future of surgery wrapped around the patient journey will be. I was very lucky to be one of the commissioners on the Future of Surgery's Royal College of Surgeons Commission. And we really looked at what does surgery look like in the next 5, 10, and 15 years. And we're optimistic, and we know that there's going to be a lot of interesting solutions that will continue to add benefit to our patients. Solutions such as computer vision, artificial intelligence and machine learning, and robotics. And of course, genomics and big data as we drive more towards a precision medicine. And again, augmented reality and virtual reality, which you would have heard about also from some of the other panelists. But for me, one of the absolute fundamentals to all of this is not the technology stack, but how is it actually delivering value to patients? There can be a lot of hype about different solutions out there, but ultimately, how are we using those solutions to make sure that we can benefit patients? And what I can tell you for a fact is ultimately wrapped around all of that is communication and connectivity allows us to save lives. Our ability to reach out to our network of surgeons nationally and globally can make an impact in saving lives. The power and potential of 5G connectivity is also going to take that to the next level. Particularly as we start to think about surgeries and videos around surgery, it's such a compelling use case to use 5G to really enable that connectivity that is seamless, ultra low latency, and meaningful for clinical care, transfer of knowledge, and delivery of expertise. And why is it impactful? It's impactful because it allows us to do things at more capacity. Nothing is left behind, so the bandwidth capabilities are much broader. But ultimately, it's about latency and low latency. What we really wanted to build in Proximie as a solution, and we'll talk more about it, was an ultra low latency experience. And of course, we've optimized our platform that even on 4G, we can deliver that ultra low latency experience where it's seamless, it's not buffering or cutting or having that less exciting or appealing experience. That being said, we recognize that we can do so much more with 5G, those high definition 3D views that we can drive into an experience, overlaying more and more structures and images from augmented reality and other tools that would allow us to do that. And we see the value of immediate insight. What we know is that information is liquid gold. This is a saying from Dr. Shafiq Ahmed. What we know is that getting the right information at the right time for the right patient is critical. It's those choices that we need to make that can be life or death decisions for patients. And so having that ability to really accelerate a higher infrastructure and architecture for connectivity is going to be so much more meaningful as we, as a global healthcare community, strive more for digital. This was, of course, accelerated and catalyzed by COVID, but undoubtedly, I think you'd agree that there was changes towards that happening even before COVID. What COVID afforded is that ability to move quickly. What we see as 5G's opportunities in healthcare is around decentralization and accessibility. It's something that we believe very much at Proximie. It's why we've built our platform the way we have. It's about saving lives by connecting experts. Again, on our platform, using Proximie, you're able to virtually scrub into operating rooms around the world to collaborate and connect. And how amazing it would be to use 5G connectivity to do that, to deliver emergency care, to support more impactful community and social care, and hospital and workplace digitization. So we see a lot of opportunities here, some which we are working on, but some that our partners and other healthcare systems are working on as well. And we truly believe that we want to save lives by sharing the world's best clinical practice. We understand that we've got fantastic surgeons all around the world. But imagine if we could then amplify their reach, amplify their ability to deliver care to patients, and really save lives by sharing their expertise with the best clinical practice and solutions to do that. So I'll share this video, which is perhaps our view on how we see the value of that connectivity. When we look at other industries, we see how they've moved very much towards data-driven methodology, data capture, and data sharing. And how having those abilities to do all of that in real time means that they're able to leverage that for future benefit within their industry. So in this case, we're looking at the athletics industry. Imagine if surgery pivoted into that component as well. And that's where Proximie is really driving that concept. And so I'll share this video with you, which I hope demonstrates that.
The pursuit, being better, the edge, the marginal gain, the unfair advantage. We've all been looking for it, no matter what we do. The truth is, there is no shortcut, no easy route. Technology is changing our pursuit. It's evolving before our eyes, creating endless possibilities. Just look at the world of sport, the modern quarterback, the new age domestique, the pre-game plan, the post-game review. Every angle, every possibility, every inch. Watched, reviewed, understood, applied. What about the clinical world? At Proximie, we enable clinicians to virtually scrub in and collaborate with each other from anywhere in the world. Allowing any clinician to prepare,
What I tend to use is a horizontal incision.
To perform.
Everything is about triangles and the proper planes of dissection. So the top of your triangle is where you're going to come across.
And perfect their craft.
Question there?
Yeah, Ben, I wondered if you make a comment as to how you pitch that. Is it such that the labrum is flushed to that preparation zone?
Yeah, I'm so glad you brought that up, John.
Pre, during, after. Think of us as your game tape. Start your pursuit today. Plug in Proximy. Connect clinicians. Save lives.
So I hope what that video has shown you is that our thesis is very much about how do we digitize the global operating room? How do we ensure that we can really aggregate meaningful information, actionable analytics, but ultimately connect surgeons all around the world to deliver care to patients wherever it's needed? Our applications are varied around preceptorship and proctorship, giving people an ability to virtually dial in and see how surgeons are performing groundbreaking procedures around the world, but also going through surgical coaching where you may be working through a complex case and having another surgeon be able to dial in and work through that with you, almost like a coach in the wings working through those cases is really valuable. We're also providing a lot of live and remote support through reps and through other industry players. And finally, we're working with groups and institutions around how can we expand their service capacity, where you may have a hospital that has multiple hubs within their hub and spoke model. And how do you ensure that you can deliver and amplify that expertise from one center to every other center within that system? And we're seeing a lot of interest around this, both in the UK and globally. Our use cases are varied. We focus largely on a number of key specialties around cardiology, where we've managed to use our solution to dial in experts to deliver life-saving procedures here in the UK, in the Middle East, in India, and in the United States. And it's very heartwarming. 2 weeks ago when we did a case in India, allowing an expert from the United States to dial in, and they worked through a cardiac case. And the surgeons and the scrub tech actually gave a standing ovation at the end because they were so touched and moved by this solution being able to give impact to the patient that was on the table. Orthopedics, we do quite a bit. Plastic surgery, of course, as it's my specialty, but also head and neck, being able to do training and education, layering that augmented reality tool on the anatomy, being able to talk through the surgical landmarks, colorectal and urology. And I think what's important to recognize is COVID is the accelerant. We are not blind to that. We see, and we've seen it across the board. I know many on this panel would have spoken to that as well. It's accelerated the behavior change that was going to happen anyway, but rather than it happening over a number of years, it happened over a number of months. And we saw the huge need for our solution, and our engagement grew in terms of users about 8 to 9 times. And the numbers of cases we were doing on our platform grew about 5 times. But we're always moved by the patient stories. This is Mo, a patient who had metastatic testicular cancer. And by using our platform, Dr. Fernando was able to dial in Dr. Jim Porter from Seattle, and they were able to work through this complex case robotically. He was able to guide her and mentor as he'd had a huge logbook of these cases, these complex metastatic cases. And they were able to work through that case. And she sort of described it as if she was a player on the tennis court and was having a coach in the wings. And that was a fantastic outcome. Mo went home at day 3 and was doing interviews on Sky News a week later. And of course, we have many other surgeons that do the same in colorectal. So this surgeon was working on a lap CME with another surgeon overseas, but he's able to also bring in the 3D tools and the 3D recons and DICOM files into that view. And they're able to make a much more meaningful discussion around how to proceed through that case. Everything she sees, he sees, and it's very much, in his words, it's as if I was there in person. And he often says, it's like I'm sitting in the control room. You can see everything that's going on. Audio is perfect, no delay, which you sometimes face when you're doing these live streams regularly on the internet. And that's thanks to our architecture that we've built. And finally, being able to deliver training for our future surgeons is so critical. It's about being stronger together. We partnered with ASSET, the Associations of Surgeons in Training, and many other groups to think about how do we deliver the workforce training that is needed across the country. And we run a lot of workshops now where Proximy is used on live or review cases. We're able to layer anatomy and structures onto that and really walk through the key components of an operation, which is so important for learning. And of course, we're incredibly humbled and proud to be partners with the UK military. We were selected against a very competitive tender, against many blue chip companies. And we were selected because of our ease of use, our scalability, our security infrastructure, our ultra low latency and low bandwidth requirements. And it's incredible for us that our solution is being able to help our men and women on the front line get the care that they need instantly. We have been covered in the press quite a lot, and really it's usually about the human stories and the benefit, but we're very humbled and proud ultimately by the impact that we're making. And I think I'll just leave you with a final story, which is it's a case story. So this is a patient, it's a couple of years ago now. She was 55, 56 at the time. Unfortunately, she'd had an operation that went wrong. She had a laparotomy that didn't go to plan. She was in hospital in and out for years, had fistulas, was PEG fed, fed by a tube for a good 8 to 10 months. Eventually was left with a healed wound, but a pretty awful abdominal hernia. Every time she coughed, all the contents of the abdomen would be bulging out. And you can imagine for a woman her age, who's still very young, this was not really a good quality of life, to the point that she was desperate and asked us if her surgeon could perform the procedure, but have an expert from the UK dial in. Her surgeon was keen on that as well. This was a complex case. And as he said, having 2 eyes is always better than having one. And being able to work through that with another colleague who has a lot of experience in these cases is always helpful. And so they worked through that case. She was in hospital for 4 to 5 days and was home then. Incredibly well in herself. 6 months later, she was at the beach in a swimsuit and doing all the things that a woman of her age should be doing, playing with her grandchildren, enjoying life, traveling. And that patient is my mother. So I think, there's an element of a litmus test here. If you're willing to put your own mother through this, then, you do truly believe in the technology, which I do. It's always humbling to share this personal story with everyone, but I think it lends itself to the potential, the credibility, and how much I believe in it personally. So I really want to thank you very much. I hope that this is something we can continue to work on together. We're very open to collaboration. We believe in strategic partnerships, and we look forward to a future where every patient gets the best care the first time, every time. Thank you very much.
Hello, my name is Scott Petty, Chief Technology Officer for Vodafone here in the UK. 2020 has been an extraordinary year for everybody. Nobody knows that more than the health sector. Here in telecommunications, it's also been a super busy time, keeping our networks running and adjusting to the changing traffic patterns that the pandemic has demanded. As everyone moved to working from home, businesses had to adjust their capacity and the way their networks worked. We had to support government across a whole range of sectors to ensure that those services continued to run smoothly. I'm really proud of our performance throughout the pandemic, especially of our engineers who worked very hard to ensure stability of the networks, ensure that we were always able to cope with our customers' demands. A key success factor in being ready was really that we're constantly modernizing our networks and evolving for new technology. Of course, we're getting ready for 5G. As part of 5G, we've been modernizing our core networks and moving to cloud-native technologies. That gave us tremendous flexibility in the way we could adjust for those traffic patterns, spin up additional capacity, and ensure that we were ready for any spike in the network no matter where it occurred. That resulted in fantastic stability from the very first days of lockdown all the way through to today. We worked hard to also support the health sector through this process, from connecting the Nightingale hospitals with free connectivity, ensuring that there was enough capacity for those sites to be able to perform optimally for patients as they arrived. We also run the NHS 111 service. Over a few short days, we're able to double the capacity to be able to handle more than 2,400 calls simultaneously into NHS 111, and we've been monitoring and continuing to upgrade that service constantly throughout the process. We also were able to support and equip more than 1,000 retired health workers and GPs with software to work from home as a remote call centre, leveraging the things we'd learnt from our own call centres working from home to assist NHS England staffing the free service. The additional workforce was up and running in a few days and has been performing very well throughout the entire pandemic. We also provided and enabled NHS Wi-Fi calling connections in the NHS South, Central and West support units to ensure that people could always have access to telephony services no matter where they were and able to use their mobile phones effectively. Of course, we offered free unlimited connectivity for NHS staff and workers for 6 months throughout the pandemic to ensure that they could talk to their loved ones and always be in contact with their family. So it's been a super busy time in telecommunications, supporting the health sector through the COVID pandemic and ensuring that as a country we were able to continue to operate and keep the economy running. We're really excited about where we are in the technology lifecycle for networks. Of course, we started deploying 5G last year. 5G we're deploying right now is what's called non-standalone, so it leverages our 4G network to create a 5G coverage map across the country and to offer increased speeds to our customers. Early next year, though, we'll launch the second phase of 5G, which is called standalone 5G. This enables a whole set of new features, greater speed for devices connected to our network, but most importantly, low latency, which enables augmented reality and virtual reality applications, really important in remote telemedicine applications in health. It'll also enable massive IoT devices, so services such as connected ambulances, and be able to connect infinitely more sensors to the network than we can today in a very reliable way. Underpinning that and supporting that is massively increased security and the ability to guarantee end-to-end performance through a technology called network slicing. So 5G will enable a whole host of new applications in connected health and connected services, and ensuring that we can manage and look after a much broader range of devices. To be ready to cope with 5G, however, health needs to also modernise, build new applications and services, and digitise the platforms to really leverage the benefits that we can see with 5G. Vodafone is looking forward to working with the health sector to help you through that modernisation process. We've built great experience in modernising our own networks, and I think we have a role to help the health sector as you go through a massive growth phase and capture the opportunities that 5G will offer. Thank you.
We take some time now to meet one of the clinicians in the field who will be the user of the new technologies that we can bring through the power of 5G. With that said, I would like to introduce Ali Phillips from Southampton General. So Ali, welcome today. Why don't you go ahead, Ali, and introduce yourself, please?
Good morning, Danny. Thank you very much. My name is Ali Phillips. I'm a consultant orthopaedic surgeon. I'm head of trauma for orthopaedics at Southampton and also lead for education for major trauma.
Brilliant. So look, Ali, thanks very much for joining me on this topic today. Why is the topic of innovation and technology important to you personally?
I sit on the augmented and mixed reality committee here at Southampton, and I'm surrounded, when I look around me, by the most phenomenally intelligent people. They are some of the most high IQ people I've ever met, and they're doctors and senior nurses who just want to make things better. Yeah, we all like a bit of tech in our lives and we all like to play with new and fun stuff, but in order to get all that going, we need to innovate. We need to make it interesting. We need to use all these applications to make our patients' lives better. And yeah, we have a little fun along the way.
Yes, and so look, Ali, Vodafone, as you and I know, we've talked many times about this, but Vodafone's investing heavily right across the UK in terms of the introduction of our 5G networks. That will bring lots of benefits around latency and bandwidth and speed, and those attributes will really open up a number of new applications that we can bring to bear, especially in the healthcare sector. From a transformational perspective, what is it you're looking forward to in terms of adopting those new technologies in healthcare?
We're a huge university hospital. Even before COVID times, we still did remote lectures. We still did remote all sorts of things to teach and train. You can't get 300 students from a single year into the same room necessarily. And even now, that's a complete no-no, of course. So let alone the university, we have registrar training every other week for the whole of Wessex. We have students and professors from abroad who want to learn some techniques that we do. There's quite a lot of stuff at Southampton that only we do in the entire country, centres in the entire world. So getting that information out there in a meaningful way requires a network that functions, requires a network that isn't glitchy, requires a network that actually does what we want it to do rather than what we've got at the moment. This is all about patients at the end of the day, and the ultimate user of my services and ultimately your services within the healthcare sector are patients. I think we're a digital exemplar at Southampton, and I feel very lucky, but the grass is always greener, isn't it? And I think with 5G coming along, the grass is an awful lot greener. I don't think a lot of my colleagues know how green it could be. And I think that's really, really interesting to get that message out there too.
You're completely right. It's a great message. We're seeing 5G does absolutely bring the ability to transform a number of industries. We're seeing this right across industry, whether it's transport, logistics, manufacturing, and healthcare is definitely at the forefront of that technology adoption. But we understand as well that there is a number of barriers, Ali, in terms of the adoption, whether that's at a network level or at an application level. What's your experience in terms of the challenges that you face in the hospital in terms of the adoption of this new technology?
I was on call all last week, and I tried to get communication, and that's the essence of what I try and do in my week on call, so that everybody can get hold of me. And yet half a dozen times last week, I couldn't even receive a phone call. People would call me on a landline because they knew I was in my office, and they'd say, "I just tried to get hold of you. Where were you?" And I said, "Well, I was wandering around the hospital doing my job." So, even at a very, very simplistic way, that is a problem. And then you step it up to theatres, and you're trying to implement something like proximity augmented reality setup, where you're trying to train and teach, or even, as I have done recently with open fractures, tried to get my colleagues to give me an opinion remotely when they weren't even necessarily in the hospital. And it's glitchy, I can't hear them, it takes a long time to set up and connect all the application with the network. It's frustrating to say the least, and I don't have the time to go through and work all that out. We're all busy clinicians. We don't have the time to sort that sort of networking problem out. So if it worked perfectly, man, you'd make an awful lot of people very, very happy.
So, Ali, it's frustrating to hear that we're still facing some of those real basic challenges in terms of communication needs within the hospital. Here we are today talking about the advancement of 5G and not unlocking new applications such as augmented reality or virtual reality, remote patient monitoring, remote education within the hospital environment. But yet at the same time, within the hospitals, they are faced with significant challenges just in terms of basic communication and digitalization. So how is it that we can work closely together, more closely together to resolve some of those challenges? Because if we don't get that fixed, Ali, we'll not be able to take advantage of all of the great benefits that we can get now from a 5G perspective.
Thanks, Danny. And I really appreciate the opportunity to work like this, because what we need to do is to build from the ground up. It's all well and good coming in and having these great aspirations, but actually if we don't deliver the basics, then it's not going to work for the rest of it. And just getting a simple one theatre working, one theatre having access to fantastic network, and then other people being able to dial into that to see, having one ward, one bed even, where we can remotely access their statistics. That's all we need to start with. If we can show that we can do it on one individual level, and then make it two, and then two theatres, a whole floor, we have to build it up like that, because the important things for us as a trust are communicating with our students. That's absolutely vital. But communicating with our patients, we just need one computer to work with one patient to start with, and then go up from there. Yes, we've got some wonderful ideas and wonderful innovations. We're looking at Google Glasses and HoloLens and all sorts of things. That all chews up bandwidth. So actually, I want to put a 4K camera on my forehead when I'm operating. I want to have a 4K camera looking at the operation as well. I want to have a 4K camera in the corner of the room doing human factors research. And we can't do any of that if we don't get the actual bandwidth within that theatre right to start with, let alone the whole hospital. It's a grand plan. It's going to take a while, but I truly believe it's the only way to do it from the ground up.
Yeah, I think that's some great advice, Ali. We have to find a way in which we can deploy these, both the network technology and even the applications themselves, in a small scale but flexible and scalable way, so that we can begin the journey together in a confined environment, and then allow that to grow. That will give us advantages in terms of the cost of network adoption or the cost of the application adoption, and then we can grow from there, prove out the benefits, build out the business case together, prove that this can really work. work, but it is dependent, I suppose, on the network operators and the application providers to collaborate together with you, the clinicians in the field, because we understand actually it's the proximity to the problem statement. You know, if you're very close to the problem statement, you typically know how to answer the challenge. Vodafone and other network operators, they tend to have spent a lot of time building great relationships with the procurement teams in hospitals, but actually it's clinicians in the field who really understand the challenges they face and the applications they need to resolve them, Ali. So if we can work together in the future, as we have begun with our relationship, to understand what's the challenge, what's the outcome we're trying to achieve, and actually how do we begin to do that, but do it in a secure, in a flexible and a scalable way, then I think we've got a recipe for success. So look, Ali, with that said, thanks very much for sharing your thoughts with us today. It's been really useful to get that insight, and I look forward to working with you in the future.
Thanks, Doug.
Thank you so much. What a great video and presentation from Vodafone. Great thanks to Ali, of course, Nadine, Scott, and Danny for a wonderful presentation. Also, giving us a vision around the future of healthcare, where 5G might support us in that mission. So that's been amazing. So thanks so much to the Vodafone team. We have a few questions, Danny, if you're here to join us for a few questions from the audience. And I have some of my own, of course. So let's go to the top. Jocelyn Loma asked a question about collaborative decision-making. And the question is, in order to access remote experts, what does the next generation of collaboration really look like? So I think that's quite an open question, I guess, Danny. What are your thoughts on that?
Yeah, I mean, it's an interesting question. I think what we now get, Shafi, with the introduction of 5G is the ability now for us to adopt a number of applications, and we'll see a lot of new applications being developed and brought to market that can take advantage of the low latency, the high bandwidth, and the speed elements that we can offer as a guaranteed service from a 5G perspective. So when we talk about 5G, it's quite important that we talk about the ecosystem that we build around the 5G partnership. So what we'll now see in the market is a lot of ecosystem partners who are very keen to develop best-in-class capability that take advantage of those attributes of a network that can offer those attributes, and that's an interesting area. So there's already capabilities in this space today. Nadine was on talking about her capability from a proximity perspective. That's certainly one in the market. You know, we're partnering there with Nadine to help bring that to market, but there will be others for sure.
Yeah, I'm sure. And of course, if you look at the long-term future, people talk about avatars, holograms. Who knows where that journey might take us in the future about remote collaborative work, Danny. But it's all very exciting, of course.
Correct.
Yeah, sure. Next thing is really around, I think Thomas has a question around the fact that 5G is still relatively new, I guess, from our perspectives. Are there any concerns about its reliability to consistently work? What's your thoughts around that, Danny?
Yeah, I mean, great question. Look, 5G comes in all different shapes and sizes. 5G, you know, whether it's a private network, a public network, is it an in-building 5G coverage scheme? Is it? So we have to look at what is the end application, what is the requirement that we're looking to deliver, and then we determine what is the best-in-class capability to deliver that. So if it was a public 5G network, of course you have to worry about things like contention or spectrum availability that you're contending with across the public network. However, in a healthcare setting, for example, in a hospital setting, if we were delivering a 5G capability for example, remote surgery or one of these advanced technologies, you'd certainly do so with a private network. And with private network, of course, we can offer guaranteed SLAs around the latency and the bandwidth to give you that assurance of the application. And of course, it's not just about the network. We also have to consider the evolution of edge computing. So where does the compute power happen? Taking it right down to the edge. So for example, you wouldn't sit behind the wheel of an autonomous car in the UK using 4G network, you know, contended on a public network spectrum and all of that compute power happening in the cloud. You actually need that to happen across a 5G network, and for that to happen at the edge, you know, so we can have that immediate decision-making capability. So it's really important that we take both 5G and edge compute capability, combine them together, and that enables us to offer in a mobile private network environment guaranteed service levels to ensure those applications work in real time.
Thanks for that. I guess the next question really is probably for me. I think Chung Chong asked the question about what are the ethical implications when a procedure were to fail? Will it fall upon the acting surgeon of the virtually dialed in surgeon from elsewhere too? Or can we, in fact, blame the network, Danny? I'm just, of course, looking from that perspective. So from my perspective, having streamed many live operations in the past and done remote working, I think this area needs some work on. I think Danny mentioned the autonomous car industry, and I look forward to that. I look actually quite excited about what they're doing, because they're asking the same questions. If, for example, a car fails, if it's autonomous driving like a Tesla, for example, who's at fault? Is it the software? Is it the company? Is it the person who's supposed to be driving the car, but autonomously? So those kind of questions are already been asked in other industries, and that's why it's important to work around other industries. And those questions, the difficult questions, hopefully will help us in healthcare work out our own answers. I think ultimately it has to be, of course, that there's some responsibility from the surgeons themselves and also the hospital or the platform you're working on, so that you will share that initial responsibility to make sure it's safe and effective before you start doing the remote operations. So I think it's about being slow and methodical, as well as using the speed of technology at the same time. So I think it's a mixture of both. There's a lot of other questions we'd like to ask you, Danny, whilst we've got you here for a few minutes, if you don't mind. So there's obviously a lot of question in the kind of Western world around security concerns. We've seen that, the involvement of Huawei in terms of their 5G technology infrastructure, a lot of people pulling out from their ecosystem. What risks exists at the moment, and how is Vodafone mitigating some of them?
So we currently don't see any risk at the moment in terms of the way in which Vodafone is deploying its 5G networks. Of course, we're working really closely, Shafi. It's a good question. We're working very closely with the UK government and following their guidance. So just in line with their guidelines, Huawei will not be used in our non-core infrastructure. And of course, Vodafone has never ever deployed Huawei in our actual core network. So therefore, following the guidelines from the British government in terms of the how we should and shouldn't use Huawei, we don't see our 5G networks impacted in any way.
That's really good to know. I'm sure reassuring for the audience, obviously, around the future of 5G. The other thing is whether the whole 5G, the whole country is connected through 5G, or there's still dead zones. I mean, what are your thoughts around that at the moment, Danny?
Yeah, so look, we're all operators in the UK are in the middle of deploying their 5G networks across the country. So we have 55 major locations across the UK covered at the minute from a 5G perspective, really going after the big population centres, and then we roll on out to the rest of the country. But remember, just as I mentioned earlier, Shafi, 5G comes in very different forms. So that's very much with regards to the public 5G network. That's what you and I would use if we picked up our phone, had a 5G phone, and we were streaming some services across the 5G network. However, the 5G that we're really talking about here, when we talk about autonomous vehicles, or we talk about healthcare use cases in hospitals, when we talk about the advancements of the technologies that can really transform industry, we're really looking at very different 5G schemes. Those would be dedicated 5G schemes, such as an in-building 5G scheme, which we would connect to our core, or a mobile private network dedicated to the customer's applications, and again connected to our core. And in that scenario, Shafi, there is no part of the country that we cannot cover today with that type of 5G connectivity. Regardless of where the building is in any part of the country, we can bring 5G for that deployment. And
that's so important in healthcare, of course, Danny. Obviously, as we have this digital revolution, there's vulnerable people out there who may not have access to digital technologies. How do we encourage them? And if in the future we can have that connectivity across the UK, it gives rise to an equitable structure for healthcare. So thanks for clarifying that. We've also seen in the press and sometimes conspiracy theorists, Danny, around the health impacts of 5G. Are there any negative health impacts in 5G that you're aware of, Danny?
Yeah, it's unfortunate that 5G got off to a bad start. I suppose globally, in terms of some of the negative things that have been said about it, but the reality is there's no single study has been able to show a single adverse link between 5G and health. And in fact, the World Health Organization themselves have concluded the same, that there is no known risks. So we're very, very confident that 5G, it's a spectrum no different to 4G. It gives us better benefits in terms of speed and latency and bandwidth. But yeah, there is no impact to health in the same way that there's no impact to our health from 4G.
Yeah, I'm glad you said that. And I've also read up widely on this. And I can honestly say, as a doctor, 5G doesn't appear to have any negative impacts in all the papers I've seen so far. So I'm very reassured that this is certainly going to be part of our future. The other, I guess, area is around the collaboration with government. So how can the government help speed up the adoption of the technologies like 5G in the NHS, and perhaps your experiences of how you've navigated our healthcare system?
Yeah, I mean, it's an interesting one, actually, and there's almost a pre and post COVID conversation to be had here. I think pre-COVID, we've seen a lot of government push into not just healthcare, but all industries in terms of the adoption of 5G in some way for transformative outcomes. Of course, we're in a global race against other countries in the world who are also doing the same to transform industry, leveraging the new capability that 5G offers us. And therefore, we did see, and the government has been very active in this space, so there's circa £65 million worth of investments pushed in through a number of programs. We had Innovate UK, we had the DCMS part-funded programs across the UK into every industry vertical. But interestingly, what we've also seen, Shafi, is that was very much pre-COVID. During the COVID pandemic, we've seen a massive pull from industry, in particular healthcare, manufacturing. There's a number of industries that were saying, okay, how can we use 5G to transform our services? How can we do remote production line monitoring, for example, in manufacturing? How can we do remote assisted surgery, for example, in healthcare? So the government have been very, very active, in terms of enticing the industry to have a look at this technology. But I would say the pandemic has actually made everyone think differently around how can we leverage this technology for good, how can we transform our industries, and how can we move forward, delivering, for example, healthcare in a very, very different way, leveraging 5G. So it's an interest in both push and pull.
Thank you for that. Obviously, one of the most important people involved in healthcare is, of course, all of us, the patients. So do you have any evidence from the patient perspective from Vodafone? I know you've done some work on this already, around their attitude and response towards technology for conducting consultations and delivering treatments and operating.
Yeah, so we have absolutely looked into that, and we've produced a report that's available on our, in fact, I'll share a link in the chat group, in terms of patients' behaviours, in terms of their willingness to accept healthcare and healthcare provision being delivered in different ways. I think patients are quite keen to understand actually how they can access services from their doctors or hospitals from home, and especially patients with acute illnesses. How can we stop those trips to the hospital? How can we remove those unnecessary journeys? How can we give access to, for example, GP surgeries, through video conferencing? Remember, we're moving into a world where 50% of the workforce are millennials today. They expect to engage in a digital format, and that is true of the healthcare space. So through 5G, whilst we have seen a number of trials across as a result of the pandemic, we've seen a complete willingness to accept new ways in which you engage healthcare, and that's exciting for all of us, because I think it gives the opportunity now for us to rethink how those traditional services that have been delivered through the same channels over a number of years, how can we rethink those? How can we take the technology advancements and make patient care easier to deliver a better outcome for patients?
Thank you for that. I'm really glad that you've engaged the patient population. It's one of the great things about Vodafone, having the stakeholders together to kind of redesign, reimagine what healthcare looks like in the future. I think our last question we'll ask an audience, which is Dr. Gurpinder Singh Baidwan, who asked us a question around 5G rollout. The initial costs are quite high. How the networks ensure that the use of this technology will not lead to postcode lotteries or increasing health inequalities? I think you alluded to that in one of the other answers, but if you could address that again, that'd be great.
Yeah, absolutely. I mean, it is a really important question. So 5G will eventually be available from a public network perspective across the entirety of the country. But of course, we don't need to wait for that in terms of delivering a number of services to patients today. We can use 5G as the springboard for us to rethink the way in which we can deliver services. And of course, when you're a patient at home receiving patient care from home from your local practitioner or whatever it may be, it actually could just be on Wi-Fi or broadband. But to bring it back to 5G, in order for, we kind of touched upon this previously, I can deliver 5G in very different formats. formats. We have, of course, access to the public 5G network. However, we can deploy 5G, for example, as an in-building coverage scheme into a hospital in a very remote location. And for example, we can convert simply just one operating theatre, and the cost is not expensive. You know, we are in just the tens of thousands, not hundreds of thousands of pounds. So I think there is certainly a view that this will be prohibitive in terms of cost. It's incumbent upon the network operators to find a way in which we can deploy this technology in a scalable, flexible, and secure manner. And we've done a lot of work in the background. So you heard Anne up front saying, let's work together. Let's think about, okay, how do we prove out the business case? How do we, for example, deliver just one 5G hospital bed, or just one operating theatre, or just one connected ambulance? And let the hospital understand what's the return on investment, does this pay back, and actually can we make this scalable? And therefore, we have to work with the application providers, ourselves, the network operators, and of course the procurement teams to understand how we can do this together. But we completely understand the need to do this in an agile and iterative approach.
Thank you so much. That was really a good way to, of course, finish out our conversation. So I'd like to thank, of course, the Vodafone team and also, of course, you, Danny, and Anne and the others to really support healthcare going forward. I love the ambition from Vodafone. I love the fact that you're trying your best to improve patient outcomes and actually doing it in the right way. So hopefully our audience have enjoyed that. I'll leave you with, of course, a Churchillian quote, because this is not the end. It's not even the beginning of the end, it's the end of the beginning for the world of 5G and going forward. I'm so grateful for share all the work that you're doing and good luck, of course, with the team in the future. Thanks, Danny.
Thanks very much, Shafi.
Okay, so I think we're finished there. Danny, thank you so much for that. That was really good. It was a really good session. Honestly, I really enjoyed it. I was watching the videos and it was just brilliant. And I think our audience really enjoyed it as well. Some of the comments coming through, just being amazed at what kind of work you're doing. So that's great news.
Brilliant. And can I just ask, do we know how many viewers we had actually on the main stage?
Well, hi everyone, and welcome to this fireside chat as part of the series Giant Health with key opinion leaders across the world, talking about their role during the pandemic and also their vision on the future of healthcare. It's a great pleasure to introduce our guest today, who's Giles Platford, who is the president of Takeda for Europe and Canada. He spent 20 years working in the industry with Takeda. For the last 6 years, he's been on the executive team. So it's a pleasure to see you today, Giles. Thanks for joining us.
Thank you, Shafi, for the introduction and again for the opportunity to be part of this discussion today. I mean, let me start by saying that as a global pharmaceutical leader, Takeda is doing all we can to protect the health of our employees, their families, and our communities while ensuring our medicines continue to reach the patients that rely on them. It has been a very challenging 2020. COVID-19 continues to have a major impact on the pharmaceutical industry, as on all sectors and aspects of society. And we continue to adjust our operations to manage through the multiple challenges. We're experiencing a heavy strain on the global supply chain due to unprecedented demand for medications to treat and manage COVID-19, as well as for other chronic diseases such as asthma and diabetes. And this has also triggered, panic buying and stockpiling practices. And as a response, the industry has focused on securing product supply continuity for patients through resilient supply planning and management. And companies are constantly monitoring global and market-specific demands for their products and take all inventory decisions carefully, because supply disruptions, as you well know, can affect patients globally. From an R&D perspective, more than 1,000 clinical trials have been disrupted on a global level, meaning potential delayed approvals for non-COVID related pharmaceutical products. And at the same time, the pandemic has seen an unprecedented reorientation and investment in clinical trials research towards COVID-19. And I'd like to highlight here the flexibility of regulatory agencies in close collaboration with the industry, which has been absolutely pivotal. And there has been a concerted effort to increase the efficiency of regulatory processes for the rapid development, approval, and global rollout of safe and efficacious vaccines and medicines against COVID-19. We've also seen a shift towards telemedicine with less face-to-face patient-physician interactions. And we're just starting to understand the consequences of this shift, including how lower rates and later stages of diagnosis of common chronic conditions, but also cancers and rare diseases, will impact the overall health of the population. And to mitigate some of these challenges, Takeda, along with other industry players, have established home care services and home delivery and home infusion support, as well as remote therapy initiation and psychological services to ensure we don't have delays in diagnosis or disruption to continuity of patient treatment and care. And further, I would just add, obviously, that health budgets are constrained with the economic challenges that many EU member states are facing, and it's placed health systems under immense pressure. And so all over the world, health systems have needed to cover the unexpected surge in demand for hospital care with inconsistent relative increases in spending power, and leading to concerns that patients with chronic diseases, including rare and orphan diseases, have been sidelined as a result, as there is a call for relatively more investment in disease areas and treatments and vaccines that are seen to have potentially higher societal impact. So we continue to work and partner with regulator, patients associations, healthcare providers to ensure that there are no patients left behind during and in the aftermath of the pandemic, with a focus on those with rare and life-threatening conditions.
Your insights and also giving a really erudite overview of the challenges that you face and how you're potentially overcoming them. I've mentioned vaccines, of course. We're seeing the excitement around these vaccines that might come into effect for the COVID pandemic in the new year. We hear a lot of things about the new ways of working in the industry, triggered by the pandemic, essentially. Can you just elaborate more on this for us, Giles?
Yeah, sure, Shafi. I mean, indeed, COVID-19 has provided the opportunity for the pharmaceutical industry to be an active part of the solution in the battle against this virus. It's been really inspiring to see the industry come together and pool resources, data, and technology to accelerate efforts towards a vaccine and potential treatments for the virus. Takeda is involved in a number of research partnerships, industry alliances and consortia. A couple of examples include helping to establish the COVID R&D alliance of around 20 biopharma and biotech companies and venture capital firms who are collaborating to rapidly advance COVID-19 therapies and vaccines. And the group is organized around 7 working groups, each led by a different R&D leader: clinical phase repurposing, preventative vaccines, novel antibodies, novel small molecule antivirals, preclinical repurposing, data sharing, which is actually led by Takeda, and clinical trial acceleration. Additionally, Takeda is a member of the Accelerating COVID-19 Therapeutic Interventions and Vaccines Partnership, or it's called ACTIVE, coordinated by the National Institutes of Health and the Foundation for the NIH. This public-private partnership brings together more than a dozen biopharmaceutical companies and international government agencies to develop a collaborative framework to prioritize vaccine and drug candidates, streamline clinical trials, coordinate regulatory processes, and leverage assets among all the partners to rapidly respond to COVID-19. We've also co-founded CoVIG-19 Alliance for the development of plasma-derived hyperimmune globulin, or HIG. The spirit of collaboration has gone a long way to advance science, which has reinforced trust in industry from stakeholders. And I hope that with this positive trend, industry will be seen as a true and valued partner to health systems around the world, not just during the pandemic, but post-pandemic as well.
One of the key words you mentioned there is collaboration. We've seen how industry now and healthcare is coming together like never before to really accelerate change and to bring new ideas to market. So I'm really glad that Takeda is very much part and parcel of that forefront of change for us. So thank you for the work you do, of course. You mentioned the Takeda's involvement in the CoVIG-19 Alliance. As I understand, this collaboration is unique in the plasma industry. Can you elaborate more on this for us, Giles?
Yeah, sure, Shafi. I mean, of course, together with CSL Behring in early April, around about that time frame, we formed the CoVIG-19 Plasma Alliance, as we realized we could potentially save more lives and do so faster if we could bring together others within the plasma industry. And we've seen this in other areas of the pharmaceutical industry as well, this really strong sense of unity and collaboration. And this is a unique partnership of leading global and regional manufacturers of plasma-derived therapies who have deep experience in discovering, developing, and producing these vital, life-saving and life-sustaining treatments. The scope of the alliance activities include combining our collection of antibody-rich plasma from COVID-19 survivors, the clinical development of hyperimmune globulin through a single clinical study to be done in conjunction with NIAID, a potential commercial manufacture of CoVIG-19 if proven safe and efficacious, and of course regulatory submission and broad distribution. And I'm pleased to confirm that patients are now being enrolled in the NIAID-NIH phase 3 clinical trial evaluating the safety, tolerability, and efficacy of hyperimmune globulin HIG to treat adult hospitalized patients at the onset of clinical progression of COVID-19. I think this global multi-center, double-blind, placebo-controlled randomized trial will enroll 500 adult patients at up to 58 sites in the US, Mexico, and 16 other countries on 5 continents, including the UK, utilizing the NIH's Global Insight network. So it's a significant undertaking, and an important alliance principle should be this investigational medicine, if it were successful, is equitable in terms of access and wide distribution. There's no mechanism for profit. So frankly, it's extraordinary just how much we've managed to achieve in such a comparatively short time frame by pulling together leading players in the plasma industry, pooling resources, knowledge, expertise, technology, and capacity to be able to do this in record time. So I'm very proud of this alliance.
And I think it's amazing. I mean, the fact that you mentioned the fact that profits weren't a huge problem here. You want to do the right thing for the world as a whole. You're collaborating. And what you're doing is showing how you can bring partners together and also scale very quickly and at pace, which is essential during the pandemic. So we, as a mere clinician here, I'm just so impressed by the way the industry has got together to fight one of the biggest challenges of our lifetime. So thank you for that. So what other lessons can be learned from the industry as regard to these collaborations that you created? Charles, I'd like to know a bit further on that.
Well, I think as we've spoken about, Shafi, I mean, COVID-19 has acted as a catalyst for innovation and collaboration between pharmaceutical companies, with the public sector, academia, the medical community. So I do hope that we'll continue to see that trend of strong collaboration and the industry being seen as a valued partner to the healthcare community continue well beyond the pandemic, and we leverage those learnings. I mean, such partnerships must have a solid framework based on transparency, collaboration, and standardization, as well as clear goals, a common purpose, so that they can happen as fast and as effectively as possible. Transparency speaks to the need for data sharing related to clinical trial programs. Given we're all working to find a treatment option with the same goal, sharing our data rapidly should speed up collective development efforts. Collaboration is necessary as we do need the support of regulatory agencies to facilitate testing and approval of vaccines and treatments. And Takeda and others are focused on providing our treatments as quickly as possible to as many patients as possible globally. To bring this to reality, we need alignment among governments and international organizations. I think the industry has approached this crisis focusing on research, data, and information sharing, and adapting where possible existing resources. I believe the acceleration of innovative ways of working combined with the industry's digital transformation provides a unique opportunity well beyond the COVID-19 pandemic to collect real-world evidence and substantiate the value of our products and the value that they bring to patients and society. And I really feel this trend of collaboration and partnership within the industry, and of course between the industry and the healthcare community, and including the public sector, is going to be critical for that trend to continue.
So one of the things obviously crucial to this is around data. You mentioned it briefly in your last statement. So and that's a passion that I have in terms of healthcare and how we share data appropriately at the right time. Sometimes we don't have the right conversations with the key stakeholders. So I'd like to get your views on this as a CEO of a major pharma company around data sharing. And how do you see the future of the health data infrastructure way beyond COVID-19?
Well, yes, I'm Shafi. The unprecedented challenges brought by COVID-19 pandemic has undoubtedly led to the acceleration of industry's digital transformation, especially in using digital technologies to further innovation, but also in transforming patient care and healthcare delivery. As a next step, integrating data sets is integral to designing the health data infrastructure of the future to deliver a more value-based healthcare model. And I'd like to mention, if you don't mind, the recently launched Health Outcomes Observatories Initiative, or H2O Initiative as it's called, as an example. This is a project that Takeda co-leads along with the University of Vienna. H2O has brought together 23, I think, world-leading institutions, including university hospitals, patient groups, public sector, and the pharma industry. And it's the first endeavor ever to collect and incorporate patient outcomes into healthcare decision-making, both at an individual and population level across multiple jurisdictions in Europe. So it's about putting data into the hands of patients and patient data at the heart of healthcare decision-making. So for healthcare systems to be sustainable in the future, it'll be critical to focus resources on what happens and what matters most and what creates true value for patients and societies. While value assessments have made their way into the armory of decision makers, there are still many gaps before the healthcare systems across Europe, particularly, can be truly considered value-based. Report after report from the Organization for Economic Cooperation and Development and other independent organizations stress the huge amount of waste in healthcare, often linked to silo budgeting or lack of transparency around outcomes across the continuum of care. And so this H2O project is a novel approach to empowering patients to improve their outcomes, and the public-private consortium brings together scientists, clinicians, professionals, and patients who will design and set up independent patient-centered observatories. And with input from patients, providers, and healthcare decision makers, these observatories will collect data and provide information not only for individual clinical care, but also for evaluation of new technologies and for healthcare decision-making. And each observatory will in fact be an independent, not-for-profit entity whose mission will be to safeguard patients' health data, ensuring the highest level of integrity and data security while creating transparency of patient outcomes. The project will set up observatories initially in 4 countries, and will set up each national observatory as an independent entity within 2 years. And the first patients will benefit from the information soon after. And we'll ensure these observatories become integrated into the relevant national health system. As a program, H2O, as it's called, is being established so that it's capable of scaling up to more countries and more diseases in the future. And we'll create a European umbrella observatory to oversee and coordinate this. And the focus initially is on 3 disease areas: diabetes, inflammatory bowel disease, and oncology. And the primary aim of this initiative is to provide patients and their healthcare professionals with patient-centered information for use in clinical care. And secondary to this, the aim of H2O is to make the information available in order that patient-reported data is at the heart of broader healthcare decision-making. So I think it's truly exciting to be involved in a transformative healthcare project like this. And in short, we see this as the future of health data infrastructure, particularly in Europe, where this project is focused, and we hope to be able to replicate these initiatives across disease areas and different geographies, and potentially even scaling beyond Europe in the future. But a very exciting initiative, and a glimpse of the future of health data infrastructure.
I can share your excitement and passion there, Charles. It comes across, and it's so powerful. So I'm really excited by that. And of course, as a colorectal surgeon who deals with cancer and inflammatory bowel disease, I look forward to seeing what comes out of your HDO project. How indeed fascinating. You mentioned all the right words, of course, the value-based, the patient-centric design of healthcare, empowering patients, and having transparency of data, which I think is really great that you're talking about those ideas in the context of healthcare and your industry. So going on from that, I'd like to ask you why it's so important to increase access to this type of patient data. And how does it impact on the wider areas in which your company Takeda works?
Great question. I mean, increasing access to patient data is critical for improving quality and sustainability of care across therapy areas. This is important because patient-reported information in healthcare will enrich the interaction between patient and their physicians, and will, as a result, drive better outcomes for patients. It also provides health authorities, providers, and payers access to better and more transparent evidence of patient measures and outcomes on which to base decisions, and does so, of course, as illustrated in that previous initiative, right across the care continuum. And so that longitudinal data is really, really important. And researchers and pharma companies gain insights that can be used to support the design and direction of the development of new treatments as well. So across a number of different areas, this transparency on patient data and outcomes is so important, Shafi.
I couldn't agree more. And I'm really glad that you're head of this kind of initiative and going forward with it. And we look forward to seeing what comes out of it, essentially, as well, to learn from what Takeda's been doing and how others can learn from your examples. I guess the next question is really around one of Takeda's main interests, which is rare diseases. And given the fact that is your focus, what are you doing outside of your COVID-19 response to ensure the needs of those kind of patients with rare disorders are not sidelined during these challenging times? We've seen the interest in cancer, mainly our hospitals. We've seen a slight change in the way we work to remote working, and some patients do feel disenfranchised by not being seen at the right time. So I'd love to get your views on how you're managing those patients.
We recognize that COVID-19 has brought immense challenges for our society and healthcare systems, and of course it's impacting all areas of society. But and of course our primary goal or priority, if you like, at this point in time, as with many other companies in the pharmaceutical and biotech industries, is around developing a potential vaccine, and or treatment for COVID-19. But we're also keeping our focus and commitment to discover and provide treatments for other underserved patient populations. And of course, Takeda is a leader in rare and orphan diseases globally, and large part of our pipeline of innovative medicines is also catering to address high unmet needs in these underserved rare and orphan patient populations. And so therefore we continue working with multiple stakeholders to create solutions to further improve the rare disease ecosystem, from diagnosis to access right across Europe. And this is why we developed, together with Eurotas and Microsoft, for example, a global cross-sector approach to overcoming the barriers to diagnosis for children with rare disease. For a child with a rare disease, an accurate and timely diagnosis can be the key to a longer, healthier life. And these days it can take up to 5 to 8 years for a patient with a rare disease to get diagnosed. So that's why we brought together a multidisciplinary group of experts with the creativity, technological expertise, and commitment required to make a difference in the lives of millions of children and their families. 1 in 17 people in the world will be affected with a rare disease, and 95% of rare diseases don't yet have an approved treatment. So a lot of work to be done, to improve diagnosis, and this is where these kind of collaborations can be very, very important. Another initiative I'd like to mention is the Real World Evidence for Decisions partnership that we are exploring, where we're exploring how real world evidence can support payer and HTA decisions about highly innovative technologies in Europe. The vision of this group is that stakeholders agree what real world data can be collected for highly innovative technologies, when, by whom, and how, in order to generate real world evidence that informs decisions by healthcare systems, clinicians, and patients. And it is quite normal, that when an innovative medicine for treatment of an orphan or rare disease gets regulatory approval, that it may get that on a relatively more immature data set. And so there's work still to be done to build out that data in a real world setting to enable appropriate valuation and reimbursement and access for that drug. So it's really important that we reinforce the need to leverage real world evidence to enable earlier sustainable access to innovative medicine for orphan and rare patients. And we believe this approach that is based on evidence and that provides predictability while securing access for patients to solutions that will truly benefit their lives, this is going to be a win for all involved. Therefore, it's vital that we work together to improve access to existing medicines, sustain investments in development of new treatments for rare diseases.
What incredible insights we've had in the last 20, 30 minutes or so. And I've learned an awful lot about your strategy, your direction, and what you're bringing to the table almost in terms of managing both patients with different disease processes and those rare diseases as well. So thank you so much for sharing those unique insights from that perspective. I guess the last point really is for our audience is really to share perhaps a closing message, something that you might feel really important for our audience to hear from your perspective as president of a very large pharmaceutical company who's been really at the forefront of change, the forefront of this management during the COVID pandemic. What are your last thoughts, Charles?
Once again, it's been a great privilege to be here speaking with yourself. And when I joined the pharmaceutical industry 20 years ago, the motivation for me was to be able to make a difference in the lives of others. And frankly speaking, for the past 9 months, I have seen the industry step up to this challenge in an unprecedented way. And I'm immensely proud of being part of this community and the collaboration that's been shown and trust that's been built over these periods. These times are not easy for anyone. We've got a long way to go, but I'm truly humbled by the way my colleagues continue to be engaged and determined to respond with urgency to find a vaccine and treatment for the COVID-19 virus. It's important for us to leverage the learnings on how we have been collaborating to keep the digital acceleration momentum that we've seen during the course of this year, as we continue to focus on doing the right thing for patients and public health during and beyond COVID-19. I think as healthcare leaders, it's a privilege to be able to bring the right voice and capabilities together to create rapid impact and contribute to the greater good. And it's a really pleasure for me to be able to share these thoughts with you today, Shafi. Once again, my thanks for the invitation, and I hope you found the discussion also to be insightful.
An amazing, really, truly remarkable conversation I've had with you. I'd like to, on behalf of the audience at Giant and myself personally, thank you and your particular team for really helping us navigate through these difficult times. We obviously it's been challenging for all of us, but now that we've seen this kind of collaboration, your ideas, where you've accelerated change for us, you're helping doctors like me in the front line have an easier time going forward. Hopefully we'll see the back of the pandemic fairly soon with all your innovations and hopefully your therapies going forward. So thank you so much, Charles, for joining us, take out some of your precious time to join us at Giant. We're so grateful. Thank you so much.
Very happy to be here, Shafi. Thank you.
Well, hi everyone. It's a pleasure to be here again for a fireside chat with our guest, Professor Marlies Schreeman. Marlies has been at the forefront of healthcare education and technology for a number of years and holds the position of Professor of Surgery at the Amsterdam University Medical Centers, as well as being an academic. She's also part of the government. She is currently the Chief Medical Information Officer for the Dutch government. So we'll explore all of these going forward. So Marlies, thanks for joining us.
Thanks for having me.
I guess the first question really is, how is the COVID pandemic affecting the Netherlands at the moment?
Big question, right? Yeah, how is it not? You know, the whole society is disturbed, as well as healthcare is, and you know, we're trying to cope with it as best as we can, both in terms of caring for our patients, as well as caring for our students who are striving to become a medical professional in restricted times. So yeah, it impacts every level, but it also generates another kind of dynamic, which makes a lot of creativity flow and flourish.
And we've seen that with, you know, the pandemic has accelerated change, of course, and allowed us to innovate much more rapidly with less regulation and more, I guess, interest in innovating quite fast, it seems. The Netherlands has always been, in my opinion, at the forefront of innovation in healthcare. To many conferences where people have spoken about the kind of the creativity and the desperation to move further forward. Can you give examples about what you're doing as CMIO, for example, in that role?
Yeah, I guess we have to, because we're so small. If we risk getting trampled and unnoticed if we aren't creative and reach out. In terms of collaborations, in terms of language, in terms of, you know, we have to, and it has become part of nature, of course. The Dutch have been very explorative since you know, since ancient times. So that makes it part of our genome, I would also almost say. And coming back to your question about CMIO, I think, you know, I think our government became more courageous in these times, more courageous in terms of openness, in collaborating also with people who criticize them a lot. There's much to do and much to say about things like the Corona Melder app, you know, and it's not so much about being for an app or being against an app, but to engage into the public debate and try to make you know, make ends meet and incorporate everyone's opinion if it makes sense in order to get to the next level. And for my work, I've worked on the, in Dutch it's called ziekenhuisbed checker, which is unpronounceable. So it's called hospital bed checker, in which every professional has access to a website where you can see for yourself how many beds there are in the hospitals, if there are COVID or non-COVID labeled, if there's opportunity to welcome patients in the hospital or not, you know, to see the pain points. And that takes courage of hospitals to open up for that. In the other end, it helps in better registration because it's all out in the open now. And it helps in the public debate, which patients have to go where, you know. So yeah, I think these times help us to become more mild, to better understand each other's needs, and to better understand how technology can help us.
Yeah, so I think that's amazing. The fact that you've led a transparent process of showing real-time data on hospitals and flows, etc. How do the patients cope with that? Because obviously sometimes they don't see the hospital working, its functions, capacity, and they make, I guess, influences around that. Has that helped your debate with the patients? Are they much happier now because you're seeing them?
I don't know if they're much happier. I think it helps them understand a bit better. Although, you know, there's only so much stretch in people's mind. You know, if you have to have help, and if you cannot have help, you know, in the first part of the pandemic, people applauded for healthcare workers. And now we see, you know, in the second wave of the pandemic, it's becoming much harder for people to accept that they are not being helped again, or, how to explain to a person who has a disease, if it's cancer or not, that they have to wait. And while the ORs are not turning because we don't have the staff to equip the ORs, and even if we have the staff, we don't have the beds at the ICU. So it's showing what's actually happening in the country. At least it gives them the idea that we're not hiding stuff, which helps in building trust.
And trust is so key at the moment, of course, during the pandemic. That leads me to the next question, really, around data. Clearly, you have some data there. What's the kind of attitude to the Dutch healthcare system on data? Everyone struggles with interoperability, for example, access, patient empowerment. What are your thoughts, Marlies, as the kind of CMIO, at where you are now, where you'd like to be the next 5 or 10 years?
Yeah, well, our government has not chosen for one hospital system, so they gave it up to the market, which has led to a competition, which may be a good thing, but has ended up with problems in interoperability, of course. And these times have led to more regulation on that. Because the government previously did stress on open standards, on sharing, on reuse of data, but as long as the bigger players were not forced to do so, they had a competition interest not to do so. And it's one thing to stress that data needs to be shared, but if you're not enforcing it, and if the hospital only has so many means, it's no guarantee they will do it. So that debate, the brokerage servers between the hospitals, that's a heavily debate going on at the moment. And what I think, my role, I see. Let me give an example. Last week or 2 weeks ago, I did a Zoom session with the government employees on the patient system, because they have never seen a patient system in action.
Okay.
So I created a fake patient in our actually hospital system with a fake letter of a general practitioner sending the patient to me, and I took them by the hand, so to say, via Zoom, what I need to do in order to get things done. And it was they went berserk. Because then they saw, if I have to register people as an allergy, how many steps are required of being able to capture the natural interpretation of typing language. So you have to search for the right tag instead of the system helping you. So, I see my role as a enabler, as a, to give people insight on each other's challenges. And I think it's very courageous of our government to embrace a critical person like me into their system.
Well, you're the right person to challenge and ask the right questions. And I'm glad they shared your frustrations on turning a computer on and going through the electronic health record and navigating through the different that we all face, which is quite important. So I guess the next question really now is, okay, what are the key challenges you set yourself, or the government set themselves, where you're part of that kind of long-term problem-solving solution? So say next 5 or 10 years, where do you think you'd like to be in terms of and what the key challenges are for the Dutch healthcare system?
That's a difficult question. I don't think it's wise to keep people too long in such a position at one place. It's honorable, and it's it brings you places, but I think for the system it's good to have a changing viewpoint on these matters, because that helps bringing things forward. You shouldn't keep a person too long in one place. So I hope I can give them insight and make myself not needed anymore, because the insight has landed. And how long that takes, I really don't know. I think we just started. Of course, you need some time to do the job. So in my perspective, anything between now and 5 years or something is a good time window for that. And I think it's important for people to understand we're not each other's competitors in getting better healthcare to patients. We only have different viewpoint angles, but in the end, we all have the same interests. And it needs to shave a little bit against each other to get the sparks and to light the engine and to fire up things. But I think the mutual understanding and respect, and to be able to step into each other's world, virtually or not, is important. And that's why I admire your work a lot, Shafi, bringing people together and using technology that, in my perspective, is not cold but very warm, in showcasing, in inspiring, and also in helping build relationships between people across boundaries.
Talking about building relationships, one of the key things we found during the pandemic in the UK is that there's been much more close relationships between industry and the public partners. In fact, we have companies coming in who are much more able to come in and help deliver some healthcare services with the NHS. Are you finding the same in the Netherlands? Is there closer collaboration? What's the relationship with industry at the moment?
It varies a lot. There's a difference between. I think there's a huge array of in that scale. There are startups. There are people who just getting by with some seeding capital, and there are the big industry firms. In my country, you have to disclose everything, which makes it, in terms of transparency, we even have a transparency register in which you have to, to settle every relationship you have. And what I sometimes find a bit painful, but that's how life is, I guess, is that some smaller firms might have very good ideas and very bright, who are unable to land in our healthcare system because they're so small. And then again, you see the bigger pharma tech who is eager to almost, spy on every initiative in order to get the best out of it for themselves. And, I know that's how the world works. And, the bigger firms are eager to look in our OR also, where we have settings who are to explore things. And you see them scribbling on their notepads and taking things back to their firm, while the people I work with are often small industries who have a bright idea. And that to me is a delicate balance in bringing small technology forward and having to lean or wanting to lean on the bigger firms in order to get things done. I guess that, I guess you understand what I mean with that.
Of course. So I think the other thing around this is that, of course, you've been a great protagonist for mHealth for many, many years. And I think that's how, when I first met you a while ago, when you experimented with Google Glass and technologies and that kind of thing. We're now moving to e-health. And what the COVID has shown us is that patients now can be monitored more at home, whether it's asthma, diabetes, or other chronic diseases. Are you seeing the same transitioning of patients from secondary care to primary care or remote care, as it were, in the Netherlands?
Yeah, we do. There's a lot of interest for that also. I think in this case, it's not so much the technology that limits. It's the way that our infrastructure is not built around it. I mean, if patients are wearing, for instance, let's say bandages or stickers monitoring their heart rate or whatever, and they feel protected because they're wearing technology that's able to grasp their vital signs and is able to send their signs to a place, we have a lot of questions not solved around that a place. What happens with the data? From whose data is it? Is it on safe servers? What happens if a patient has, for instance, a heart attack at 12 at night? Is someone going to read out that data? Is someone getting alarmed automatically? Are there AI algorithms that are safe? Are they ethical? Are they able to bring back that information to the patient health record? And who is liable if a patient gets a heart attack at 12 at night? Those questions, much more than the technology, is what we need to solve.
I think you're right. I think we're all struggling with the same kind of problems. And I think one of the things the pandemic has shown us that we are creating global solutions. One of the things to think about going forward is how do you learn from other countries, other experiences that you can take back and hopefully share commonality going forward, which I think we all share the same frustrations, of course. So I guess next really question is around your thoughts around technology as a whole. I know you've done some amazing work, by the way, one of the real leaders in technology and healthcare around the world, particularly as a surgeon, of course, with a busy full-time career. So technology is obviously transforming our lives. Do you think technology has the ability to make us more human, Rahmanis?
Yeah, I think if well fitted, it does. But those are three words that are very important. You know, I think technology can augment us in a good way, but also in a bad way. A mobile phone can be a great help and can also be a great distraction. So it's about fitting things in a process that helps bring the process further. And sometimes that's technology, sometimes that's something else. I think technology is an asset as well as you know, a human hand is, or a good nutrition is, or it's part of a, you know, of a toolbox, but you need the right hammer to nail the nail. And you know, just having a very shiny, gleamy toolbox makes you parading around like a kid, but in a sense, it doesn't help you build a house. You need skills to work with it, and you need to choose the right stuff. And I think on that level, we need to, we can still offer people a lot of help, and people need a lot of help to be able to work with it.
I think you're right.
I give an example. I'm sorry for that, Shafi, but you know, if I'm what boggles my mind, for instance, that in our hospital I have to do several e-learnings or trainings on important things like you know, if household violence I have to do training about, and I have to do a fire extinguisher training, and I have to, you know, all kinds of trainings. I never ever had a training how to work with the endosuite. Or, you know, I never ever had a training about, you know, equipment that I use in the OR. I even didn't have a training how to work with the hospital bed that I'm still unable to lift the head and you know, the things you work with in daily life, and which we have to be able to master. You know, we have this strange perception that it comes naturally to us to work with those things, and if shit happens, and shit happens, then we all look at each other how to fix this and press every button, and you know, and in the end it either works or we get something new inside the room. That's how we work.
And that's because we should be, as you say, be thinking about how to bring the workforce of yesterday into the future. We've seen some change over the last 9 months. We changed the language, of course, of workplace in terms of technology. And I agree, technology is an enabler. It provides solution. It's not the only answer. It's about kind of change management of society. So if we're going to create a more digital workforce, how do you think we're going to be? What do you think we should be doing in terms of the students, the trainees, the healthcare workers? How do you bring digital literacy much more to the masses in healthcare?
I think we need to take ourselves seriously and to acknowledge that we don't know a lot about what we just talked about. And, you know, all of us are eager to learn, but none of us are eager to being taught or to have to do exams. You know, we can grow as a society in helping each other understand that we deserve this type of knowledge, and we need to, you know, to be able to get this type of knowledge and to invest in how to work with technology and learn about that, and to, you know, to bring it into the curricula, and but also to enforce it, because, you know, as we have seen with simulators, there's beautiful stuff out there. People don't use it unless you make them to.
Yeah.
And if they work with it, they say, yeah, it's brilliant and I have fun and I'm getting better. And, you know, once they experience it, they say, yes, I am very good. I didn't want to miss it. I'm a bit, but, you know, they talk, we assumed when people would have had that experience, it would spread naturally and people would talk about it and their peers would engage in. That's just not the case.
Yeah.
And we also need to acknowledge that.
I think you're right. I think allowing just diffusion to happen isn't good for a government or a healthcare system. It has to be proactive. It has to be embellished into kind of curriculum and models of care. So I'm totally agreeing with you. And I think we've got a lot to do globally on how we change the language of healthcare so that it becomes more relevant for today's society. I'd like to ask a kind of a question around your research, actually. I've always been fascinated by the wonderful work you're doing with the kind of black box, the OR black box, if you like. Can you share what that is to our audience and what it might mean in future for kind of surgical practice?
Yeah, it's not my invention, not by far. It's the invention, or it's the work of Theodore Grangerov that we implanted in our hospital. But implanting technology is, you know, research in itself. And what we did, we have a close collaboration, and we decided to use the black box, which is actually, you know, an overview monitoring system of different data sources. And you have to define your use case. Your use case can be looking for error, can be optimizing workflow, can be, you know, thinking about what to use and what not to use, equipment failure. But we chose to use it for very primal questions, namely, are our hospital employees at the OR satisfied with using an OR black box in terms of looking at the output it generates? Can we use the output for team debriefing? Because we don't do team debriefing with the people at the OR. And the best way to build stronger teams and to reduce error is to understand each other better. And for that, you need a template, because if you do a team debriefing and have everybody, you know, recollect from their experience and mind what happened, you get 10 different versions. And it's very hard to get to a common denominator if you don't have an objective underlier of the discussion. So we used the OR black box to bring back every OR to 10 minutes template, in which there was basically a storyline, and which you could go back to situations in which there was either confusion of language, or confusion in understanding, or you know, a technical error, which does not necessarily mean there has been an eventful situation, but there has been a situation to talk about. And that we did. And you know, there were, I believe there were, I have to do this from memory, but there were over 100 persons exposed to the system or working with the system. We tried to get very critical people who didn't want to work with it inside this environment. And 89% was very satisfied with the use of the outcome report for the purpose of team debriefing, because it helped them to express their concerns. It gave a voice to people who normally don't speak up, because the team debriefings were led by a psychiatrist in order to keep the surgeon and the anesthesiologist at bay, and also have the intern have their say. And that, you know, I changed my surgical routine after the second time I was in that black box environment, based on a remark of a OR nurse who would not have spoken up to me in a good way if we didn't do the team debriefing. So that for me was such an eye-opener that, you know, I became a very big advocate for the system. Although I must say our hospital has been very courageous. It was the first in Europe to do this. I had to go to, you know, to the minister to be able to film our hospital employees. I had to build in, again, that's the set of rules around technology that I had to ensure, because you cannot videotape hospital staff. So we had to go for privacy by design, to blur from from capture of imaging, not post-processing, you know, all those conditions, which has been a journey in itself. And I learned so much from it. And, you know, we have one system now. We were looking towards install in all our ORs, but unfortunately, COVID has thrown a lot of dust into this times. You know, our hospital finances have gone down. So we are looking for creative ways to enable some of our ORs with it. And that's how it is now.
Incredible. Yeah. So good luck with that after the pandemic. Hopefully you can disseminate some of the information to other parts of the world. So we talked a bit about data, we talked about the OR black box and how you've used that transition some of your ideas and practices. That lends itself to a natural conversation around AI, of course. In the UK, we have been now quite proactive with NHSX and the AI labs being set up and a lot of funding being given to companies who are going to be using AI in healthcare here. What's the situation of AI in the Netherlands? Are there user cases? Is it being embraced? And perhaps share some experiences of what you've seen so far.
Yeah, well, AI is like, you know, 10 years ago, everyone was on the VR and then it became on the AR and now it's on the big data and the AI, with a few people understanding it, including myself. You know, it's a whole world out there, you know, it's the neural networks. And I believe, you know, for pattern recognition, AI will be the next thing. That being said, I also think that it's very, very, very important to ensure that we need to keep on thinking using AI. AI will do a lot of, you know, hard work for us, but we need to keep on thinking what it gives us back. Because otherwise we rely on stuff we haven't control over, because then it controls us. And you know, an AI algorithm isn't smart in itself. You have to build it. There will be errors and bias and flaws inside it.
Sure.
You need to have a regulation system, you know, evaluating AI, being able to deconstruct and construct. You know, that there's whole science around it. And if it's on purely pattern recognition, like for instance, radiology imaging, or you know, where interpretation might be less difficult, so to say. I hope radiologists won't murder me now. And then you know, making decisions built on more fluid information. Yeah, I think in those areas, it will help us a lot. But you know, another example is, for instance, we have in the Netherlands an app that recognizes health skin problems, and in many cases it's able to you know, to see or differentiate a good mole from a bad mole, a melanoma from a birthmark. But you know, if there are so many conditions alongside, if the light of the monitoring is not well, if someone doesn't take the picture well, if it's blurry, if it's whatever, if it's misdiagnosed, you may even have a bigger problem than a doctor who missed their diagnosis in their own setting. What do we agree upon? That's the basic question. What do we allow? And you know, technology is able to do a lot, but how do we set our rules working with it?
Sure.
And you know, that's a big question, and that can only it's like discovering a new language or you need to understand the language, and you need to and that can only be done by talking a lot, actually. So those rules and guidelines will be formed while it's being built. And the risk is that you are unable to understand faults because you don't have the word for it yet.
Yeah, I think you're right. So I think one of the key things we've discussed today is about technology being an enabler. It's going to be a great solution for a lot of things. It's not on its own. We need rules, regulations around it. We need government interventions. We need a vision and strategy. So, it's great to have you as a CMO of a country where you're thinking about change and how you administer that sensibly in a way and in fashion that also covers the ethics and the confidentiality, which you've worked for a while and is now our black box. So I think we're to the end of our session. I'd like to thank you for joining us, Marlies, from your busy schedule, and I'm sure that the audience will find your insights particularly helpful as they think about this whole area of digital transformation. So thank you very much.
Thank you very much for having me, and looking forward to our next collaborations.
Me too. Thanks so much.
Thank you. Bye-bye.
forward-looking as opposed to a sort of an unashamed shopping mall of products that you can buy today. It's a visionary event, and every year we've explored the new technology that we want to adopt into our system at Giant. And,
yes.
In the past, we've explored, as you know, adopting Alexa, and we now use Alexa as one of our means of achieving remote medication, remote care monitoring, and so forth. We launched that, sponsored by Amazon, as you know, at Giant. This year, we're launching what has been, I guess, about a 1.5, 2-year journey, which is a means to bring rewards to care. We believe firmly that why should the world of shopping in retail stores or air miles, for example, the retail world be the only world that is rewarded? Why shouldn't care be rewarded? Because carers, quite frankly, they're unsung heroes. They're unsung and under rewarded. I used to reward my mother's carers whenever they did a particularly good job, to be honest, by buying them a bottle of wine or worse. And that's not really the ideal way to do things. So we spent a year working out a way to reward anyone for care engagement. So my son is now rewarded for engaging with my mother-in-law. He used to be rewarded with pocket money. Now he gets rewarded with tokens that he knows he can convert eventually into something of use. She gets rewarded by telling Alexa that she's taken a medication with tokens. So why not reward? And that's what we tried to do. And it's very hard to do in a world that's vulnerable and needs to be secure without the use of a trust model. And this is why we've adopted blockchain as the underlying technology.
Right.
Invisible to the user and the consumer, it's just rewards, but it's blockchain that enables us to be transparent and valid in how we operate.
Superb. Excellent. No, it's an extraordinary framework. So I understand the awards proposition. Naturally, we all love to be rewarded, and we all work towards receiving incentives, don't we? But help me to understand that in more detail, please. If you could share with our listeners who are, like I said earlier, quite literally dialing in from around the world. A lot of them might not be that familiar with these rewards programs. They might not necessarily understand too much about how care works and who needs to benefit from a rewards program. Could you give us a little more detail, please? And any case studies?
Well, the rewards model is something that sits alongside the principal proposition of Remedy Life, which is that we provide functionality that supports all those that need to improve their care, whether it's my son, whether it's a carer or a care home. And we provide a suite of modules that assist in that, from activities. We provide a new activity every day. I think today's National Shoe Day. There's an activity about shoes. We provide a means to do what we're doing now. For example, I think we're probably on Zoom, but Zoom is not really the ideal mechanism because they're harvesting your data. You're not gaining anything from this. But you do need to do it. So we have our own proprietary communication video tool and many other tools, including a marketplace. But it occurred to us a year ago that at the moment, and I think it's true to say that COVID has kind of masked this reality as we all focus on the complications and problems of COVID. COVID has masked the reality that the tech giants are gaining hugely, massively from what is going on now, making a lot of money. And quite frankly, the money they're making is from such things now as data harvesting, as we are literally doing now. And from that retail margin. I mean, we all know that Amazon's profits have gone through the roof. In our view, those margins, those financial outcomes from increased digital engagement shouldn't just be winging their way across the Atlantic to Silicon Valley. They should be going where they're needed. They should be going to the individual being cared for, the carer who's under pressure and stress, to the family members who are stressed, and indeed to care associations who valiantly seek to support communities of Parkinson's, which we work very closely with. And it just doesn't. So we found a way to capture the value of the data, enable our members to manage that data and monetize it to their benefit. And also to capture a component of the retail margin in a product purchase and have that come to them as well. So everybody benefits. The aim is for it to be a win-win-win for everyone. Apart from Silicon Valley.
Yes, exactly. And so this idea of capturing the data is obviously quite clear. Thanks for that. But the idea of monetizing it, is this about transactions, or help us to understand once again, can you give us an example? Who would be an end user of the Remy Life service? Who else is participating in that little, what do you call it, transaction or ecosystem?
Well, we launch at Giant the fact that we're launching.
Brilliant.
The total ecosystem is not live. It'll be going live in stages over the following months.
Yep.
We want to gather early users because that's the way you find out what you're doing right.
Excellent.
And what you're doing wrong, probably
Yes.
in our order, to be honest. But what we're launching, you'll see, is a digital game, a fun game,
Okay.
because that's what we're all about. I mean, our internal mantra that I probably shouldn't put out over the airwaves is health by stealth.
Okay.
And what that means is you have fun, you engage, you play games, you undertake activities, but behind that, because of the knowledge that's accruing about you,
Yes.
we're able to do a better job. Carers become more engaged.
Yes.
My mother, for example, she hated the visits of the domiciliary carers because all they did every day was discuss the weather. But once they got to know her through, defining her profile on a tablet, they started taking her around to their homes for dinner. I mean, it was fabulous.
Oh, okay.
I mean, she was literally off her meds and on the gym, which in my view is a win-win. So,
Of course.
so that knowledge of the person is critical. But the point is, as I said, how do you reward people for that? So what we do is any game you play, any activity you undertake, any care process that you digitally undertake, you get tokens for. And so the tokens are for anybody. They're for the person cared for, they're for the kids, for family members. They accrue in your wallet. And then you can use them to purchase the products that are suppliers of, well, anything basically, digital hardware. Here's our ideal. My son's local school has enrolled in the proposition to be able to have their kids, including my son, create digital activities using our platform and deliver them to the local care homes over our system. The kids get rewarded in tokens, the school is community engaged, the care homes feel included.
Exactly.
Everybody wins. So
yes.
To answer your question, it's really for everyone.
Yes.
And it's all about fun with a robust architecture underneath that achieves all of it.
Fabulous. Simon, it's such a good story. I really, really love to hear more about what you guys are developing, and we're very proud to have the opportunity to feature what you guys have been putting together. What's the phrase? Overnight success comes after many hours and days and years of very hard work. But this is so interesting. Can we look at the token theme a little bit? Let's assume that there might be some of our audience who, like I said, are quite literally dialing in from around the world, who don't necessarily have a strong understanding or background in blockchain or in crypto, or do not necessarily have a pile of tokens in one of their wallets sitting in a leather pouch on their desk right now. So explain to us, what are tokens? Where are they coming from? Why would I want to have a pile of tokens? I know you've already said this, but can we rephrase it just to give it more clarity, please?
Sure. I mean, I'll start by saying that the Remy Life member will not need or even come across the term blockchain or crypto or any of that.
Okay.
It's like saying, do you know about ERP? Well, underneath any business is enterprise resource planning software, but nobody really pays attention to it. Blockchain will sink into the background.
Yes.
It becomes an enabler for lots of things that just couldn't be done before.
Perfect.
But alongside blockchain, of course, as we all know, sitting on top of blockchain is the world of cryptocurrency.
Right.
And the cryptocurrency, which we all know about, Bitcoin and Ethereum's Ether, runs on blockchain, and it's blockchain that enables them to effectively cut out the middleman, cut out banks, cut out all the cost elements,
right,
democratize the world we live in. Because if you cut out those, the city or the world of the credit card, then you're kind of democratizing things.
Absolutely.
So blockchain enables that. But
okay.
The way to think of a token is really to think of air miles, or if you go shopping in your retail store, they'll give you a reward. It's just a reward.
Okay.
And it's managed on the blockchain. And again, blockchain makes it completely uncorruptible. It's open for inspection. You cannot do anything dodgy with the tokens, and that's where the trust comes in. And if you're dealing with a community in healthcare and you're involving them and wanting to inspire them, you've got to have a trust model.
Of course.
And so we have a trust model and a sharing model. So we share the profits that come into us. So as we monetize the data for the member, as we do what we're not doing now, but would be doing on Remy Meets, the value of that is shared back to the members in terms of an ever-growing number of tokens in your wallet. Now, that's no different from in your Air Miles wallet. But of course,
I understand.
Your PayPal wallet, it's the same thing. And I think we all know that last week, PayPal adopted cryptocurrency. You can now pay in Bitcoin through PayPal.
Yes.
You may or may
Brilliant.
not know. So it's now becoming
Yes.
endemic, if that's the right word. But to
Sure.
answer your question, so that's use case number one, if you like. The token can be used for rewards, to reward a carer or a grandson for undertaking a care activity. And then that token can be used to participate in a retail purchase. But the other side of this that's really important to us is we want our members to participate in the growth of the business. We don't think it's right that an entity like Uber, for example, what made Uber great? Uber was made great by, I have no idea how many, but it's probably millions now, certainly 500,000 Uber drivers.
Yes.
Did they benefit from being Uber drivers? Did they get a chance to profit share in the growth of the? No, they didn't. They should.
No.
And I think so many businesses miss out on the opportunity to be inclusive with our participants. So our, again, key ethos is that our members will benefit, will participate in being part of the community. And so that's a second use of the token. They can participate, they can purchase tokens if they want to, and participate in the growth. So Bitcoin has gone up hugely, as we all know, in value.
Exactly.
Massively.
Yes.
So we believe that our token will, when it's listed on an exchange, will also go up in value. So if a person wants to, they can participate in the business and you know, share in the excitement that we see coming over the next year.
Superb, absolutely superb. So you're number one, you're facilitating the ability to provide care by way of incentivizing people with rewards. And the reward program sits on top of a platform, if you will, which is a token structure. And yet the people don't really have to have an understanding of blockchain or crypto or token management. Like you said, it can be as simple as how someone might currently be collecting air miles and managing and making use of their air miles. And this is all happening in the broader ecosystem of care and the provision of care. And so how do people discover your business? What are you guys doing? Do you have an engagement program? How am I going to learn about what you're offering and this type of thing?
Well, the interest has been incredibly broad.
Nice.
And surprisingly so, as you say, overnight success. Think of a care association. How does a care association generate the money they need? Well, they ask for charitable donations. So a care association might have 500,000 members. They would love to find a way to be able to monetize to their benefit their membership.
Yes.
They wouldn't monetize it unless it was done in a way that benefited the membership. So of course, our system can enable them to benefit the membership but benefit themselves, because anyone who becomes a Remy Life member will automatically sign up their care circle, their family members.
Oh, okay.
And then by doing that, they get tokens. If their family members then sign up anyone, because they will do, they'll have friends and neighbors who they want to be part of community engagement, because part of what we're trying to do is to increase the community engagement, the care circle engagement, the regularity of connection between those members in the care circle. Now in Facebook, that happens just through dopamine and peer approbation and all those elements that we know about. But we want to take the next step, where you get what you get when you walk into a retail store and buy a product. You get an actual token reward. So you know, the beginning point, of course, is the fun of engagement. My son engages with my mother-in-law now, not because of tokens or the pocket money he used to get, but because our system has identified commonality of interest. It's found they both love cats.
With the mother-in-law?
My son now provides videos through our system to my mother-in-law of cats and all sorts of things. He's getting a pleasure, pleasure of her feedback in the joy from what he presents. But at the same time, he also gets rewards. And of course, she gives her tokens to him because she loves him. So, you know, the starting point is the care engagement, the human principles of joy of human interaction when you find a commonality of topic to discuss. But the byproduct is just like when you go in a retail store, you go in to buy the spaghetti, you don't go in to get the tokens or the discounts, you happen to get them. But then when you go in the next time and you find you have got enough discounts to get that spaghetti half price, it's pleasing. So I don't
Fabulous.
want the world to think that we are all about tokens and all about money. We're not. We're all about capitalizing on the joy of human engagement that can improve quality of life and well-being. But at the same time, instead of those processes harvesting data for Silicon Valley and a substantial retail margin for Amazon,
Exactly.
shall we say,
Exactly.
we want that to pass through to our members.
Excellent. Fabulous. No, it's a very, very impressive model, and we're very excited to be involved in doing whatever we can to promote and to champion it. So talk to us about the application of the token program. So I can collect tokens by introducing you to people in my community. I can collect tokens by providing some type of care or getting involved in this type of engagement with people. And then I have my tokens, and let's say over the next few years, will there be a marketplace? Do I have to sign up and phone a broker to sell my tokens on an exchange? Or what else can I do? Again, just asking you to elaborate a little bit on some detail here, please, Simon.
Well, you can go as deep as you want on this. I mean, for example, Rishi Sunak 2 weeks ago announced to the world,
Yes.
House of Commons, that he wanted London to become the crypto center of the world.
Okay.
Which is a radical statement, bearing in mind the London regulators have been always very tough on
Exactly.
crypto.
Sure.
And right so, because over the years, it's like most new technologies, those that exploit new technologies the first are, the dodgy dudes of the world, as we all know.
Yes.
So people have traditionally associated blockchain with the dark web. In the same way, so many technologies have been exploited. Reality is blockchain is like any software system.
Yes.
Cryptocurrency is like any other currency or commodity.
Okay.
It's no different.
Yes.
It's got a bit more volatility to it, but governments around the world now are adopting cryptocurrency. And so Rishi Sunak announced a couple of weeks ago that he wanted the central banks to be adopting cryptocurrency. So we're going to see a lot of different changes. And I voice this in the light of the exchanges, because there are already exchanges. You can list your token, we can list our token on exchanges.
Okay.
But one has to be very careful how you structure the token so that it is done in a manner that benefits the member, the consumer.
Exactly.
And isn't seeking to benefit the company solely, because there have been
Yes.
a lot of instances of exploitation. And I don't think those worlds of exploitation that have prevalent in the early days of blockchain are any different than any other world. I mean,
Of course.
you can look
Yes.
across the world we live in and you'll find exploitation everywhere. So
Well, exactly.
blockchain's no different. The regulators
Indeed.
are there to ensure that things are done optimally. And of course, we have no interest in doing anything other than creating a community, global community, which is benefiting from being integrated. So the timing is perfect, actually. I mean, we could not have found a better time to launch what we're doing.
Excellent.
Thank you, PayPal. Thank you, Rishi Sunak.
Exactly.
And thank you, Barry, because you give us a voice to the world. So,
Well, very kind of you, and I appreciate that. But indeed, I guess the stars are aligning, as they say. Tell us, Simon, what's your bigger vision, let's say, for example, a year or two from now, with regard to healthcare and with regard to where you guys sit in the community, and what are the health issues and the care issues which can be addressed over the next few years by way of the REMI Life program?
Well, it's a big irony in that, our principal mission is to get people to stop using technology. Now, that sounds very strange, but what I mean by that is the mission is to get people out, to get
Okay.
people to meet each other.
Okay.
Now, a few years ago, it broke my heart that my mother's lunch club was shut down because a local authority couldn't afford to support it.
Oh, okay.
Our dream would be that the token methodology I've just described would
Yes.
enable external support services to be rekindled. Starbucks,
yeah.
for example, my local Starbucks, is keen on having a dementia group there. Why? Because they can benefit financially, but they can engage with the community.
Yes, exactly.
The rewards
Make it real.
mechanism that we've described would be a stimulator of that.
Mhm.
So we feel that what we're building can connect the world. It can enable a man in Clacton to engage with another one in California, because they both have a lot of MGs
Yes.
in a
Yes,
protected
exactly.
and secure environment.
Nice.
But that same man in Clacton will be advised of an NG event that is taking place 5 miles away. in 3 or 4 weeks' time by our system.
Right.
And his family remotely around the country will be informed of that because it's a connected system. And he will, with his family, he'll come down and visit because that's a fun event as opposed to a difficult time with the kids and granddad.
Exactly.
Everyone will gain. So
yes.
He'll be outdoors, he'll be with his family around a topic that's of interest to everyone. The NG event benefits the family, but everybody benefits. But that is through the power of technology to capture the data, the knowledge of what the man in Clacton loves.
Well, precisely.
To impart the information to the right recipients.
Yes.
So I guess that's the vision. The vision is to be able to oil the wheels of increased human interaction and engagement, external to the screen as much as using the screen.
Exactly. Making it real, as they say.
Making it real. I could have said that earlier on and made life a lot easier. Yeah.
Well, no. It's a brilliant program, and it's very helpful to get the more detailed explanation from you. So, Simon, we only have a few more minutes. To be honest with you, I'd love to talk to you for another hour and a half and also have a pint with you to hear a lot more about this, but I'm hoping we can do that sometime in the near future. As we're summarizing right now, help us to understand, Giant is a big global community of people working in healthcare providers, obviously, doctors, nurses, hospital managers, people working in government whose responsibility is the delivery of healthcare services across entire nations. And of course, we are very much a very large business community. We are startups and SMEs and big global corporates working in healthcare technology, hardware, services. And then on top of that, obviously, the big international healthcare investment community and healthcare advisors and management consultants and accountants and lawyers. Everybody whose business is health. What can people do to support you? Do you have any big asks right now? If there are people watching, and if we're, of course, working hard to promote this message over the next few months, what are some of the big asks for your business in summary?
Well, yes, we do have an ask. We're very fortunate now that we have major support. We're partners with Sharp, with Amazon. In the sort of blockchain world, we're partners with Consensus Health.
Nice.
We have a relationship with the government think tank on COVID. We've got the partnerships, but it's one thing to have the partnerships, and it's another to have the support of a growing membership base. So bottom line for us is, as I said, we're launching the fact that we're launching a Giant, but we do have a lot still to build. What we need is members. So sign up, simply come to remylife.com, take a look around and become a member, and then watch as we launch our modules one after another and grow with us and participate, because there is an opportunity on so many fronts. We want to do something sizable and global, and it's happening fast. So come and take a look and join us, basically. That would be the big ask.
Perfect. Hey, well, look at Simon. This has been so very, very interesting, and we love what you're doing. You can consider us absolute champions and fans of your initiatives, and we're also proud about the ongoing commitment that you have to promoting healthcare and the roller coaster challenges that all of us as technology entrepreneurs have. So we really, really appreciate and admire your perseverance in the midst of the challenges of the pandemic and the world economic situation. So congratulations, obviously, on what you guys have accomplished. Very, very proud of what you're launching right now. And I hope that on behalf of all of our listeners from around the world, they have found this interesting. I certainly have found it interesting, and I've learned some new things today. So thank you very much, Simon, and good luck with everything. And certainly looking forward to developing our discussion with you.
Thank you, Barry. I'm looking forward to the world getting back to normal and you buying me that beer that I now have on record.
Did I promise that?
You did.
Perfect. Well, count on that. So thanks again. This has been Simon Hooper, who is the founder and CEO of Remy Life, one of the world's most interesting new innovations, applying blockchain and networking and communication and token technology to the world of care. And it's also it's a consumer-facing proposition, but there's also, if I understand correctly, an extremely interesting B2B element to it. So huge opportunities for lots of people around the world to participate, to partner with Simon, and to engage. So we certainly welcome everybody listening in to contact Simon and to explore ways of collaborating successfully.
Looking forward to next week. Thank you, Barry.
Okay. Yep. Thank you very much, Simon. All the best.
Sure, yeah.
We are live.
Hello, everybody. We are here in a live session, so please feel free to interact with us. And we have Professor Shafi Ahmed. You know him well by now, probably. He is medical director at Medical Realities, but also chair at Giant Health event. We have with us Denise Dilber, who is truly a pioneer in empowering patients. We have Matt Eagles, who is really an expert patient and the champion. And we have Paul Gordon that I'm going to circle back a little bit later. So we have a bit of a suspense right there. We are together here around Michael Sears. Some of you might know him, might have known him. He passed away this year, sadly. And with that, before I continue, I would like for us, all of us, to send our best wishes to his family, his children, and all his friends. And hope that Justin, his wife, is here with us today. We all knew Michael well. We've been changed by Michael. We've seen his light. And we are here. We have plenty of stories. We could just stay here for hours, but we will actually do what Michael would want us to do and focus on where is the patient empowerment today and what can we do moving forward for creating change in healthcare. Change that will embrace patients as equals in healthcare teams, as experts, and as true and fantastic innovators like Michael was. So that's like the big picture. So I will actually circle back to Paul right now, because Paul is actually the chief marketing officer of the company that Michael founded, a very successful patient-led startup who is growing very, very nicely. But Paul was also one of his best friends for 20 years, so he knows Michael the best. So he's gonna give all of us a overview of his life, of his achievements, and of his really mission and his wishes. So Paul, I'm gonna open it up to you.
Thank you very much, and good afternoon, everybody. And for probably some of my colleagues, it's good morning. So I'm Paul Gordon. I'm the Chief Marketing Officer of 11 Health. That means I've got responsibility for marketing, for sales, and commercial strategy. But far more important than that, I'm a 20-year friend of mine. We first met when we were at the school gates, picking up children. He has 3 children. I have 3 children. They are more or less exactly the same age. Our kids grew up together. Our wives are best friends. I think Justine is probably on this. In fact, no, she's texted me a message 30 seconds ago. We literally are part of each other's lives in every manifestation. When I first met Michael, the licensing business, and he was damn good at it. He really was a fantastic licensing agent and was working for some major blue chip brands, football clubs including Juventus, big consumer brands like Disney and Warner Brothers. And Michael was in that space redefining the role of branding and merchandising. And the way he did that was basically, rather than just having the license and coming up with some interesting creative work to bring together their properties, he actually persuaded Disney, amongst others, to give him the license to manufacture products in China. So Michael was one of those brave guys, brave is used to describe Michael, who went to China in the very early days when British and American business people went to China and products on their behalf. That was a very smart way of redefining the role of licensing. As I say, Michael was very good at it. In later years, when his began to be more of a challenge, he used the skills and expertise from branding, marketing, manufacture, and intellectual property think the interesting thing to Michael is that, unlike so many people who do suffer from chronic illness, Michael never, ever defined himself by his illness. If you ask Michael how he was, he'd say, "I'm fine, how are you?" Even if you're absolutely fine. He was infinitely more interested in your health than he ever was his, and he never wanted his health to define him. But his health was always there, and we all know that to be a part of his being. When Michael went to hospital to have the transplant in Oxford, and he recovered from it, he knew straight away that his future was not going to be about licensing. His future was about doing good. He absolutely believed that he was spared to do a job, and the job was to actually help mankind, humankind. And we used to talk a lot about this, Michael and I, and very much he saw himself in the way that survivors of the Holocaust saw themselves, as being spared for a reason to do good for humanity. And that very much is what Michael wanted to use his life to do. So when he hacked the sensor, which actually is the first thing he did to create what became 11 Health, that was purely to deliver against the personal need. Medical bags, he called them dumb. It's a very good description of them. Hadn't moved on for 40 years. And this was kind of nonsense to Michael. Healthcare has moved on so much in 40 years, but it hadn't in this particular area of healthcare, in medical bags. He looked around for someone who could do it better to help him. There wasn't anybody, so he thought to himself, why don't I do it myself? He started a business in the US, in the US, after frankly being a little bit disappointed with the UK. He found the UK a little bit slow in order to embrace the opportunities, and thought there'd be greater opportunities in the US. And he was so right. I mean, who to America? I mean, most businesses that go to, British businesses that go to America singularly fail. Well, that's going to happen for Michael. The big movement, the big opportunity was when he managed investment from Silicon Valley investors who believed in his vision, who believed in the opportunity. And that really was the genesis for what was 11 Health. In 2018, we launched the world's first smart bag. Back end of last year, we launched Smart Bag 2, which is the next iteration of the smart bag, completely transformational, nothing comes close to it. And he also launched, as part of our core proposition, our patient coaching service. Our patient coaching service is a way of patients helping patients. And this all comes from my personal experience, where he felt that technically there was an opportunity, but also on the human side, there was an opportunity as well. And that's the genesis of the patient coaching program. So here he is, small guy in stature, in the middle of California, launching his business. And all of a sudden, on the radar screen, all of a sudden people are talking about this great guy around with sometimes a t-shirt that's too small to him, in tracky bottoms that are always falling off him, throwing his meds around. And Silicon Valley is taking this guy seriously. Eminent doctors are taking this guy seriously. Who does that? Everybody looked at Michael and thought, this guy is transforming something. Let's get on board. Let's find a way of working with 11 Health to transform healthcare. Because Michael always knew that just being a patient advocate in itself wasn't enough. He knew that in order to fundamentally change patient-led healthcare via a corporate machine, because otherwise you're just a soundbite. Otherwise you're just a pressure group. So the vision for 11 Health very much is to create a business, and that business is to help more patients. And we can only do that if the business is successful. I moved over to America in late 2019 with my wife and my son. We lived 3 doors away from Michael. I saw him every single day. More often than not, I saw him at home because he wasn't well enough to go to the hospital. And at the final time, the final few weeks of his life, we were there. What I want to say is, on a positive note, is that I am part of the leadership team of 11 Health. There are 2 other Brits that are part of it. Bern Gilby, who took the role of CEO when Michael passed. Dr. Robert Ferd, who's a British doctor, gastroenterologist in the UK, who's now our Chief Medical Officer, and myself. And we see our role very much as taking Michael's vision, bringing that to life commercially without losing sight for even a second of what he was about, which is using an opportunity to build a business that transforms patient care. Initially in our space, but more broadly beyond it. I'll take that responsibility very seriously. We're on our way to succeeding with 11 Health. It will take some time. And I know that he'll be smiling down on everybody who's on this call, everybody who's attending this conference. He's on my shoulder. I say this a lot, I say this to Justine a lot. Michael is on my shoulder. I feel his presence all the time. We're in meetings and somebody will say something and I'll shake my head and think, and I feel him on my shoulder saying, Paul, I don't want to do that. Tell him I don't want to do that. So I do. We were so symbiotically connected that we more or less exactly what we were thinking at any given time. And I miss him hugely. But I'm empowered by his presence, by the vision he laid down. And I'm here to say to all of you here that keep an eye on what we're doing for 11 Health, because 11 Health is Michael. Michael's the embodiment of the brand. I talk a lot about that. And I'm sure he wishes everybody here well. This cause is incredibly close to his heart. He always saw patient-led healthcare as being the future. He felt he was spared in order to do that. He wasn't spared for long enough. And certainly, I speak on behalf of everybody 11 Health when I say that's the vision we have moving forward. And when we hire, and I'll shut up in a minute because I know there's a lot to cover on this call. I promise you I will shut up in a minute. When we hire, I am always involved in those hiring decisions. Not because I'm looking for skill competency. I'm not sure I could add much value when we're looking at hiring a hardware engineer. But I hire to make sure that whoever comes into the business understands the kind of cultural aspects of what we're about, the values that we're looking to achieve. Because ultimately, there are very, very, very few businesses that are geared in the way that we are. And ultimately, we know we'll be successful by helping more patients. So I'll shut up now and let the session continue, but hopefully that gives an introduction into...
Oh, thank you, Paul. That's lovely. And thank you for bringing so much passion into your talk, because really this was really Michael, and I agree that I feel that he's here with us and he will probably have a laugh looking at us right now. I miss him dearly as well. And what you said is what I think is very important for everyone to understand, is that Michael changed that particular field in healthcare. His innovation changed it, that's something that didn't happen in 40 years because of his experience on the hospital bed, his lived experience as a patient. And another point that
I think just to add to that,
and another point that
I was just going to, one thing that he, I was just going to say, one thing that he always said, and I think this will resonate with everybody, is that he knew that a lot of patients wanted to say what he said, but didn't have the confidence to say it. So he saw himself as a person who was their voice. A lot of patients, particularly patients who suffered from, they were disempowered by their own experiences.
But I can.
And he said, "I'm not going to have this. I'm going to control them."
I can assure you, Paul, that he was definitely an example of perseverance and determination because he believed. When I met Michael Sears, he showed me the prototype. It was 2014. He showed me the prototype at a conference where no one else was interested. No one else. He gave a talk and he was left on the side. He was wearing a nice hat, He was undergoing his chemo. He was having a very weak voice. So he persevered a lot, and we've met across the world in conferences, when he was, brought in just to have a patient in the conference, and he was very aware, and he never stopped walking the line. And another point I would like to make everyone aware of is that he always believed in patient to patient, in the value that patients can bring to other patients. And he lived that, and he embraced that within his innovation, through the coaching service that they provide, that you guys provide. So that's another very powerful legacy that Michael is giving us, and that we have to embrace and move forward. And actually, for those of you who are interested, and thank you, Matt, for reminding us, Michael Sears on his blog, you can check out Being a Patient Isn't Easy. He has a wish list written in 2014. And you could see that he actually did very well in checking some of the boxes there. But it's very interesting. We would like to hear your thoughts. What would you like as a patient today from healthcare? So if you want, you can use the hashtag wishlist and hashtag GenHealth2020, and we would love to get your thoughts on
Lorena, I would say not just as a patient, what do you want as a person who works in the period? Because as Michael so rightly said, healthcare is all about relationships. So let's get everybody who's listening to this involved with their wishes. So we're inclusive and we're collaborating with everybody.
And we are all equals in health, right? So Matt, actually, I was coming to you. So we would like to hear your thoughts. Why do you think real change will happen only if we accept patients as equal partners and innovators in health?
First of all, I must explain, if you see me moving about and suddenly disappearing off the screen, it isn't because I don't want to be here. It's because I actually live with Parkinson's, and I've lived with Parkinson's for 45 years. And it has a habit of getting into or controlling my body at times when it really shouldn't do. But going back to Michael, just very, very quickly, I personally consider myself to be a positivity activist. I'm actually head of patient engagement at the Havas Links group. But Michael is the epitome of positivity. I mean, people, it's super important, first of all, to understand that being a patient and illness aren't sort of life choices. People don't choose to become patients. People don't choose to have to fight for their well-being either on a daily basis. We all face the challenges in our lives, but it's how we respond that's key. Finding motivation and inner strength when always in a crisis takes a particular mindset. It takes resilience, determination, passion, the ability to communicate and engage. Michael had this mindset, this strength, this desire to disrupt healthcare, enough to make a massive impact and to change people's lives. Now, as a patient, playing an active role in your own well-being is crucial, and none more so now during the global pandemic. We've all learned what's important in life, what are the real essentials. We've all become more conscious of our own mortality, how much we love our families, and how important healthcare is, and particularly in our own well-being. And if I may, I just came across this article recently by Dr. Catherine King in Psychology Today, the 7 principles of resilience and practical ways to enhance well-being. And they were perhaps going off topic a little bit, but this is so pertinent to Michael. Principle 1, cultivate a belief in your ability to cope. Principle 2, stay connected with sources of support. Principle 3, talk about what you're going through. Principle 4, be helpful to others. Principle 5, activate positive emotion. Principle 6, cultivate an attitude of survivorship. And principle 7, seek meaning. Michael practiced all 7 of these. He was resilience personified. And this enabled him to establish the relationships with clinicians, nurses, academics, industry and family that's so crucial in healthcare. He actually said before that healthcare is about relationships. It's about mutual trust. It's about mutual respect, and it's about mutual empathy. Give what you wish to receive. Empathy, which is one of the crucial things, and I've had to write this down, it's so good. empathy is what Michael, he's just, again, empathy personified, seeing with the eyes of another, listening with the ears of another, and feeling with the heart of another. Now, this doesn't just apply to Michael. I'm not going to embarrass Shafi, but Shafi, to me, is a similarly innovative and inspiring clinician, surgeon. He inspires me in a very similar way to the way Michael did, and still, indeed, still does. So I hope I haven't embarrassed you now at all, Shafi, because that really does come from the heart.
That's really kind.
We're all friends coming together, so.
But yeah, just very, very briefly, a true relationship, and this is another quote from one of Michael's talks, a true relationship is two unperfect people refusing to give up on one another.
Oh, this is beautiful.
And I love that. I really do. Just very quickly, his passion and captivated his audience when speaking about health tech. It was obvious what he wanted. He spoke about solutions being given to the end user rather than being built with them. I think we've seen a little bit of progress there in collaboration and co-creation, where new startup firms actually do contact patients and ask them what they would like, what is their biggest problem, because that's one of the biggest issues in healthcare, particularly with health tech. People think of ideas and then go to the patients when really they really need to sort of truly understand what the problem is that they're trying to solve in the first place and understand the needs of the patients. I'm sorry, my microphone appears to be a bit noisy, apparently. I do apologize. But meaningful change will not happen unless you engage with patients first. And it starts from the top, and you have to be brave. And I put another hashtag out here, and it's hashtag be like Michael.
Be like Michael, indeed. He was brave and persevered, and he had a wonderful sense of humor, so he went through everything with a smile. So Denise, you've met Michael for a very long time, and he visited you at your conferences where you really supported so many patient voices, and you've done so much for the movement, if you want, and you really created progress in that sense, and you are still doing that. Do you have any thoughts on what we could all learn from Michael?
Yes, absolutely, because thank you for asking me that. Michael would never have wanted to be perceived as a Superman, as a hero. He really considered himself just one of us, just a person, an imperfect person. And I would hate for this tribute that we can't help but do to him to have people come away saying, well, there's Michael, we can't do that. And so I have reflected on, yes, we can, which is to understand that when you are a patient who is potentially in a situation where one could lose one's life, I believe that that gives everyone a clarity of purpose. And I believe that it was this clarity of purpose, which all of us can have, that is the fuel for all that we are saying about Michael. And with this clarity of purpose, you can become what I believe he truly was. Now, you're going to laugh a little bit, but it's not funny. I'm going to use the word surfer. He was a fearless surfer, and I believe that we can all surf on the waves I'm going to describe, which because I followed his career in healthcare. He began when everybody was doing a blog on the web. He used that blog to get in touch with others and then surfed onto the wave of social media. And it was through social media that he identified the surgeon in England. It was someone in New York who told him, it was a doctor in New York who told him that there was a surgeon in England who could do the transplant. So he surfed onto social media. Through social media, one became aware of conferences. That is where I met him. I met him when he was at Medicine X. I had already started Doctors 2.0, and he was not yet a speaker. And as soon as I got there, he said, I see you're setting up a conference in Europe. May I speak at that? And so he became a speaker at not just my conference, but at many conferences where we would follow one another. And at one point, he realized that he could make that prototype. There wasn't just the prototype for the ostomy bag. He also was working on a prototype for a backpack. He had various ideas because he was a bit of an inventor. And then from that, he had the idea of going across to the US. And because he was an insider in the hospital, he knew with whom you would have to speak to get things done in a hospital and to put himself on the way to getting reimbursement. To get reimbursement, he just went on the web. I remember him telling me that, and he found out what was required by the different governments. So what I have laid out is the fact that if you want to be like Michael and you have this clarity of purpose, you then adapt to the opportunities that you will see because you know what you want. And what do you want? You want to make lives better for yourself, the patient, and for all patients, because you can't really make it better if there's only one person concerned. If you want to make it better for yourself, you have to make it better for the professionals and for all the patients. So that is why I would say that if we all can surf in an adaptive way with clarity of purpose, we can carry on with Michael's work and continue to improve the world of healthcare and the world at large.
Thank you, Dennis, and thank you for saying that Michael was not a superhero. Well, in a sense, he was for all of us, but he was very deeply human, and he had tough times. And I remember we were having the pizza, the conference, and he was really, I don't know, he was feeling a bit sad and demotivated, if you want, because he met some big surgeons, and sorry, Shafi, I'm not passing on this to you. He met a surgeon that said that patients actually won't care about his innovation, and he was really concerned. He was, really thinking if he's doing something wrong or if this is actually true. And they said, Michael, you came up with this because you were on a hospital bed.
Hello, we lost everything. Where are we all, guys? Sebastian, what happened? Hello? Sebastian, can you hear me? Because we've lost the other speakers for this session. Oh, we're here. I can see everyone now. Can you hear me, guys?
Yeah. So
Just Denise, I think, is missing.
yes.
Are we live?
For the interruption.
Isabel, are we live? Isabella, are we live? I can't hear you. Yeah, I can hardly hear you.
You are probably muted, Isabel.
Yeah.
Sorry, I had my volume down. No, we're not live. No, we can go live at any second. We just need to regroup.
Okay, so we've got Denise, we've got Lorena, Matt, and myself. Denise and who else is missing?
So I don't know when we got interrupted. Do you have any ideas?
The server went down for about a few seconds. You guys were still going though. So everyone that was watching you
who was
didn't.
talking? Was it me or Denise? Do you remember?
Denise was speaking. Come to end of her session.
Yeah.
So then you didn't hear me talk. Okay.
Lorena, you were speaking when the server went down. So just as soon as you started.
Okay.
Re-enter the giant main stage.
I hope you didn't mind my impromptu. I really meant that, though. I did.
But listen, honestly, the it's reciprocated.
Apologies for the unexpected break, but Denise just finished up giving us some very insightful lessons from her experience with Michael and from his life. And one of the most important one is that you don't have to be a hero. And, you know, Michael had his tough times, and probably that's one of the reasons why he really valued friendship above all. He was a loyal friend. And he realized, as a patient, you realize that you cannot do things alone. And he realized very early on that he cannot also innovate on his own. So he needed his tribe. He needed people that he trusted. And then she also mentioned that he was a surfer. So he moved from the UK to the US. But this also was a challenge for Michael, because he found it difficult in the UK to push through and develop his innovation, and that was one of the things that made him really sad. And I'm glad that I'm going to Shafi right now, because Shafi broke some rules, and he created new paths in healthcare on his own end as a doctor. So he's been through what Michael has been, but from a doctor's perspective, in a sense. So he knows how to be told no, that this is not possible. Shafi also knows that it takes courage to change medical education, change perspectives. So Shafi also knew very well Michael, so they were very good friends. So Shafi, please tell us from your own experience, but also from what you learned from Michael.
Sure, what a great pleasure to be here to remember Michael, who was an extraordinary individual, and who's of cancer or further complications. You never heard him complain or moan about his own problems. He was saying, how do I help other people? He looked at his own condition of stomotherapy and thought, how do I engineer something to help people from leaking around the stoma site? It's a horrible thing to have, having fecal contamination across your abdomen, across your bedroom, etc. Not very pleasant for anybody. So he thought, well, how do we overcome? I remember him showing very successful. The fact that he was unyielding in his demand for better outcomes, better innovation for all of us and people that had suffered along the line with him. He was also a patient voice globally, talking about his condition, his problem, very open and transparent about what the issues were and how they could overcome them. And really, he was an inspiration as to someone who says, look, you know, let's, as we move healthcare forward, how do patients, doctors, healthcare workers, so Michael was a number of things. He was an innovator, he was an educator, of course, he was a brave person, he was a patient, and also he was someone who just understood humanity. Whenever you talk to him, it wasn't about that, it's just about humanity. How to make people better, happier, live longer, spend more time in well-being.
Okay, I
and I think that's
we are
his
live
main
right
legacy that he's left us. And he's inspired many patients also along that path.
I'm curious, Shafi, as a doctor, what can we do to create this bridge of trust between doctors and patients, so we can trust what they bring to the table, because the patient brings the lived experience, so they can innovate from their own experience, and the doctors, they bring the skills and the expertise, the knowledge from medicine.
Yeah, we need to listen to each other, Claire, and that's what it is. Look, we historically as doctors have been very hierarchical in the way we manage our patients. We know best, this is what we've decided, etc. And often the person missing from that conversation is the patient. So one thing that Michael did leave us is this whole concept of changing the way the company's run. So look, I remember him coming up and saying, look, we have the chief medical officer in the company, we have the chief operating officer, we have the chief executive officer running the company, etc., etc. We never have the chief patient officer. Why don't we have a CPO in every organization in healthcare? The patient is involved in those conversations. And I think his legacy going forward is the chief patient officer.
It was on his wish list in 2014 that NHS should have a chief patient officer as well.
Yeah.
So that's one of the things. And what can we do to move things forward. We, as you said, he was an educator for patients, but he was an educator for doctors too, and for healthcare as a whole. So I think that we can all do that individually, but is there something that you think that we could do from inside the establishment of healthcare to improve that?
Yeah, so look, it is upon us to create that, I guess, the ecosystem, the environment where people have a voice. And I think one of the things I've been striving for many years, Lorena, is how do you put innovation into the heart of every organization? How do you bring innovation to the heart of the NHS, for example? How do you empower people to think differently, to allow them to have that voice and that vision, if you like? So I think that's part and parcel of it. And I think Michael just showed glimpses of what could be possible. It's up to us. We have, in the NHS, of course, we have a number of organisations, NHSX, NHS England, NHS Digital, etc., etc. But each institution itself, every healthcare trust, needs to embrace those ideas and ensure that we innovate together. So I think one of the key things is how do we bring that technology, how do we bring innovation, and how do we kind of embed it into people's mindsets and into practices.
So I will bring it a bit towards the end now, because we don't have much time left. I will bring it to the present because, but also drawing on the past. In 2014, Michael was saying that he would love to see doctors interacting with patients via Skype, for instance. So now, we interact via Zoom, via Skype, via WhatsApp, etc. with our doctors because of what happened this year, because of the pandemic, on one hand. On the other hand, we've seen a lot of decisions taken top down, and there was actually an article on the British Medical Journal saying that, this year patients were not involved, and NHS was, supposed to become more patient-centered, but this year patients were not as involved as they've been. So do you think that, do you all think that patients are not being heard this time, or anything like that presently? Yes, Denise.
Well, we're in a time of crisis. So crisis has a good side because sometimes it gives opportunity to do things in a new way, which we have seen with teleconsultation. But I think that there is a long-term need to really inject and make communication as a skill, as a course, as an education, something that is required and noble. We've gone so far in valuing STEM that it seems to be at the expense of humanities, and in particular, something like communication, which has never been recognized as a tool for a healthcare professional. Independently of all that we've been saying about patient advocacy, so far we know that internally to the healthcare profession, to the surgical team, communication is of the essence. Everybody must feel free to make a good suggestion or to point out a problem. So I think if there's one thing that Michael could agree to and that we could all agree to.
That's very true. And I think the crisis also showed us that we still have a long way to actually integrate the patient. The patient should be also part of the conversation.
Absolutely. If we understand that communication must happen amongst everyone, it's patients included.
And in every situation. So any opinion, Shafi?
You're muted.
Yeah, you are muted, Shafi. Can you unmute?
Sorry. Yeah, I'm saying that I think that Denise is right. This has been a huge transition for all of us in the last 9 months with the pandemic. We've seen acceleration of innovation. We've seen telemedicine being used, and obviously Mike mentioned Skype before. So I think part of these wishes have already come alive because of the pandemic. We're now doing remote consultations, up by 8,000% in most institutions. We're now never going to go back to what's the old normal, of course. We're now going to be in a more remote virtual world, whether it's patient consultations or, in fact, education. So I think Mike got his wish there. Obviously, it is precipitated by a global pandemic, but it's part of the way there. But what it's allowed us to do is think differently. We're going to exploit that. We're going to explode. We're going to propel ourselves in the future. I think Mike would love to have seen this. He'd love to have seen where we are now today compared to 9 months ago. I'm sure that's part of his vision that is now being realized for all of us.
And Matt wants to say something. Let the patient speak.
I was going to say that the pandemic has really brought to light some of the inequities in health as well. The differences in cultural standards, in health-seeking behaviours in themselves, and access to healthcare as well. Now, I think one of the beauties of Michael was communication, and I'm sure he would have stood up for the people who perhaps didn't have a voice. But this whole pandemic has really emphasized the differences between different cultural communities and how they're, I mean, we all want to see health-seeking behaviours become the norm. We want people to be as comfortable accessing their healthcare as they are on Amazon or on TikTok or on social, because that way we can all help each other.
Sure. And I would like us to have maybe a thought on one of Michael's. And Paul, do you have any opinions on what's going on today and the role of the patient? The voice of the patient.
Yeah, I just want to think. Obviously I speak with a British accent, but I work in America, so I'll give you an American perspective on things that I know it sounds incongruous, given the way I sound, but in our space, and I'll talk from our space, I think that's my role on this panel, is that remote patient monitoring, which is essentially is our take on life, is here to stay. I think what we're finding in the States is that obviously hospitals are just inundated with pressures that frankly they couldn't have possibly contemplated, and I don't know what that means for the next 3, 6, 9 months. I'm not sure. God Almighty knows what's happening in the next 3, 6, 9 months. But I think that certainly we're finding in our conversations with clinicians is that any party that can basically augment inpatient care, out of patient care, with or out of patient care, is hugely important, and that's essentially what we're about. And nurses and hospital administrators, your patient's really important, but you can't cope with that amount of patient throughput. We can basically augment your in-hospital support at home. It is essentially what that's about. And I think that goes back to the point about partnership and communication. I think that's certainly where providers and brands like us come in, about helping the patient at home, because the hospitals can't cope.
And it's also a bit of a transfer of knowledge here to the patients, along with the care, which is, it's going to create a new wave of innovation, in my opinion. I don't know if you agree, because the more people are becoming more, skilled, if you want, in their own health, they will have better and better ideas about how to improve it. Okay, and so we touched on the remote monitoring as well, which was on Michael's wish list in 2014. So this also happens this year, and is going to, is going to have a post starting forward. It's something a bit ironic, but also something to enjoy that these things happen. Michael would enjoy that. On the last, we have only a few minutes left. So I would like us to maybe put forth our wishes as well and our thoughts, about healthcare. So personally, what I learned from Michael is, mainly to not give up, to being a bit stubborn, and have a good joke, but keep doing, going your own direction, and creating, as Dennis said, serve and create a tribe, and understand that things can be done only together. So this was my primary lesson. Denise?
Yeah, I was just wondering, because there's so many people who love Michael and who would like to see his legacy pursued. I'll bet you somebody's already thinking about some sort of an award in his name. But if there isn't, I would certainly think that Giant Health, at the least, which would not preclude other awards, could run a competition next year or from now for the best ideas about improving the essential problem that you raised a few moments ago, which including the patient in communication. How can we improve that structure or the organization of healthcare so that the patients are freer to communicate and are more heard, and give prizes? This could be thought out. It could be at all different levels, prizes to individuals, to organizations.
I wanted to close with that, Dennis, because Barry announced actually in June that we are going to have a prize, the big prize at the startup competition at Giant Health event is going to be in Michael Shreer's name.
I didn't know that.
Yes, I wanted to close with that. So I'm very grateful. So we can thank Barry and we can thank Shafi here because he's the chair of the Giant Health. I'm very, very humbled and I'm proud to be part of the first year jury for the startup competition. So that's a wonderful idea, Denise, and that's one way to shine light and one way to keep pushing things forward. And Shafi, you also, you've been involved in the prize. Give us your thoughts.
Yes, of course. So the Beansports competition we do every year at Giant. We ask innovators to come across around the world to submit ideas, and we'll be giving out prizes tomorrow. In fact, tomorrow there's an award ceremony, at about 2 o'clock in the afternoon, which I'll be hosting. I have my black tie on, of course, and I have a glass of champagne, non-alcoholic, because I don't drink. But nonetheless, we're trying to bring the community together. We have 12 awards tomorrow to give away to various people, including Entrepreneur of the Year, for example, Best Tech Innovation, Best Application Immersive Tech, Best Tech Innovation in Pharma, Women's Health Tech Innovator of the Year, Best Wearable Tech, etc. So we have 12 different areas. So come and join us with perhaps a glass of champagne to cheer on the success stories of 2020.
So what do you think Michael would say about having the prize on his name? I think he would feel a bit, embarrassed and humble.
He'd be embarrassed. He's so humble. He never wanted any gratitude or platitude or anything. He was just a very simple person. And I think that he'd appreciate it, but he'd be a bit embarrassed, of course, but quite rightly, he deserves to have that in his name.
And Paul, quickly, because we have only 3 minutes, what do you think Michael would think about the prize?
Yeah, he would be a bit embarrassed. He probably should. He should probably say no. It should be in someone else's name. So because he was a humble guy, but I think it's a lovely thing to do. And I would say just that honouring him. Justine and I are in the process of working out what the structure might be for something that one might call the Michael Shrier Foundation, which will be it's to be defined and developed, but will be a mechanism for us to essentially raise money for causes that we think that Michael would support, causes which give people opportunities to bring things to life, which of course that he was given. So more on that to follow, and Matt's showing a picture of Michael, and I think that's a lovely looking picture. I think you caught him at his best there, Matt.
I think that is the best thing to have a prize on somebody that who would be too shy in a sense to have a prize on his own name, because his legacy is just so deep and so sweet, and I think it's a wonderful thing. And we'll close with Matt, I think. So tell us about the picture.
That's actually part of the Healthcare Heroes book that Michael appears in, that was done by Havas Links. And I think that's an absolutely beautiful picture. And it's taken by a guy, I think it's a photographer called Chris Roberts, I think his name is. But it captures him so well. But I think I'd like to close by saying, if anything, if you're going to speak, if you're from a patient perspective, certainly, be brave, be courageous, be yourself.
Be yourself, I think Michael would agree. Be yourself, really. And I think we ran out of time, so thank you.
I would just say that this has been a really happy session, and he would have loved it.
Yes, I agree.
Once we got past the beginning.
Michael would love that.
We're all still smiling anyway, just like Michael does.
Thank you all who watched us, and I hope we'll meet again and keep things, keep the conversation going, really, because it's we are not there yet. Michael knows better than all of us. We are not there yet, so we have to keep going. Thank you all, and we have to cut short right now. So
thank you.
Thank you. Bye bye.
Bye bye.
Bye bye.
Well, hello everyone, and welcome to this fireside chat with Dr. De Richter. This is one of the fireside chats with global leaders in healthcare, which we'll be showcasing at Giant Health event. It's a pleasure for me to have a chat with Dirk, who's a colleague, a friend, and also someone who's been working in the healthcare system for many years. His current role is a senior advisor to the Abu Dhabi Department of Health. He's come from a background of being a trauma surgeon in Germany, and then he went to management of hospitals for many years of his life before he was posted to Abu Dhabi to work with their Department of Health. So he has great insights into healthcare innovation, into what's required on a macro level across the country and across healthcare systems. So Dirk, thanks so much for joining us.
Hello, Shafi. I'm happy to be here. Thank you for inviting me.
So, Dirk, I've spent a lot of time, of course, in the Middle East, and I've worked a little bit with the team there. Can we just give our audience an overview of the current healthcare system in Abu Dhabi to get a flavour of what it's like at the moment?
Yes, of course. Yes, Abu Dhabi is one of the 7 Emirates, the biggest one of the United Arab Emirates, and of course also hosting the capital. And actually, I think looking at the region around us, we are a little bit ahead since we are the first one to have health insurance for a little bit more than 12 years now. So everybody has got health insurance. And what we try to do in terms of healthcare is to attract international as well as local providers. So for example, opened in 2015, we opened Cleveland Clinic Abu Dhabi, which is really a subsidiary of Cleveland Clinic with all the innovation and all the healthcare Cleveland Clinic Ohio can offer. Recently, Mayo Clinic joined as well, but we also have local or more regional groups like NMC or VPS Healthcare. So all in all, it's a really vibrant healthcare system. And Department of Health tries to reward people delivering quality in healthcare, introducing innovation, and yeah, of course, we also have the issue like everybody to manage costs. I think we do it in a quite proactive way.
Yeah, so it's great because you've got a relatively small population. You've got quite a mature healthcare system with insurance-based models, and you've got amazing hospitals like Cleveland Clinic and Mayo, which are really world-class. And so what an opportunity, of course, for us to learn from what you've been doing in Abu Dhabi. Of course, we're all troubled by the pandemic, Dirk. We all try to find solutions. And one of the things I was really impressed about over the last 9 months was how the Middle East, Abu Dhabi in particular, were managing this problem compared to other countries. So can you give us examples and just tell me about the story around the pandemic and what Abu Dhabi has done specifically to overcome some of the problems and challenges that we've all faced?
Yeah, I think first of all, of course, we are a region really at risk since we are between East and West and around 200 nations living in Abu Dhabi. So everybody traveling through the UAE and through Abu Dhabi. So I think it was key for us to react quite early. In March already, first of all, we built huge testing centers, drive-through. Now I think we are the country with the highest testing rate per capita all over the world. So more tests than population. And so we, at least data are solid, whatever we publish and we know about the people. And then we quite early started to really isolate people. I mean, in the beginning, we were even able to really put everybody being tested positive, either in a hospital or in a hotel, to really take them away out of the communities. We also did quite a systematic approach regarding our labor camps, of course, where many people live in this relatively small environment. So I think all in all, it's about really quite a consistent way of isolating and, of course, testing again and again in order to have accurate data and be able to follow patients and everybody being tested positive. So that's basically.
Yes, that's right. So one thing I want to pick up on there is testing. So one thing is I think Abu Dhabi did really early on, and the UAE as a whole, is somehow get access to mass testing. And you realize very quickly that was something that was going to be essential in managing the pandemic. So how did you get that testing? Was it done internally? Was it external tests that you were getting? I mean, how is that you achieved that compared to other countries that struggled to test their population to the degree required to manage the pandemic?
Yeah, of course, first of all, it was a giant sourcing approach to get all the tests in. And then we really shifted the scope of our public hospital group called Saha. They usually operate hospitals and everything, and they were really mandated to build huge testing centers. So for Abu Dhabi, but also for the rest of the country, and it's drive-through, of course, the throughput of enormous throughput. So actually, that was the reason to really build an infrastructure. And of course, for us, next step is to build a similar infrastructure for vaccination for the future in order to take the next step. But it was really mandating a public group. And then, you know, I mean, we're always talking about private initiatives, and that's something very important. That's what Abu Dhabi aims at as well. But in this case, it was also very helpful to have a strong public group being able to deliver this very quickly.
So I'm guessing the fact that you had quite a mature system set up quickly in terms of testing, there should be no problems with vaccinations because you have the infrastructure already in place or the skills and know-how. Is that right, Dirk?
Yeah, yes, of course. I mean, what we try to do, of course, always be one step ahead. Now we have a also big clinical trial with an inactivated virus, registered around 30,000 people in Abu Dhabi only, starting I think in July already. And of course, the next step for us is now, of course, we're looking all over the world, have a lot of cooperations, looking at all the vaccines available. But actually for us, it was important to also be very quick in order to get the vaccine and to build an infrastructure. And that's the next step for us.
We've seen, of course, the kind of hopefully release of 3 vaccines in the next month or so, which will hopefully improve the outcome for many people going forward. One of the things I'm really impressed with Abu Dhabi is the fact that you have around about 50, I think, healthcare institutions that are now becoming more connected. Okay, so can you tell us more about that? Because I remember coming to the Department of Health and seeing a lovely dashboard on collecting data analytics in real time, focusing on how to manage the healthcare system better. Can you elaborate on that, please? The kind of the Malafi link with electronic health record, with data analytics, and the dashboard. Dirk.
Yeah. Yes, I could start. I mean, with something everybody knows, data is the new oil, and we are very experienced in oil, so that's the starting point. No, I mean, actually, already when we started health insurance, we made sure that all kind of insurance claims, so whatever happens in the market is going through DOH, so the Department of Health. So we always get copy of every kind of service being delivered in the market for almost 12 years now. So that was a really first step that gave us support in terms of planning and everything. And what we are doing right now, or almost done, is that we also have all electronic patient records in one database. It's called Malafi. It's a system we started with the public sector, but enrolled all the private providers as well, one after the other. So, I mean, it's not fully completed. And of course, whenever you talk about data, you need to make sure that quality is accurate and so on. So that's an ongoing journey which never stops. But still, we will be able to have all information in one database for the entire emirate, which of course helps us to avoid duplication in terms of too many X-ray and all the things you aim at, but also helps us to do more analysis for those data. And this is again, of course, also very valuable for all kind of research, which would be the next step as soon as this is done.
So I love that idea. You collect data because it's insurance model, you have that data already. Now you're essentially connected to a central healthcare information exchange, the HIE as we call it. So yeah, that's been expanded. Has that helped you manage the pandemic in a different way because you have really accurate and real data? Has that helped you in any way, Dirk?
Yes, of course. I mean, it helped to link those data It's all more or less linked to our ID cards. So of course, all kind of testing being done, all the data we needed to respond to the pandemic. It's of course quite helpful, and it was almost done when the pandemic started. So it helped us a lot to of course oversee population, and in particular for us, when we started all the testing, but also of course for vaccination, is to identify the risk groups. And that was something where this was quite helpful, since, I mean, of course, we had the same issue like everybody around us. The number of tests was limited in the beginning. And of course, the same is if you think about a vaccination strategy, you can't vaccinate everybody in 2 days. So you need to have priorities. And that's something where those data can for sure help us also for the next step.
Yeah, I love that. I mean, look at this. You've got a national ID system. So you have that inbuilt. You have now a connected data system, database, or electronic health record. You can actually look at risk groups very quickly, isolate, move them around. And this is it's amazing. So I really like the whole model that you've created already. And hopefully other countries can learn more about how you've managed the pandemic and how we learn going forward. Let's go back further around the other roles that you have. And one thing I'm really impressed with Abu Dhabi is its role and its passion for innovation. So I'm going to leave that question open to you, Dirk. Talk about innovation as a whole in healthcare across Abu Dhabi, because I think it's fascinating.
Yes, I mean, the whole journey started some years ago when we realized that all the research we do ends with sometimes some of the amazing papers, but there was not really much output in terms of patients really benefiting from this. And since, of course, we are still quite a young country, we'll be having our 49th birthday in some days. So we thought about there is a need for government to enable certain things. I mean, we still believe innovation is something for private sector, for people coming in, aiming at earning money and doing things for passion. But still, as a government, we started to build an ecosystem for innovation. So we thought about what can government, in particular the healthcare regulator, do for innovation, and we really started to dedicate a small team, but still a very passionate team to work with innovators, to help innovators to land in Abu Dhabi, to link them to all our hospitals, all our corporate partners, and really prepare a landing platform for innovators in Abu Dhabi. And I mean,
Yeah, no, it's amazing. So I want to explore that a bit further with you. So I've been lucky enough to, of course, experience that firsthand with you. Tell us more about Hub 71 and its role in healthcare innovation.
Yeah, Hub 71 has been created as an ecosystem for innovators to come to Abu Dhabi. So it's not sector specific, but since we are present with a strong team in health tech is one of the main pillars. So what Hub 71 tried to do is to bring all resources together. So there is co-working space and everything, an infrastructure for startups to come. There are corporate partners around, and there are also access to venture capital funds who are part of this. So it's a big innovation hub managed by WeWork with all resources required. And as a Department of Health, we are the first government entity, the first regulator to move in 1.5 years ago already, in order to really provide startups with all they need in order to be successful in health tech. And sometimes when people ask me, so what are you doing? It's sometimes like a translation service between startup and innovator language and government. You know, sometimes there are two worlds clashing with each other without any productive result. And what we try to do is really, in terms of healthcare, is of course something highly regulated. So we try to support innovators with new business models to find a way to get reimbursed in Abu Dhabi, but also find a way to get a license and whatever is required in order to run a business. And yeah, that's something like a translator service, trying to align regulation and existing or new business models. And yeah, it has been quite successful, the number of innovators and startups being licensed in Abu Dhabi, working in the market. is continuously increasing.
Brilliant. And the fact that you've encouraged innovators to come into Abu Dhabi to be kind of this hub of creativity, and also to allow them to access the healthcare system, allow the regulations to be overcome, and then license to be approved. And I think that whole model is really attractive for a lot of the countries around the world. So you're, of course, intimately involved with the innovation part of it, of course. Can you give us an example of how many startups in healthcare have come to Abu Dhabi? What kind of startups, and perhaps examples of how many of those have been kind of translated into the clinical practice?
Yeah, I mean, they're, of course, very different kind of startups right now. I think we're talking about a number of around 50 startups being licensed in this ecosystem. Of course, I mean, you're talking to many more. The long list would be something like a lot more than 100. I mean, actually what happened during COVID-19, during the last month, of course, that there's certain people really benefited from the requirements. For example, all startups delivering remote care, which means, of course, telemedicine services, also IoT devices that would enable to record vital parameters from home. We have a lot of people who are doing some kind of risk assessment. For example, one of them even joined and partnered with our national airline, Etihad Airways. Now, if you go to their website, you can find the startup and risk management tool for the pre-boarding process. So all forces somehow aligned, and many people around mental health. I mean, we realized very soon that mental health is an issue in those pandemic days. So there are many startups who really shifted their business more towards mental health and mental well-being. And COVID-19 solves a variety of things. We have one similar to Uber with an application where you can book doctors to come home, all those different services.
So that's interesting. So COVID has driven some of the changes in what startups you need at the moment: telemedicine, remote care, Internet of Things, monitoring, I guess, remotely. And I love the fact that you're thinking about well-being and mental health. Mental health has always been a difficult one in the Middle East, of course, and parts of Asia. It has a different kind of connotation for a lot of people, right? So in the future, do you think some of these mental health apps or solutions are going to be amplified for the vast population in terms of mental health problems?
Yeah, of course. I think, I mean, we can discuss the rest of the day about what's the new normal, but for health, it's very clear. Like, I mean, your children will tell you, so why should I go back to school? Homeschooling is working perfectly fine, and we expect the same for our patients. I mean, right now we are just thinking about, so what kind of services and how will healthcare be delivered in future? And it's very clear that many of the services that have been introduced during the pandemic will continue, in particular those remote care things for mental health and others. And what we also realize in terms of mental health is the fact that there are not many applications in Arabic. So that's our market somehow. I mean, there are many things, of course, in English and other languages, but for the Arabic speaking population, things made in Abu Dhabi have a great potential of going across MENA region. And we're talking about 400 million people speaking Arabic around us. So that's, of course, one of the focus areas for us, people delivering things in bilingual, usually Arabic and English, but Arabic, of course, has a huge potential across the region.
And how have the patients responded to the pandemic and your innovation? You have a fairly young population, I think, in the Middle East generally, who are perhaps tech savvy, more digital literate. Has that helped you in the way that you're shaping healthcare in Abu Dhabi itself?
Yeah, I think so. I mean, of course, in March to May, June, many providers were just mandated to deliver services remotely. But I think a huge number of the population are very much keen on digital services. So I think it helped a lot, since at least everybody has a mobile, is used to doing e-government is one of the big things. So everybody is used to using the mobile for very, very many things. So I think it helped, of course. But still, of course, there are patients who love to go back to the healthcare facility as soon as they can. But in general, I think it helped.
I'm going to pause there for 1 second. Two things. One is my charge is not connected. I don't run out of charge. 1 second.
No problem.
Oh, because my dry. Start again. Okay, 3, 2, 1. So Dirk, you mentioned earlier about your, I guess, small snippets about research in Abu Dhabi. And I've seen that now that you're creating something new, or you're trying to expand your horizons or bring partners in. Can you tell us a bit about your kind of research, I guess, project or your future that you're trying to create in Abu Dhabi?
Yeah, of course. I mean, for us, first of all, research, translational research, innovation is very much connected. I mean, of course, when we started to think about our research strategy, the region was around 3 million population. The entire country is 10 million. So you think about, so what should you do? I mean, should you duplicate efforts from countries that have maybe 10 times the population or even more? And so for us, it was very clear. Of course, we have certain challenges, like a number of chronic diseases, diabetes, obesity, the number one. But what we thought about, what if we focus on research and fund research and promote research, we should focus on things that have a high probability of ending up with products and services that are useful for the population. So products, not gigabytes of papers. That was the first hypothesis we had. Let's try to, and doing that, of course, there's a need to closely link research and innovation. And of course, we are quite lucky to have big and international providers, as I already highlighted, like Cleveland Clinic, Mayo Clinic, with a number of really smart people who come here, do clinical work, but also to want to do something more, do research, do innovation, develop products. So for us, this is something that we really look at holistically. And yeah, my research colleague is sitting next door, so there's very much communication, and we try to really enable things, starting with clinical research but really getting products out of it very soon. So that's our philosophy of how we look at research and link it to innovation.
Well, I look forward to seeing how that develops, of course. And what I've also noticed about Abu Dhabi is the way they collaborate with other partners. They have this wonderful attitude saying, look, we need to bring other expertise in. Where do we go? How do we find that? And they're really good at reaching out and creating those collaborations. Can you tell us about some of the key partnerships that you've created for healthcare and also for your research?
Yeah. I mean, the first thing I think also to understand the history of the whole nation is that it was built through partnerships and through looking east and west in order to identify best practice, which is not only healthcare or health tech, but everything. So, and that's what we usually first of all do. And it was quite interesting for me as a European citizen to come here a few years ago and see, of course, Europe and US, but we also look at Singapore, at Korea, at Japan, and of course China as well. So that's one of the things. And for innovation, of course, for example, this Hub 71 is a joint venture between Mubadala, our sovereign wealth fund, as well as Microsoft and SoftBank. So again, an international place for people to come and expertise from different regions. For health tech, we, for example, partner with Plug and Play in an acceleration program in order to get access to international markets. We're happy to work with you, Shafi, as an advisor and supporter in terms of your networks and your expertise. And there are many, many more collaborations that help us to build an ecosystem, but also to look at best practice all over the world. That's one of the key success factors for the whole country, not only for health.
Yeah. They embrace it. I just think that's really refreshing to see. And we all have different ideas, bring skill sets in, I think is the right answer. What we've seen during the pandemic is an acceleration. We've seen people coming in up faster. You want to innovate rapidly, and also to relax the rules and regulations, but to collaborate widely. And so I think your model tends to work well from that perspective. But I'd take it just a few minutes to talk about the future, really. I know Abu Dhabi has a vision for the next 10, 20, 30, 40 years as part of its strategy. Can you share that with us, Dirk? Where you are in your timeline? What's that vision of Abu Dhabi look like over the course of a period of time?
Yeah, of course. I mean, the first thing is it's quite far away, but still tangible. Is the 100 years of United Arab Emirates in 71. So that's why we looking at Hub 71 and others. So of course the vision is ongoing. And I mean, for health as a healthcare system, we want to be among the best in the world. That's very clear in terms of quality, in terms of access to healthcare. And for health tech, of course, the vision for us is to give everybody access to innovation. So we want our patients to really enjoy the latest kind of therapies and everything. And at the same time, from a more economic point of view, of course, I mean, you're always talking about health as a cost factor, as a cost center. We think that there is a huge potential for health and health tech to be a contributor to GDP. So those are the things that are driving us. And as government, I mean, many things have been driven by government in the UAE that built the country. But of course, the more the private sector can take over, the better. So we consider ourselves as enablers for very many things. In the long run, hopefully the private partners will do much more than government would ever be able to do.
Yeah, I think you're right. The public partnership is quite important, crucial as we go forward. I'll ask you a question around education. Obviously, I was there, I think last year, and I saw your new medical school that was just being opened up. How are you going to be able to, in the future, ensure that you have the adequate education resources, the kind of the training required, and the level of experts within Abu Dhabi itself, rather than bring external people in? What's your plan for that, Dirk?
Yeah, so I mean, the whole country was built on education. I mean, the first thing the founders of this country did was really send people abroad to learn, to bring talent and capabilities back to the country to build it. Of course, now as a second step, it's important for us to have education and more educated people being educated in the country. So of course, we opened the second medical school in Abu Dhabi. And we're also aiming at getting much more UAE nationals, Emirati, in healthcare. I mean, right now the share of healthcare professionals from the citizens of the United Arab Emirates is quite relatively low. So we are of course working on increasing this, making healthcare more attractive to the UAE nationals. And part of it is of course having education here in the second medical school in the country or in Abu Dhabi. So that's one of the things. And again, in particular, the second one is so-called Khalifa University. They also have a strong focus on technology, which helps us a lot in innovation. So they have a technology innovation center, and now they opened a medical school. So there's a close link between two partners within the same university to really help us to develop things in healthcare and health tech.
So that sounds great. So it sounds though you thought about all of the various problems that you have in Abu Dhabi. You've gone about in a way that's strategic, that makes sense. You're collaborating, you're thinking about the future planning, you have a vision, of course, and of course, I think you're investing heavily into that future of healthcare. So look, Dirk, it's been a wonderful conversation with you. I just wanted to share what you are doing in Abu Dhabi, because we with this pandemic, we're learning we're a global community, and the way to go forward is to learn from a global community about what works, experiences, and shared common values. And I think you've been Abu Dhabi itself is, I think, an icon for a lot of us. I think that haven't seen it before, that what you're doing is actually very productive. Of course, can be challenges, resistance, and difficulties like healthcare around the world, but at least you're overcoming some of the hurdles by allowing innovation to flourish going forward. So with that, I'd like to thank you, Dirk, for spending a few minutes with us and share your experiences and that of the Middle East and Abu Dhabi in particular to a wider community amongst the Giant Health. So thank you so much for joining us.
Thank you. It was a pleasure to talk to you again, as usual. Thank you, Shafi.
Okay, so you to get that conversation in, because we covered a bit about the pandemic. We could add at that point.
I think that
I wanted to say,
Yeah.
what's one key success experience that you had during the pandemic? And then you can elaborate. Is that it?
Something
Okay.
like this.
So we'll record that again, guys, the next bit. So 3, 2, 1. So Dirk, so during the pandemic, can you just illustrate some of the successes or experiences that you had that allowed healthcare innovation to flourish?
Yes, of course. Or actually, what we realized and observed during this pandemic, of course, there's certain kind of business models of startups, innovators that became key, like all kind of remote care services that were all of a sudden required in April, March, and during the upcoming months. And all of a sudden, and that helped a lot, innovation became a CEO task and really a must. Before that, we realized, of course, everyone was interested in talking to startups, maybe they engaged with one or the other, but all of a sudden, CEOs realized there is no way to fight the pandemic with the conventional way and methods we had in the past. So they had to deliver remote services, telemedicine, and other things, all of a sudden from one day to the other. And this helped a lot, since this really was a key, CEO task all of a sudden, and then CEOs engaged with startups and pushed very much to get those solutions implemented. And all of a sudden, 6 months projects were done in 4 weeks, and so on. And a number of startups really benefited from this. And I think also as an impact for the long run, CEOs realize there is more than just the things they have done in the past. Is really also for the future. It's very helpful to engage with those people and to support innovation, to implement quickly in order to be fit for the future. And that was something, very supportive for many of our innovators, that they all of a sudden became key to fight the pandemic.
It's wonderful. What opportunity for the startups and for the whole system to accelerate the pace of change.
Hello and welcome to this year's Giant Health event. My name is Barry Shrier, and I'm very proud to be introducing you to some leading healthcare tech innovators from Alderhay Hospital, a leading NHS hospital in England. Once again, I'm the founder of Giant Health, and Giant is an acronym. Giant stands for Global Innovation and New Technology. We have been going for over 7 years, and we are a global community of nearly 200,000 people around the world. Our informal strapline is that Giant is a community of everybody whose business is healthcare, technology, and innovation. Our vision is to improve the health and the well-being of people around the world by facilitating the adoption of new technology in healthcare and supporting healthcare tech innovators. So that's what we're all about. And I'd like to say that one of the things that's a difference about Giant compared to the hundreds and hundreds of other healthcare shows, healthcare conferences, healthcare technology trade shows around the world, the main difference that makes Giant point out is the fact that we're about the people on the floor who are doing the innovation work. We're about the healthcare providers. We're about the hospital managers. We're not featuring government ministers who are talking about plans. We're not featuring management consultants who have advice. We're featuring the real healthcare providers, the real people who are leading hospital innovation and helping the world to showcase the best innovation and to identify the best new technologies which are available and to showcase the evidence that we have about what's working in the world of healthcare. So today I'm very, very pleased to invite you to join us. We have a half-hour fireside chat now with two very senior, very successful innovators in healthcare working for the Alderhay Hospital. We have Ian Hennessy. Hello, Ian. Good to see you.
Hi there.
And we have Nikki. Hi, Nikki Murdoch. Nice to see you. Thanks for joining us.
Hi there. Good to be here.
So what we're going to do is we're going to dive straight in to help our listeners really get to the heart of innovation. So Ian, if I can ask you first, give us an example of a big healthcare challenge that you guys have at your hospital. And can you tell us right away about an innovation that you guys have deployed recently and what has happened with that innovation?
And I'll talk about an area that's really close to my heart, and that's how do you plan an operation? So at the moment, well, before now, we'd be getting CT scans and it'd be quite difficult to interpret them. Could we use modern technology to actually make the planning process better? Could you make 3D visualizations? Could you make virtual reality worlds? Could you make 3D prints?
Yeah.
And we found that actually making 3D prints is great for surgeons because we're really tactile people. We like to touch things, like to hold things, and we can make 3D prints of the patient's anatomy to allow us to visualize what we're going to do before we actually do it.
Mm-hmm.
And this was a real revelation for us about 5 years ago when we first started this, and when 3D printing technology was really quite basic.
Yes.
But now with these multimodal printers, the resolution of them, you can create these beautiful 3D prints, which allow you to really get a feel for what you're going to encounter when you operate before you get there. And that allows you to do faster operations, more precise operations, operations which you've got more chance of getting it right first time. And it's great to see how the evidence base is starting to emerge from this, about the reduction in operative times, about how people can conceptualize things better, even at the stage. So for me, 3D printing has been, and 3D visualization and that immersive health agenda has been really one of the standout things the last few years.
Excellent. That's a fabulous example, 3D printing. And so, Nikki, if you can participate in this call as well, please. From your perspective, tell us what some of your own challenges have been recently, and what's a good example of a tech innovation challenge that you've been working on, and how is that playing out?
Well, I think, one of the big challenges for us in healthcare is that when we're working with healthcare professionals, they've got a very different culture from the innovation culture.
Right.
And that can be a real stumbling block because, if I said to you as a clinician, well, yeah, you've given me an idea for an operation, go and have a try and see what happens. And if it fails, we'll have a big celebration. And if it goes right, we'll have a big celebration as well.
Right.
Your clinicians would say, well, hold on a minute, Nikki, you're in the wrong job. And I think that's sort of, we train our staff to be perfectionists because we want them to be, every time you get an operation, you want that high reliability, don't you? That you're going to get the same result for every procedure.
Mm-hmm.
And that isn't how we innovate. There's a very strong sort of culture of, well, we will try. And we know that if we try 100 things, well, 96 will not get there, but that's okay.
Yes.
So it's how we get across that culture to people that, look, we're putting up some ideas. Don't just say no and discount them out of hand. Have a think about them and actually talk about, well, yeah, maybe we should try that, but we've got to be open with our patients and say, we're trying something, we'd like you to be involved in that and see how it goes.
Yes.
So for me, as a leader in the hospital, what I'm trying to do is get people to think outside the box and consider new ways of doing things. So I've been talking to people about shared medical appointments, which in some parts of the world have been going really well. But, it's getting across that barrier that might be a way for us to work with patients, because it would provide more access more quickly for patients, but also because it would allow patients to support each other.
Yes, that's a very interesting innovation, and we'd love to hear a little bit about more of that later on in the conversation. Thank you for sharing that. And so going back to you, Ian, if you can tell us very briefly, what is your role? What is your day job, so to speak? And also tell us about what Nikki just mentioned. This is very interesting. So of course, there's the famous Silicon Valley mantra, which is work fast, break things, and move on. And naturally in tech innovation, that can be considered to be an appropriate approach. But I'm assuming that in healthcare, the concept of working fast and breaking things and experimenting and moving on doesn't necessarily fit. So like I said, Ian, number one, tell us a little bit about you and your background briefly, and also about this challenge. Perhaps it is the difference between, of course, the priorities of a clinician on the one hand, and the priorities of people working in tech innovation on the other.
Yeah, so I've got a 50-50 job split, basically. Half of it, I'm the clinical director of innovation.
Right.
My job is to try and break down these barriers, find new ideas from other parts of the world, bring them in other industries. The other half of my job is I am a surgeon. So this morning I was operating, and on the weekend I was on call. And that's the way my job is split. And it's really interesting because my mind is split down two ways. Because when I'm a clinician and when I'm operating, I'm risk averse. I'm using tried and tested techniques, which are the correct things to be doing.
Yes.
But when I'm innovating, I'm in that kind of, let's try and come up with a new technique. Let's try and do something new, something different.
Mm.
And you've got to use it appropriately, because obviously you cannot move fast and break things when you're dealing with children's lives. That is not
yes, exactly.
anyone would say is a good idea. But at the same time, we have to move forward, and we have to update the way that we practice medicine. Otherwise, we'll still be bleeding people and applying leeches to people and doing all sorts of crazy things.
Yes.
So trying to get that balance right is absolutely critical. And one of the key things, I think, is doing what's been created at this hospital is creating environments which are de-risked. For instance, simulated environments or areas where you're just thinking through a new idea. You're not necessarily doing it. You're just thinking, what if we tried this?
Yes.
And that produces the kernel, the start of a potential idea, which could then, with all the correct safety measures, be instituted into care. But you've got to have that initial bit of, right, what if we try something else? What if we try something different? And that's so critical. And it's why it's so important to have leaders in the hospital who are willing to encourage that type of thinking.
Yes, yes, absolutely. Well, that's very helpful. Thanks for that explanation. And so, Nikki, what Ian just mentioned, of course, I think is fundamental. So tell us, please, a little bit about your background and your current role, and any more examples about this challenge of managing between the requirement of innovation to get out there and take risks and do new, different things on the one hand, and the obvious requirement for clinicians to be cautious and to work on an evidence-based basis and this type of thing.
Yeah, thank you. So I'm the medical director of Alder Hey, and so that means I've got responsibility for oversight of clinical governance, professional issues, clinical services.
Right.
And I've been at Alder Hey for a couple of years now. Came from Australia. I've been working in Australia for nearly 20 years. I'm a paediatrician by background, and so a GP. But in Australia, you can actually train to be a medical administrator. So I did that training, and now I'm using that here. Right. I think what Ian said about risk is really interesting, because I think my job is to facilitate people to take those risks and to show them that, yeah, we understand that we're taking a risk here, and what we're doing is making sure that risk is being taken as safely as possible.
Yes.
I see my job as presenting to people ideas and the art of the possible, and then supporting them to explore those ideas. Yes. So we've just been going through the pandemic, and that's been a very interesting time. One of the things that the pandemic did was it took aside a lot of barriers to the way we work, which was fantastic.
Okay.
How are we going to keep that going? We're working on that. But a couple of months ago, we held a workshop when we talked to people about the different things that are happening. So my job, I feel, is almost to say to people, hey, have you looked at this? Could this work for you? So, you know, in other parts of the world, we've got people taking retinal photographs and then, doing that remotely, taking a van up into the middle of northern Australia, taking retinal photography, and then bringing it back and showing it to the ophthalmologist who can assess it without actually leaving the town. Wow. And so we talked about things like that, about digital otoscopy, so that could we start having GPs looking in children's ears, capturing the images and sending it back to ENT surgeons who then can see those children remotely. We've done a lot of work around video health, and that's been really successful. We've turned a lot of our face-to-face into video, because we've got Liverpool was actually a hotspot for COVID. So I think trying to show people and then support them, because I think sometimes doing things differently can be really difficult, and you need someone underneath you who's going to help you with time, with resources, with personnel, and a bit of money to get that going. So that's how I see my job. I mean, I do have ideas myself. So Ian has kindly helping me get in touch with some people about 3D printing, because I'm interested in 4D printing, which is where you can print something and then it alters when you apply something to it, whether that be a magnetic force or heat, or a different acidic environment, and really interested in that. And we get a bit more involved in the hands-on stuff there.
Excellent. No, that's very interesting. I haven't heard of 4D printing before, so great to hear and learn something new right away.
Oh yeah, yeah.
Ian, tell us a little bit about the background, please. We've heard that your day job is as a pediatric surgeon, if I understand correctly, but you're also the founder of what you call it, the NHS Hospital Innovation Hub. Tell us about that, please, and what were some of the challenges you experienced getting that off of the ground?
Yeah, that was just a very happy chain of events, really. Yeah, getting to the innovation hub we have here at Alderhay. So behind me here, this is the main atrium for Alderhay Children's Hospital. That is a big treehouse.
Wow.
People have described it as a boutique Norwegian airport. But the idea is that it's meant to be friendly and welcome and inviting. And this was built in 2015.
Wow.
This is really the catalyst for, I think, the innovation agenda at Alderhay, because we had a big disruption. We were moving from an old Victorian hospital, an old designed as a workhouse, with a pediatric wing attached to it for the sick Victorian children.
Yes.
This state-of-the-art spaceship-like, one of the most advanced hospitals in the country. And I was a trainee at the time, and I didn't have a job. I had enough money for a half-time clinical job, someone to make the technology in the hospital great and really geeky and techy, and they're like, oh, love that. Get you.
Sure.
And it built from there. And it was fascinating because we got one company on board, and we learned how to speak to companies, and we learned how to work with companies.
Yeah.
And all of a sudden, all the other companies wanted to work with us.
Oh, wow.
We
Nice.
Get a bit of a move. Some really big companies as well. I still remember some of the initial meetings. I was like, oh my goodness, we're gonna have to find a lot of people to match up in these meetings. But that brought resource, and it brought profile, and it attracted more people into this burgeoning innovation, because we had this new hospital. We had to do things differently. We had to change. And it started to build from one person and an assistant to some more clinical people to, I think now there's 22 people working in our innovation hub. We have 1,000 square meters of space deep underneath the hospital. It's like, the nickname is the Bat Cave. Where we check out all the new types of technology, and we do all our co-creation down there, and we work with partners in academia to imagine what could be and then try to build it.
Right. That's excellent. It's such a great success story. And tell us a little bit more, Ian, very briefly about Alderhay itself, in case any of our visitors, for example, from overseas are not aware of the group.
So Alderhay Children's Hospital is a very special place. It's in the outskirts of Liverpool. We've been going since 1912, and we've been looking after all the children in Liverpool since 1912. And it feels like a bit of a force field over the city, because every single person in Liverpool has either had a niece or a nephew or a child or even themselves treated here at some point, because it's got such an old and rich history.
Right.
And we do everything. So if you fall over and scrape your knee and come to our knee department, we look after you. You need to have heart surgery and super specialist cancer care, you come to Alderhay. We do the whole shebang, So it's quite nice to have such a defined geographical area, to have the history of it. And also, we've got all the feeder hospitals as well from all the northwest of England and beyond. I think actually we've taken someone from almost every postcode in the country for our specialty care.
Yeah.
So it's a lovely place to work, and it's got a really nice history to it as well, which is the icing on the cake is this new hospital, really.
Yes, exactly. I mean, it's such a great success, the Innovation Hub that you guys have put together, and we're extremely proud to be working with you to champion that. So, Nikki, very briefly, with your background in mind as a clinician and your international experiences, and of course the successful work you're doing driving innovation at Alderhay right now, what's your message to other people in other hospitals, not only here in the UK and in Europe, but around the world? What would you say are some of the challenges that you guys are confronting and successfully learning about how to address? And when other hospitals around the world have the shared ambition of adopting innovation and taking steps ambitiously to improve, what would you like to advise them about from your own experiences?
Well, I think one of the things I would say, and I think, Barry, you and I are testament to this, is that don't expect that innovation is just going to come from the younger staff in your organisation.
Oh, okay.
You know, it can be from the older people. You might find that the older people in the organisation are the early adopters. So
yes,
up into them as well.
Mm-hmm.
You know, because it's easy to create a job. So a new job like Ian got, which brought him in, and he was innovating. But look at your older people as well, because they've got ideas. I think involve your patient group. So for us, that's children and young people, but
yes,
really involve them and watch that innovation permeate throughout the whole organisation. So for instance, on Wednesday night, we held our annual general meeting. The financial report was presented by the children. And it's just, it made it come to life, because if they could understand it, it meant that everyone else could. And they have a very different take on it, and, you know, different idea of how the money should be spent. So it's really, it enriches the whole organisation if you can get innovation embedded. It's not just about your clinicians, it's also about your non-clinicians. And it needs, I think it needs some, you really need some infrastructure to help with that innovation, because innovation, remember, it's portrayed as that light bulb moment, but actually, you know, there's a way of creating innovation and how to foster how people develop ideas, and that takes time. I think Ian would say this hospital's been open for about 5 years now, and you can really see that in the last year or so, it's really starting to fly.
Excellent.
As far as innovation is concerned. So think of it as a long-term thing. Don't think of it as, well, we haven't had any light bulb moments this year, so let's shut it all down. It isn't like that.
Excellent. Nikki, that's very, very helpful and extremely informative. What's that phrase? Overnight success comes after 20 years of extremely hard work.
Yeah, that's right. That's
but
right.
I love the I love the idea of the children presenting the financial report. Does that mean that ice cream is served 7 times a day now in the hospital or something like this?
Well, we do actually have ice cream in the hospital. We actually have our own chef on every ward, because that helps the children, you know, they can have what they want to eat when they want to eat it and so on. So that's another innovation that we've put in. Reduces waste as well. Means the children actually eat because they're not being presented with something that somebody else ordered yesterday.
Yes.
You know, there's innovation in every single step. And when I came here for my interview, the thing that really struck me is that the design of the hospital is very innovative, because you walk in and you don't see ill children anywhere. So I think that creates a fantastic environment for the children who have to come to hospital very frequently. They don't feel they're coming to a horrible place, because we move children from the emergency department to theatre and back to the surgical ward or the intensive care unit. That's all been designed so that it happens away from the main atrium. So that, you know, the children said, we don't want this hospital to look like a hospital. We want it to feel like an airport. And it does, because they helped design it. Again, they were part of the design process. I should be careful. I might lose my job soon. There'll be one of them being medical director.
No, but this is very informative and really worthwhile information. This theme of inclusion that you've mentioned is clearly a cornerstone for the successful identification and implementation of innovation. So it's good to hear about these successful case studies. Ian, we have about 5 minutes now. So between you and Nikki, if that's okay, we'll do a little bit of a wrapping up. But I wanted to ask you about the future. And do you guys have a clear vision which you like to enunciate? Or if not, do you want to tell us a little more about what your personal vision is for the future of innovation at Alder Hey?
Yeah, well, I think between the two of us, we can definitely tell you where we're going, especially because I'm looking at our main strategy on the wall behind Nikki's head. But I think personally, one of the big drivers behind this is that this is a hospital that's still full of sick children, and I would like that not to be the case. I think is the long and short. And what is going to be the change? The change is going to be technology. Because that's the thing which is accelerating. That's what's accelerating at an exponential rate at the moment in the rest of the world. Because, you know, as doctors, we're not getting any better. You know, our brains aren't getting upgraded, our hands aren't getting, you know, I'm not developing a third arm or anything like that. So the way that we're going to, you know, that might be technology in itself. But, you know, but I mean, realistically though, I was looking at robotic platforms for surgery where you just have a third arm. You know, I mean, so that is, for me, technology is the key to how we sort the problem of having sick children, which is something I think that most people would agree we should try to avoid.
Of course.
Now, the actual strategy for how we're going to, because that's a big aim, is like, how do we break it down? You know, how do we, you know, look at all these different problems and decide what we're going to fix? And the two key things that we lifted out for using technology to enable care at Alder Hey was being Alder Hey anywhere. Doesn't matter where you are, we can be there. We can affect care. We can find out if you're well or unwell. Now, that's not just telemedicine. That goes right down to people's data, looking at patterns, where they live, how they're getting on at school. You know, there's a thousand different ways which we could both find out about people and also be able to deliver care. So there's Alder Hey anywhere. And then the next thing is the world's safest hospital and safety.
Right.
Now, technology has got risks, but it's also got the ability to reduce risk as well.
Sure.
I mean, humans are amazing. You know, they are great at creative work, and they can synthesize data, and they have insights, but sometimes we miss things. And the mistake that is made because you missed something, or you didn't take something into account, or it was there all along and you never saw it.
Yes.
That is the worst mistake, you know, as you know, for everyone, you know, because people are like, how could you have missed the fact that they were on that drug, and that drug doesn't go with that drug? And it's just, whereas if you have, you know, if you're doing like an emergency operation and you've got two very difficult options, and you go for one option rather than the other option, but it was a heat at the moment and you're trying your very best, it wasn't an omission. It almost seems like a mistake, which is, you know, more tolerable. But
yes, understood.
Technology has the ability to revolutionize safety, I think. So those are the two key things that we're driving at the moment from our technology strategy. That said, as you know, I love innovation, and I very often get distracted, as Nikki will more often than not say, and sometimes I'll head off chasing some fancy bit of kit. But I'll pass on to Nikki now from the hospital.
Well, that's very helpful. Ian, thank you very much. And it's great to hear, like I said, these absolutely practical, real-world experiences directly from people who are delivering healthcare and who equally have a very impressive commitment to innovation. So really, really appreciate what you're saying, and I think it's very valuable. Nikki, on those lines, let's say, for example, if I'm an innovator, if I have a new healthcare widget that I have invented, or I have some ideas, what challenges do I have? Is there a front door to your hospital called Innovators Welcome, or who do I telephone?
Well, there is. There absolutely is. So we've got the Innovation Hub, and each our trust is divided up into divisions. So we've got a division for medicine, surgery, community, and research.
Right.
And each of those divisions has got a partner, an innovation partner.
Right.
So that's someone who's a skilled in the development of innovation and the support, and they're your go-to point, and go and speak to them and say, hey, I've got this idea, can you help me tease it out and get it to a point where I can then start to look at it more seriously. So that's how we promote innovation. We also have you know, we showcase the innovations that we do and have innovation sort of seminars and tutorials and so on throughout the organization, so that gets people to understand what's going on and see if they want to join in.
Excellent.
Yeah, I would say also, I mean, I really want to make a point. So you asked us what our strategy is. I mean, our vision, our vision is, you know, it's great health for all children and young people. And one of the things that I think that we all need to be aware of is collaboration. And about a year ago, we changed the name of one of our programs. So we do a lot of outreach, and we used to call it Alder Hey at. So it might be Alder Hey at your hospital. And then we realized that maybe wasn't collaborative, really. And we've changed it to Alder Hey with. And just changing that one word from at to with has had an enormous effect on our relationship with the hospitals around us, that we really struggled to engage with. But now they're saying, well, you're working with us, you're not telling us what to do. And it's resulted in a partnership with a local hospital where we're using immersive technology for ward rounds, and we're
Right.
helping them set that up, because they have a lot of their staff are of Black and ethnic minority groups,
Right.
and they're also in an area where they really are one of the hottest spots for COVID in the country. So now we're helping them do virtual ward rounds so that their staff are safe but can continue to work and provide care. And I think that's because we've said with, not at. So
Yes.
I think collaboration really, really important.
Yes. Nikki, thank you for adding that. I mean, clearly the theme of buy-in, so to speak, is unbelievably important for collaboration. And
Yeah.
it's exciting to hear how you guys are even innovative in your use of language, and you're open to changing your use of language from
Yep.
Alder Hey at to Alder Hey with. And very, very gratifying to hear about the openness that you guys have, as well as the results of this collaborative spirit. So that's very, very good news. And I love case studies like that. And I'm certain all of our listeners from around the world will find that very interesting. So I hope you don't mind, but unfortunately, we're going to have to wrap up now. To be honest with you, I'd love to continue this conversation over a
Yes.
pint of Guinness with you for about the next 2 hours, but I think we'll have to wait until the pandemic is over. But on behalf of everybody at the Giant team, and quite literally on behalf of everybody who is participating in the Giant Health event this year, as you know, we're a global community. We're nearly 200,000 people around the world. Our informal strapline is everybody whose business is healthcare tech innovation. I'm sure that I can say on behalf of everybody a very, very large and grateful thank you to Ian, and thank you to Nikki. Really glad to have you guys on board. We value your time. For me personally, this has been an extremely interesting and informative conversation. I've already learned about 4D printing, so I've got a new bit to my vocabulary. And I'm also glad to hear that people who are in their 80s and 90s, like myself, are still respected and can be considered to be worthwhile and able to make a contribution alongside all the young people who are using TikTok and Snapchat and all those other innovations. So Nikki, thank you very much. Really, really good to see you, and great to have you on our show. And likewise, Ian, and congratulations to both of you. We're very proud of the innovations that you guys are doing, and we're very, very proud to have the privilege of championing the Alder Hey Hospital Innovation Hub. So thank you for that.
Thanks very much.
Good luck with everything.
Thank you.
Thank you.